Good evening and a warm welcome to everyone. On behalf of Ayurveda, I am delighted to welcome all our respected panel members, distinguished teachers, researchers, practitioners, and dear students to the first day of the Niramaya 2026 National Seminar Paper and Poster Presentation. Today marks the beginning of another inspiring chapter in Ayurvada's journey of promoting academic excellence, research, and scientific communication in Ayurveda. As we all know, the growth and advancement of Ayurvedic science depend upon the collective efforts, innovative ideas, and dedicated contributions of academicians, clinicians, researchers, and students across the country. Niramaya has been envisioned as a platform that encourages every participant to bring forward their knowledge, creativity, and research potential. Through paper and poster presentations, this seminar provides an opportunity to share ideas, exchange perspective, and contribute meaningful to the development and global recognition of Ayurveda. At this moment, I would like to express our sincere gratitude to the principals, professors, and students from various Ayurvedic colleges who have supported this initiative and contributed to its success. Your encouragement and active participation have made this event possible. I would also like to extend our heartfelt appreciation to our esteemed panel members. Their valuable time, expert guidance, and continuous efforts in reviewing presentations, identifying areas for improvement, and maintaining academic standards have played a crucial role in ensuring the quality and successful of this program. We are truly grateful for their dedication and commitment. Before we proceed, let us take a brief look at the remarkable journey of Ayurveda. Over the years, Ayurveda has successfully organized several national and international academic programs, creating opportunities for learning, collaboration, and professional growth. Niramaya 2026 is another milestone in this continuing journey. We also remember and acknowledge the many doctors, teachers, researchers, and team members whose dedication and hard work have contributed to the success of every program conducted by Ayurveda. Their efforts continue to inspire us as we move forward. Once again, I warmly welcome all our respected panel members, faculty members, participants, and students to the prestigious academic gathering. As we have an exciting schedule ahead, without further delay, let us begin today's scientific sessions and move on to our first presentation. Thank you, and I wish everyone a productive and enriching seminar experience. Without much delay, we go to the first presentation. I would like to invite Dr. Niharika Deka for the paper presentation on the topic Ayurvedic Adaptogens Scientific Perspective on Rasayana Herbs.
Respected chairperson and fellow participants, I am Dr. Niharika, second year postgraduate scholar from the Department of Dragheguna, Shri Shri College of Ayurvedic Science and Research, Bangalore. Today I am presenting my seminar on the topic of Ayurvedic adaptogens and its scientific perspective on Rasayana herbs. In this presentation, I'll briefly discuss the concept of adaptogens and Rasayana, major Ayurvedic adaptogenic herbs and their mechanism of action and scientific evidence and future scopes. Adaptogens are natural substances that help the body to adapt physical, chemical, and biological stressors. Their main role is to maintain homeostasis, meaning maintaining internal balance within the body. In today's modern lifestyle, people are continuously exposed to stress due to workload, poor sleep, anxiety, unhealthy diet, and sedentary habits. Long-term stress negatively affects immunity, cognition, mental health, and overall well-being. Stress-related disorders such as anxiety, depression, insomnia, hypertension, and diabetes are increasingly globally. According to WHO, nearly 1 in 8 people worldwide are affected by mental disorders associated with stress and anxiety. Because of this increased burden, there is a growing interest in safer and natural stress modulating agents like adaptogens. In Ayurveda, the concept closer to adaptogen is Rasayana therapy. Prakasha explains that Rasayana promotes longevity, memory, intelligence, strength, and delays aging. The word Rasayana refers to the therapies that nourishes the body and improve overall vitality. Similarly, modern adaptogens are substances that increase resistance to stress, normalize body functions, and maintain physiological balance. Therefore, Rasayana herbs can be correlated with modern adaptogens because both provide resilience and help body cope with stress. Several Ayurvedic herbs possesses adaptogenic activity. Among them, major herbs include Ashwagandha, Tulsi, Guduchi, and Yashtimadhu. Ashwagandha contains bithanolides and shows anti-stress and neuroprotective activity. Tulsi contains eugenol, exhibits antioxidant and anti-stress properties. Guduchi contains stenosporin and mainly acts as immunomodulator. Yashtimadhu contains glycyrrhizin and shows neuroprotective and antioxidant effect. Among these herbs, Ashwagandha is one of the most extensively studied adaptogens. Ashwagandha, scientifically known as Withenia somnifera, is one of the most important Rasayana drugs in Ayurveda. Its major active constituent includes vitiferin A, withanolides, alkaloids, and saponin. Scientifically, ashwagandha mainly acts through the regulation to the HPA axis, which is involved in stress response. During stress, the body releases stress hormones like cortisols and corticosterone. Ashwagandha helps reduce the stress hormones and improve stress tolerance. It also enhances antioxidant defense mechanism and protects against oxidative stress. Clinically, ashwagandha is widely used in stress management, anxiety, fatigue, sleep disturbances, and cognitive support. Ruchi, also known as Amrita, is an important immunomodulatory Rasayana herb. It enhances both humoral and cell-mediated immunity and reduces inflammatory cytokines. Tulsi possesses strong antioxidant and anti-stress activity. It helps reduce cortisol levels, improves physiological resilience through the stress. Yashtimadhu shows neuroprotective and antioxidant effects and protects against stress-induced oxidative damage. Together, these herbs demonstrate significant adaptogenic and protective potential. This slide explains how adaptogenic herbs work. Normally, during stress, the brain activates the HPA axis, that is hypothalamus pituitary gland and adrenal gland pathway. This leads to release of stress hormones like cortisol. When stress becomes chronic, excess cortisols can cause oxidative stress, immune suppression, fatigue, anxiety, and metabolic imbalance. Adaptogenic herbs help regulate this stress pathway by modulating the HPA axis and reducing excessive cortisol release. Then also they also improve antioxidant defense and possesses immunomodulatory activity. Overall, adaptogens improve stress tolerance and maintain physiological homeostasis. Scientific evidence and research gap. Various animal and preclinical studies have demonstrated Ayurvedic adaptogens reduce stress hormones, improve antioxidant levels, and enhance immunity and improve cognition and endurance. These findings are scientifically validate many traditional Ayurvedic claims regarding Rasayana herbs. However, certain research gaps still exist. There is a lack of standardized protocols and long-term safety studies, dose optimization, and sufficient clinical trials. Therefore, more evidence and mechanistic research is needed for the wider clinical application. To conclude, Ayurvedic Rasayana herbs possesses significant adaptogenic potentials. Herbs such as ashwagandha, guduchi, tulsi, and yashtimadhu demonstrates anti-stress, antioxidant, and neuroprotective and immunomodulatory activities. Scientific evidence increasingly supports these traditional Ayurveda concepts. Thus, Ayurvedic adaptogens successfully bridge ancient Rasayana wisdom with modern stress science and may play an important role in future integrative healthcare. The references, and thank you so much for the opportunity.
Thank you, Dr. Niharika. Thank you for the well explained presentation. Next, I would like to invite Dr. Greeshma MS from the Pankaja Kasturi Ayurveda Medical College on the topic Sareera Kriya Functional Framework of Health and Illness in Ayurveda. I would like to invite Dr. Greeshma MS.
Concept of Sharira Kriya, it is important to understand the meaning of word frame. Framework refers to the basic supportive structure that holds and organizes a complex system. This is the framework of a building that gives support and stability for that building. In Ayurveda, the functional framework of body is explained through the coordinated integration of dosha, dhatu, and ala. Along with this, Agni and Strovus also plays an important role in this to maintain the normal physiological activities of the body. Sharirendriya, Sattva, Samyoga, Darijil, that which indicates the human body is not merely a structural entity but a dynamic functional system. Further, classical text explains the body is fundamentally sustained by dosha, dhatu, and mala. Thus, dosha, dhatu, mala, moolam ki sharira. Just as building, which depends on the structural framework for stability, the human body also depends on the functional framework, which is explained this sharira. It is necessary to experience or necessary to know more about this, then only we can attain swasthya, or its imbalance, which will lead to vyadhi. It should be understood only through this. We are looking to how being a healthy person. That according to Acharya Sushruta, Samadosha Samanija Samadhatu Malapriya Prasanna Atma Indriyam Swastha activate. A person is considered to be healthy when the doshas are imbalanced, Agni functions properly, and dhadus are in its equilibrium, milas are properly excreted, souls, along with the soul senses, minds are happy, then it will be considered as a person is in its swastha avastha. Otherwise, the person is considered to be in stroga avastha. Pitta Kapha Shedi, Trayodosha Samas, the Pitta and Kapha, which is considered as the fundamental functional framework of the body. Vada, which is responsible for the movement and nervous regulation. Pitta, which is responsible for digestion, metabolism, and transformation. Kapha, which is responsible for stability, lubrication, and structure. Not only this Sharirika dosha, Manasika doshas also plays an important role in the Swasthavastha. That is Tamasya, Manso, dosha, Mudapala. The mental balance and the psychological health is also important for maintaining a swastha. If any imbalance in this, which will lead to be Roga Avastha. In Prakrita Avastha, Panchavada, Panchapitta, and Panchakapha have its own functions, and they will maintain the homeostasis of the body. It's Uchvasa, Nishvasa, Cheshta, everything is done by the Prakrita steps. The Oshas, in Vada, we all know that there are Panchavadas, Prana, Udana, Avyana, Samana, and Apana. In Prana, that is Murda, Samana means Samvedasta. In Samana, which helps toward the digestion, Murastana, Udana, so Udana helps for respiration. Every Vada and every Pitta, every Kava has its property. So it is important to maintain not only doshas, but the others also have its own functions in our Prinanam, Jivanam, Levo, Snehu, Dharana, Purana, Garbo, Padhanam, Dadunam, Shreshta, Karmatra, that means from a minor thing to its major complexity of the body, it's Dhatus mainly an important role for this. Thus, Dhatu also plays an important role in the function of the Dhatu, which is a structural component of the body. Then, nourishment, sustaining life, supporting the structure, reproduction, everything is under the control of this Dhatu. Thus, dosha and Dhatu, which is important, same as that of other like Agni, shoulders, everything. Malas are the waste product of metabolism. Purusha, which is considered as feces, Mutra, Sweda. So it is important for a healthy life to excrete this in a proper way. So removal of metabolic waste and maintaining fluid balance and regulation of body temperature, these are done by these malas. So thus proper elimination of malas is essential for maintaining a physiological balance and detoxification. Thus, as a physician or as a doctor, it is important to assess whether not only the doshas and the abuse of avastha, it's also malas, how is it properly evacuating everything. Not only doshas, dhadus, and malas, Agni also plays an important role in maintaining the healthy lifestyle. So it only when the Agni, which is in Prakrita avastha, or it is maintained properly, Ayurveda, Varma, Swastha, Utsaha, Dachayu, Prabha. These are the karmas which is done by the Agni, which is in Prakrita avastha. Thus, Agni should be maintained in the Prakrita avastha for the proper functioning of dosha, dhatu, and mala. Thus, Rogam Ado Parishetadhanandaram Dosha. So for a rog, it's important to find out the Vaidya Avastha Dosha, Dhatu Pala, along with the need for the proper administration of medicine and the proper uh, uh, and for a proper result. Thus, a physician should understand these factors for his proper chikitsa. Ayurveda does not consider only physical health; mental and spiritual health are equally important. Lakshman Manaso Jnanasya Bhavam Neeraj. Mind, which controls the perception and cognition. Proper cognition of Atma, Indriya, Mana leads to the clarity of knowledge. This state is called Prasanna Atma Indriya Manaha, which is also important for maintaining the swastha avastha of the person. For the proper functioning of these doshas, dhadus, and manas, the sources should be within its proper avastha. So then Srodasa Madhu Parinama Apathya it acts as a way for carrying this or maintaining this in its proper condition. Thus, Srodasa also plays an important role in the maintaining of proper homeostasis or a physical dynamic of the body. The rogas, which is occurring due to Adipravata, Sangha, everything is because of any vishesham in this rogas. Thus, any vishesham in rogas also relate to the disease formation. Thus, maintaining the rogas in its proper normal avastha is essential for maintaining the swastha. Robusta dosha vaishamyam dosha samya aroga. From it is clear that when is dosha in its vaishamyam state will lead to the roga, and it is in samya state will lead to roga. And also, sarva rogo sarva abhimandanya, which mandanya every disease is occurring. Like that, so it is essential to maintain the doshas, dhatus, malas along with the agni, and also shrodas should be in its proper avastha. Adi pravati sangha, grandha, Lakshanas, which is occurred while there is visheshana. Also, proper maintaining the slope is also important for maintaining the healthy state. While the avastha represent the disturbed state of dosha, dhatu, mala, and agni, which will lead to the pathological changes in the body. Understanding this concept is essential for identifying this disease progression and applying appropriate Ayurvedic therapeutic measures to restore the physiological equilibrium of the body. Human body is maintained through the balanced interaction of dosha, dhatu, mala, and agni. These components, which regulates the metabolism, tissue nourishment, waste elimination, and physiological stability. Therefore, understanding Sareera Kriya is essential for diagnosing, prevention of disease, and planning treatment. Thank you.
Thank you, Dr. Grishma. Thank you for the insightful presentation. Next, I would like to invite Dr. Dhanashree Prakash Rathod from Yeshwantrao Chavan Ayurveda Medical College on the topic a case study and Ayurvedic management of Urdhwaga Amlapitta with special reference to hyperacidity.
Hello everyone, myself Dr. Dhanashree Rathod, MD Kaichikisa scholar. Today I am going to introduce a case study on Ayurvedic management of Urdhwaga Amlapitta with special reference to hyperacidity. Introduction. That is, what is Amlapitta? That Acharya Vakpat described that Roga Sarvapi Mandagni. That is, all diseases are caused by the Mandagni. In Ayurveda, the main cause of disease is Mandagni. Amlapitta is very common disease and it found in about 80% of people, and this disease is caused due to inappropriate dietary habit. Present lifestyle has been sedentary and lack of physical activity. Unhealthy food habits have led to many GI diseases. Nowadays, mostly young people are being diagnosed with Amlapitta. Ayurveda states that Amlapitta is due to Samapitta, an increase in Ama, Dravya, Ushna, Guna of Pitta. It is said that eating and fasting during indigestion lead to acidity, heartburn, gastritis, which is referred as Amlapitta. Now I present the case, that is 40-year male came with complaint of avipaka, klama, rullas, हस्तपाद चिंचिमायन कंठदाह अरुचि परिदाह अम्लोदगार क्षुधामांद्य आत्मान दौर्बल्य since 1 year, and there is no any past history, any medical history or any surgical illness history. On examination, pulse rate was 80%, 80 beats per minute. BP was normal, that is 130 by 80. respiratory sound bilaterally clear. So SpO2 is also 98%, and heart sound, that cardiovascular sound is S1 and S2 is also normal. The central nervous system is conscious and oriented, and per abdominal examination, that is soft and non-tender. अष्टविध परीक्षा नाडी was पित्तज and कफज. पित्त कफज, मल सम्यक, मूत्र सम्यक, जीवा साम, निदान पंचक, that is हेतु. आहारज हेतु was अति कटु ahar, that is spicy, ati amla ahar, akala bhojan, and adhesion. Bihar, that is ratro jagran, diva sopna. Samprapti. Now we look at how the samprapti is, how the disease is going to how diseases occur, that is hetu sevan. Then it leads to tridosh prakopa, then agni mandya, anna vidagda, pitta prakopa, and then amadravya gun predominance, and that is leads to amlapitta. संप्राप्ति घटक, that is dosha, पित्त प्रधान कफ अनुबंधी, दुष्य रसदुष्टि, स्त्रोतदुष्टि अन्नवह, पुरीश्वह, and रसवह स्रोतस. व्याधि अवस्था, that is साम अवस्था, दोष उद्भवते, साध्य साध्यत्व कष्टसाध्य, व्याधि मार्ग अभ्यंतर मार्ग, व्याधि निदान उद्वग आम्लपित्त, सामावस्था दोष उद्भगती. Okay, that treatment, while treating the amlapitta we must think about doshadhikya, sthana vaigunya, and hetu of the patient, and according this we can use treatment, that is like pachan and anuloman. This patient of amlapitta was unable to digest properly, leading to inappropriate rasadhatu formation. So a Rasayana drug was added first, that is guduchi ghanavati. Guduchi also reduce some other drugs include in treatment, that is प्रवाळ पंचामृतवती, अविपत्तिकर चूर्ण, हिंगवाष्टक चूर्ण, रक्तपाचक चूर्ण reduce dosha samta and leads to anuloman and shaman of the dosha. Shankabhasma has Deepan Vachan, Pittahara Dravata, Pathya, Yava, Godu, Pathya, that is we can eat, the patient can eat the food, that is yava, godugdha, mugdha, old rice, boiled cooked water, and sharkara, madhu, sattu, all bitter and light vegetables, Ruddha Kushmanda, Dadima, and Patola. Apatya, that is patient don't do that things, that patient should avoid the things, that sesame, black gram, garlic, curd, amla, and katu padartha. Guru Anna, oily, spicy food, and fermented foods. Observation. On day 1, the patient is come with the clinical features, that is avipak, glamor, ullas, hastapada chimchemayan, कंठदाह, अरुचि, परिदाह, अम्लोद्गार, क्षुधामांद्य, अधमाना, दौर्बल्य since 1 year. Treatment, we give the treatment that guduchi ghanavati 2 thrice a day, प्रवाळ पंचामृतवती 2 वटी thrice a day, अविपत्तिकर चूर्ण, रक्तपाचक चूर्ण each 200 mg, शंखभस्म चूर्ण 100 mg thrice a day, कुष्मांडा उलेह 1 teaspoon thrice a day. On 7th day of follow-up, the symptoms relief 50%, Shudhamandya, Admana, and Atishul are present. Then we give the treatment that Guduchi Ganavati 2 vati thrice a day, Pravar Panchamurvati 2 vati thrice a day, Asti Majja Pachak Churna, Avipattikar Churna, Raktapachak Churna is 200 mg, Hingvashtak Churna 100 mg thrice a day, Kushmanda Oleha 1 tablespoon thrice a day. On second follow-up, that is on 14th day, the symptoms relief was 80%, and we give them treatment Guruchi Ghanavati 2 tablespoon thrice a day, Prava Panchamrutvati 2 vati thrice a day, Astimajja Pachaka Churna, Raktapachak Churna each 200 mg, Hingvashtak Churna 100 mg thrice a day, Kushmanda Uleha 1 tablespoon thrice a day. Now the discussion was Amlapitta, Pitta is caused due to the increase in Drava Amla Gun of Pitta. Patient was given a Guduchi Ghanavati as a Rasayan, while other drug shaman of Pitta dosha. On seventh day after treatment started, patient has 50% relief of symptoms of Amlapitta. On regular follow-up, decrease in symptoms gradually decrease. Patient was taking treatment for last 1 year, Ayurvedic as well as allopathy, but did not get relief. Then he come to OPD for only Ayurvedic medicine. In Ayurvedic science, before starting a treatment, patient through examination views of dosh, nadi, prakruti, etc. should be done. This patient was given with a Kuduchi Ghanavati, Anulomok Dravya for dosha, which aggregated Urdhvagati and Urdhva Amashay. One Rasayan drug is added in view of health become very poor because of improper digestion. Then he has given with combination of Anuloma Dravya such as Hingvashtak Churna, Avivatikar Churna and Shita Dravya, Raktapachak and Shankabhasma, Kushmanda Avleha. Probable mode of action, that is Guruchi Ganavati, it is Tikta Rasatmak, Swadu Pak and act as a Rasayan, Jwaragna and Pachan. Pravaya Panchamrutvati, that is Pittagna, uh, Swadu Rasatmak, Shamak, Pachak, Agni Deepak. Shankabhasma is indicated in initial stage of Amlapitta. Shankabhasma is Deepan Pachan and Grahi. Pittahara. हिंगवाष्टक चूर्ण it act as a deepan and pachan. रक्तपाचक चूर्ण पित्त शामक and अनुलोमक. अस्थिपाचक चूर्ण it is pachak and pittagna. अविपत्तिकर चूर्ण it is पित्त शामक अनुलोमक used in आम्लपित्त. कुष्मांड अवलेह it is मधुर कटु रस पित्त शामक आणि and सामस्ति शोभन वीर्य. Conclusion. Shaman Upkarama as below. Shaman Upakram as above with Pittahara for long period of time are beneficial for any GI related disease. According to Ayurveda principle, patient of any disease treated with their dosh, dhatu, mala, avastha and Ashtavida Pariksha definitely lead to Upashaya. In this case study, Shaman Chikitsa with Pathya Pathya proven to be beneficial in reducing the sign and symptoms of Urdhwaga Amlapitta. Thank you.
Thank you, Dr. Dhanashree. Thank you for the presentation. Next, we go to the another poster presentation. I would like to invite Dr. Pratiksha Dilip Lokhande from Dr. D.Y. Patel College of Ayurveda Hospital. I would like to invite Dr. Pratiksha Dilip Lokhande.
Good evening all. Myself, Dr. Pratiksha Dilip Lokhande, PG scholar from Swasthavruta Evam Yoga Department, presenting my topic titled as Pathya Apathya in Gastrointestinal Health, an Ayurvedic approach to digestive wellness. My topic includes in Ayurveda, maintenance of the gastrointestinal health is essential for overall well-being. Pathya, that is wholesome and beneficial, and Apathya means the unwholesome and harmful, are key pillars of Swasthavruta that helps in balancing Agni, maintaining dosha equilibrium, and preventing diseases. Following Pathya and avoiding Apathya is the simplest yet most effective way to preserve digestive health and prevent GI disorders. The Ayurveda perspective is Agni is the root of health. Proper Agni ensures digestion, absorption, and assimilation of the nutrients. Pathya strengthens Agni and maintains the dosha balance. Apathya weakens Agni and causes armor, that is toxins, and result in GI disorders. Here I have included all the Pathya and Apathya Ahara, Vihara, Manasik and general Pathya and Apathya. In Pathya means the wholesome Ahara includes fresh, warm, light and easily digestible food, well cooked grains, old rice, wheat, etc. Moong dal, green gram, masoor dal. In vegetables, it includes bottle gourd, rich gourd, pumpkin, ash gourd, carrot, and beetroot. In fruits, it includes ripe banana, pomegranate, papaya, stewed apple, sweet fruits, buttermilk, takra with cumin, coriander, and also the fennel water. Ghee in the moderate quantity. In Vihara, it at regular time, eat in calm and peaceful environment, proper chewing of food, day sleep. Avoid day sleep because it will aggravate the kapha dosha. Regular physical activity and yoga and the adequate sleep. In Manasik, happy and peaceful mind, avoid stress, anger, and worry. Practice gratitude and mindfulness for the mental health. The general pathya includes follow dinacharya, rutucharya, adequate hydration, lukewarm water, seasonal and locally available food, and maintain the bowel regularity. Apathya includes in ahara heavy, oily, spicy, sour, salty, and fermented food, deep fried, processed, and packaged food, leftover, stale, reheated food, excess tea, coffee, alcohol, carbonated drinks, excess curd, cheese, mayonnaise, red meat, excessive non-veg, ice, cold foods and drinks, irregular and excessive eating. In Vihara, includes irregular eating habits, eating while watching TV, mobile, or while working, sleeping immediately after food, lack of physical activity, that is sedentary lifestyle, day sleep, and suppression of the natural urges. In Manasika, stress, anxiety, anger, and fear, overthinking, sadness, mental strain while eating, general apathy, overeating and undereating, incompatible food combinations, excess use of chemicals, additives, late nights, and insufficient sleep. The principle behind all the Pathya and Apatya is first is Agni, second is dosha balance, third is Dhatu Poshan, and fourth is to prevent the diseases. All this Apatyahar will trigger the Ajirna, Amlapitta, Grahani, Vibandha, and Atisara. And Patyahar, Vihara, uh, all the things will support strong Agni, better digestion, regular bowel habit, dosha balance, detoxification, energy, strength, immunity, mental clarity, and well-being. The simple daily guidance for GI wellness includes first is eat fresh and seasonal and home cooked food. Second, chew food well and eat in a calm state. Third, eat in the right quantity, that is the matravat ahara. Fourth, stay active and do yoga. Fifth, drink warm water in sips. Next is sleep on time and wake up early. Manage stress with meditation and pranayam. Avoid apatya habitually. The conclusion is Pathya and Apathya are the foundation of preventive healthcare in Ayurveda. Choosing wholesome food, following disciplined lifestyle, and maintaining mental well-being ensures Agni, healthy digestion, and disease-free life. So the take-home message from my presentation is choose Pathya today for a healthy gut and healthy life tomorrow. Thank you.
Thank you, Dr. Pratiksha. Thank you for the well-structured presentation. Next, I'd like to invite Dr. Varsha from the Dr. D.Y. Patel College of Ayurveda. I would like to invite Dr. Varsha.
Good evening, all. Myself, Dr. Varsha Pote from Sastuttar Evam Yoga Department. I am presenting my poster. Title is Role of Yoga in Stress Management Among Healthcare Students. Balance the mind, strengthen the body, and empower the healer. Stress is a common problem among healthcare students due to academic load, exam, clinical posting, and future career concern. Chronic stress affects concentration, immunity, sleep, and overall performance. Yoga is an holistic approach including asana, pranayam, meditation, and positive lifestyle that helps in achieving balance between body, mind, and emotion. Aims and objective to understand the factor causing stress in healthcare students, to explore the role of yoga in reducing stress and empowering well-being, to highlight the physiological and psychological benefit of yoga, to promote yoga as a daily practice for a balanced and healthy student life, to encourage integrate of yoga into academic curriculum and campus life. Yoga is the stilling of the fluctuations of the mind from Patanjali Yoga Sutra, and stress in healthcare student, common heavy academic load and exams, long clinical hours and responsibility, fear of failure and high expectations, competition and comparison, lack of time for healthcare and recreation, regular sleep and a healthy lifestyle. effect of stress, anxiety and irritability, poor concentration, sleep disturbances, headache and fatigue, and decreased immunity. Yoga holistic solution. Yoga is a unique science that harmonizes the body, mind, breath, and spirit. Components of yoga are asana, that is physical posture, improve flexibility, relieve muscular tension. Pranayam, breath regulation, calm mind, reduce anxiety, and improve oxygenation. Meditation, the training of mind, enhances focus, emotional balance, and self-awareness. Yama and yamas, ethical and positive lifestyle, promote discipline, self-control, and positive habits. Benefits of yoga in stress management. Reduces stress, anxiety, and depression. Improve concentration, memory, and academic performance. Enhances the sleep quality and increase energy levels. Regulate autonomic nervous system. Improve the heart rate and variability and cardiovascular health. Increases emotional stability and resilience. Promote overall physical, mental, and spiritual well-being. Evidences from the research paper shows that regular yoga practices significantly reduces perceived stress and anxiety level in students. Yoga improves cortisol profile, autonomic balance, and emotional regulation. It enhances the cognitive function like attention, memory, and information process, reduces the burnout, and improve quality of life among healthcare professionals and students. Simple yoga practice for busy students. Daily practice for 20 to 30 minutes that includes asana for 10 to 15 minutes, pranayam for 5 to 10 minutes, meditation for 5 to 10 minutes, and relaxation for 2 to 5 minutes. Tips for students. Start your day with yoga and positive affirmation. Practice conscious breathing during stressful situation. Maintain proper sleep, diet, hydration. Be consistent, not perfect. Yoga is not about touching your toes. It's about what you learn on the way down. Ayurvedic perspective, according to Ayurveda, stress vitiates vata, pitta, dosh, leading to the mental and physical disturbances. Yoga pacifies vata, balances pitta, stabilizes the mind, manas, and promotes sattva, clarity, calmness, and positivity. It is an essential component of Swasthavavritta for maintenance of health and prevention of the disease. The conclusion is yoga is a powerful, practical, and natural tool to manage stress among the healthcare students. Regular practice enhances resilience, improve academic performance, and promote holistic well-being. Incorporating yoga into the student life today will create a healthcare individual, a better healthcare professional tomorrow. Stress less, breathe more, study better, live better. Thank you.
Thank you, Dr. Varsha. Thank you for the well-structured presentation. Next, we go to the another paper presentation. I would like to invite Dr. Adithi Adarsh from Sri College of Ayurvedic Science.
Good evening all, I am Dr. Adithi Adarsh, second year RSPK PG scholar, and this is the title for my presentation, Therapeutic Significance of Smritisagara Rasa in Apasmara. These are the contents. Coming to the introduction, we all know that Apasmara in Ayurveda is described as a loss or destruction of Smriti, Buddhi and Sattva, which is classified under Manasa Roga. And Apasmara is one among Ashtamahagada according to Acharya Charaka. And it mainly involves Vata along with Rajas and Tamas, which affects Manovaha Srotas, Hridaya, Mastishka, Majjadhatu, Indriya, etc. Clinically, apasmara resembles epilepsy, which is characterized by recurrent seizures, jerky body movements, frothing, and transient loss of consciousness, which is caused by abnormal neuronal discharges in the brain. Globally, epilepsy affects around 50 to 60 million people, causing major disability, social stigma, psychological stress, and decreased quality of life. This slide contains Nidana, Samprapti, Lakshana and types of Apasmara, where the Nidana includes Ahitakara, Apavitra, Durgandayukta, Dushita, Ahara, Nitya Sevana, Malamutra Vegadharana, Ayoga, Atiyoga and Mityayoga of Indriyartha, etc. This Nidana Sevana leads to Sharirika and Manasika Dosha Prakopa, which travels to Hridaya through Manovahasrotas, causing Manakshoba, leading to Smriti Nasha, Tamapravesha, Fenavamana, Hastapada Vikshepa, Bibhatsa Cheshta, Vivritakshata, etc. leading to Apasmara. There are 4 types of Apasmara, namely Vataja, Pittaja, Kafaja, Sanipataja. This slide majorly focuses on the treatment aspect where Tikshna, Shodhana and Shamana is being mentioned. In Shamana, Aushadhis that pacifies doshas are being mentioned, namely Brahmi Grita, Kalyanaka Churna and Rasaushadhis like Smritisagara Rasa, Aindra Brahmavati, etc. are being mentioned. Here, Smritisagara Rasa is highlighted because of its potential action on improving memory, stabilizing mental functions and decreasing the seizure episodes. This slide explains the pharmaceutical processing of Smritisagara Rasa. The ingredients such as Shuddha Parada, Shuddha Gandhaka, Shuddha Haratala, Shuddha Manashila, Tamra Basma, Swarnamakshika Basma is being subjected to repeated bhavana with Vachakwata and Brahmi Kwata for 21 times and Jyotishmati Bija Taila for 1 time. Apasmara is mainly caused due to the derangement of Vata along with Kapha obstruction and impairment of Manas, Smriti, Buddhi and Sattva. Hence the formulation is designed with Ushnavirya Dravya which removes Kapha obstruction and stimulates the channels. Tikshna Guna which penetrates Srotas and acts rapidly on the nervous system. Medya Dravya which improves the intellect, memory and mental stability. Vata Kapha Shamana action which controls convulsion and abnormal neuronal activity. This slide discusses the role of individual ingredients of Smritisagara Rasa in the management of Apasmara. Coming to Kajali, it acts as base of the formulation and it works as Yogavahi by enhancing the potency and bioavailability of all the other drugs. As it has Rasayana action, it nourishes Majja Dhatu and nervous system. It balances all the Tridoshas and facilitates deeper penetration into subtle channels including Manovaha Srotas. Due to its catalytic action, it helps in quicker therapeutic response in Apasmara. Coming to Haratala, it has Katu Kashaya Rasa, Katu Vipaka and Ushnavirya. These properties helps in reducing kapha accumulation and clears the srotas. Since kapha causes guruta and increases the tamobhava, Haratala counteracts the symptoms. Coming to Manashila, it has Tikta Rasa and Ushna Tikshna properties which mainly acts on Kapha Shamana and it stimulates the nervous system. In Apasmara, as we all know, Tamas predominates and it causes loss of consciousness, where Manashila helps to restore the consciousness and it acts as sedative by decreasing the hyperexcitability and abnormal motor activity, and it breaks the pathological obstruction in neural pathways. Coming to Tamra Basma, it has Tikta Kashaya Rasa, Madhura Vipaka and Ushnavirya, which acts mainly on Kapha and Pitta, where Kapha causes obstruction and Pitta causes abnormal neuronal excitability. The Tamra Basma helps in removing the accumulated Kapha, improving circulation and proper nerve conduction. Tamra Basma in combination with Kajali and Rasa Sindhura acts on Vegavastha Lakshanas like bluishness of lips, irregular movements and clenching of teeth. Coming to Swarnamakshika Basma, it has Tridosha Shamaka properties and acts as Rasayana and Yogavahi. It improves strength of the nervous system and enhances the metabolic activity and improves the cognition and gives strength to Majja Dhatu. The Swarnamakshika provides a restorative support and improves overall neurological resilience. Coming to Vacha, it is one of the major drug in Apasmara management. It has Katu Tikta Rasa, Ushna Virya, Lagu Ruksha Tikshna Guna, and it acts as Kaphavata Shamaka and possesses Medya action. It also possesses Sanya Stapana and Sanya Prabodhaka action. It clears Manas, improves speech and cognition. It stimulates CNS and does GABA modulation and decreases the tendency of seizure by removing kapha obstruction. Coming to Brahmi, it is the classical Medya Rasayana with Tikta Kashaya Rasa and Shita Virya, and it calms mind and stabilizes the neuronal activity. It improves smriti, concentration and intellect, and it also decreases the anxiety and stress related triggers. It also balances Vata Pitta by helping in long time neuroprotection and cognitive recovery after seizure. Coming to Jyotishmati, it possesses Katu Tikta Rasa, Ushna Virya and Tikshna Guna. It is known for enhancing Buddhi, Smriti and sensory perception. It also acts as stimulant to higher mental functions and supports restoration and consciousness and cognitive functions by decreasing the intensity and duration of seizure. The probable combined action of Smritisagara Rasa It removes kapha avarana obstructing the vata. It normalizes derangement of vata, which is responsible for convulsions. It acts on manovahasrotas and higher mental functions. It improves smriti, buddhi, and sattva. It provides medhya, anticonvulsant and neuroprotective effect. It decreases the frequency and severity of the seizure. In conclusion, Apasmara is neuropsychological disorder affecting memory, consciousness, and motor functions. Smritisagara Rasa acts holistically on Majja Dhatu, Mastishtha, and Manovahasrotas, providing Medhya, Rasayana, neuroprotective, and anticonvulsant effects. It helps to decrease seizure frequency while improving memory, cognition, and mental stability with ingredients like Brahmi, Vacha, and Jyotishmati, which supports CNS calming and GABA modulation. These are my references. Thank you.
Thank you, Dr. Adithi. Thank you for the well explained presentation. Next, we go to the another paper presentation. I would like to invite Dr. V. Hema Prachetan for the paper presentation from Dr. NRS Government Ayurveda College.
Respected Chairperson, co-delegates and teachers, a warm greeting to all. Myself, Dr. V. Hema Prachetan, second year PG scholar in Kaya Department, Dr. NRS Government Ayurvedic College, Vijayawada. Today, I present a paper entitled Beyond the Bite, the Art of Mindful Eating. In this, we will explore the therapeutic science of Ahara Vidhividhana and its profound resonance with modern neurogastroenterology. In Ayurveda, Ahara is not just fuel. It is recognized as one of the Trayopastambha, the three supportive pillars of life. Kashyap Samhita elevates food to the status of Mahabheshaja, the ultimate medicine. No amount of therapeutic drug intervention can succeed if the diet is faulty. However, modern dietetics often limits its scope to biochemical analysis, that is calories, micronutrients, and glycemic index. Ayurveda expands this pattern to view eating as complex psychosomatic event that determines whether food turns into life-giving ojas or disease-inducing ama. The core philosophy of Ayurveda Chikitsa revolves around the preservation and treatment of Agni. Crucially, Ayurveda recognizes that Agni is not a purely physical entity. It is deeply influenced by Manas. Acharya Charaka states a profound clinical truth: even if you consume the most wholesome, organic, and perfectly measured food, it will fail to digest properly if you eat while experiencing emotional distress like anxiety, anger, grief, or fear. This incomplete digestion leads to Agnimandra, which synthesizes ama. To prevent this pathological cascade, our sages outlined Ahara Vidhividhana, 10 clinical rules of eating. First, food must be warm, that is Ushnam, and anxious, Snigdham, to naturally kindle enzymes. It must be eaten in correct quantity and only after the previous meal is completely digested to prevent metabolic overlap. Furthermore, it must be eaten in a clean, pleasing environment with proper utensils. This ensures that mind is pacified, allowing the nervous system to transition smoothly into digestive mode. Moving further, the classics address the physical dynamics of eating. Na atidrutam, do not eat too fast, which bypasses oral digestion and triggers stress. Na ativilambitam, do not eat so slowly that food gets cold and digestion slows down. Ajalpan ahasan, restrict talking and laughing while chewing. Among all these rules, main thing is tanmana bunjita, eating with single-minded focus. This means engaging all five senses in the act of eating, which is the classical equivalent of modern mindfulness. How much should we eat? Acharya Charaka introduces a beautiful clinical formula known as Trivita Kukshi, or the stomach rule of thirds. The stomach volume must be divided into three parts. One third is reserved for solid food, one third for liquids, and one third must be left entirely empty. This vacant space is not wasted. It is physiologically necessary for the free circulation and mechanical action of three doshas. When we overeat and eliminate this empty space, we choke the Agni and trigger physical and mental distress. Let us bridge this modern pathophysiology. What happens neurologically when we eat with tanmana? Modern science identifies the cephalic phase of digestion. Simply looking at smelling, and anticipating food triggers the cerebral cortex, which signals the vagus nerve to release saliva, stomach acid, and pancreatic enzymes. If you are distracted by phones, screens, or emails, we are in a state of sympathetic nervous dominance. Our body behaves as if it is under threat, shunting blood away from the gut, immediately halting peristalsis and enzymatic secretions, resulting in functional dyspepsia and irritable bowel syndrome. When we examine lifestyle diseases like type 2 diabetes, obesity, GERD, and metabolic syndrome through the lens of Ayurveda, we find these clinical errors. We see adhyashana, constant snacking and grazing when the previous meal is not yet digested. We see vishamashana, erratic eating times that interrupts our biological clocks. Above all, screen time eating creates a sensory disconnect where the brain fails to register satiety signal, leading to mechanical overeating and chronic digestive insufficiency. Next, time, that is kala, is another crucial pillar. Aligning our largest meal with the solar apex when Agni is naturally at its peak prevents metabolic sluggishness. Furthermore, eating at a moderate, mindful pace respects the body's endocrinology. Hormones like leptin takes 15 to 20 minutes to reach the hypothalamus and signal fullness. Slow, deliberate chewing is not just about mechanically breaking down food. It is physiological time buffer that prevents caloric overshoot and subsequent tissue clogging. To conclude, Acharya Charaka beautifully states that both the healthy body and its diseases are born of food. The difference between physical happiness and misery lies in whether our eating habits are wholesome or unwholesome. As practitioners of Ayurveda, our prescriptions must extend beyond herbal formulation. We must actively counsel our patient on the art and science of Ahara Vidvidhana. Mindful eating is not a modern trend. It is an ancient medical necessity. Thank you for kind attention.
Thank you, Doctor. Thank you for the well organized presentation. Next, I'd like to invite Dr. Aishwarya Publicity from Dr. NRS Government Ayurveda College.
Good evening, respected members of the panel of Prasuti Tantra and Stri Roga. Myself, Dr. Aishwarya Publicity, second year PG scholar of Department Prasuti Tantra and Stri Roga. I'm currently studying at Dr. NRS Government Ayurvedic College, Vijayawada, Andhra Pradesh. Today, my topic of presentation is a conceptual review of Rasayana Chikitsa in managing the menopausal syndrome. Acharya Charaka explained in Sutrasthana, Swabhavat Vinashakarana Nirapekshad Uparamo Vinashaha Swabhava Uparamaha, which means that every substance which is created on this earth has to be destroyed or degenerated. That likewise, menopause or Rajonivrutti represents the natural cessation of the menstrual cycles. This transition, which is natural, often accompanied by a range of physical and emotional symptoms, collectively known as menopausal syndrome. Acharya Sushruta mentioned Rasadeva Striya Raktam Raja Samyam Pravartate Yati Panchashatakshayam. The age of menopause is genetically predetermined, typically ranging from 45 to 55 years with an average onset of 50 years. It is classified under Swabhava Bala Pravritti Vyadi. Next, the determinants of onset of Rajonivrutti or menopause is mainly under genetic factors, lifestyle factors and environmental factors. Genetic factors, the family history largely dictates the timing of the ovarian depletion, whereas the lifestyle factors like smoking, high stress, low physical activity will accelerate the onset of Rajonivrutti. Environmental factors like exposure to endocrine disruptors will affect the hormonal timing. Whereas the Samprapti of Rajonivrutti, it is mainly explained under following steps, that is Kala and Jara. Due to natural timing and aging, the progression of the age which leads to the depletion of the ovarian follicles leads to Rajonivrutti, whereas the Dhatukshaya, primarily the Rasa and Rakta Dhatu, leads to the Rajonivrutti. In Upadhatukshaya, the Kshaya of Artava leads to the Rajonivrutti. Whereas in modern, the pathophysiology of menopause goes like, due to aging, there is a reduction in number of the granulosa cells from the ovaries. The reduction in the level of hormones like inhibin and estradiol will causes the loss of inhibin and gonadotropins, which increases the level of FSH and LH hormones, which further disturbs the HPO axis, which leads to failure in the development of the endometrium, and it causes the irregular menstrual cycles, which finally leads to menopause. It is mainly explained under the triple cellular crisis, which includes hormonal dysregulation, oxidative stress, and the systemic inflammation. In hormonal dysregulation, due to the disruption of HPG axis, the due to this disruption there will be destabilization of the body's central thermostat, which triggers the vasomotor symptoms like hot flashes and night sweats. In oxidative stress, estrogen in general acts as a natural antioxidant scavenger. Its loss because of the depletion causes a massive spike in free radicals, leading to widespread of the cellular aging. In systemic inflammation, because of the surging inflammatory cytokines, it will fuels the mood disorders, joint degradation, and metabolic shifts. Next, coming to the lakshanas of rajonivrutti, it is classified according to the doshas: vataja lakshana, pittaja, and kafaja lakshana. Vataja lakshanas include sandhi vedana, tvakrukshata, anidra, atmana, brahma, and supti, whereas the pittaja lakshanas are daha, svedadikyata, trishna, mutra draha, hrudravatva, and glani. Kafaja lakshanas are agni mandya, klama, and mano avasada. Next, coming to the Rasayana therapy, how Rasayana therapy is beneficial in managing the menopausal syndrome. The word Rasayana therapy is a combination of two words, that is Rasa and Ayana. Rasa means the primary nutrient fluid, which is formed after digestion, and which in further nourishes all the saptadhatus, and Ayana means the path, movement, or circulation. The word Rasayana explains that means by which one obtains the optimum premier quality of the nutrient fluid to the body tissues is called Rasayana. The Rasayana therapy is going to act at three levels, that is the level of Rasa, level of Agni, and level of Shrotas. In level of Rasa, it improves the quality of nutrient fluid, plasma, and circulating blood. At the level of Agni, it corrects the metabolic correction, and it optimizes the digestive fire to ensure thorough breakdown and absorption of the nutrients. At the level of Shrotas, it clears the micro obstruction and restores the systemic circulation and cellular communication. Next, I'm going to explain about the few drugs which are having Rasayana property and beneficial in managing the menopausal syndrome. First is the Shatavari. It contains natural phytoestrogens and rich in steroidal saponins. It balances the HPO axis. It prevents vaginal dryness and vasomotor flushes. Next is the Ashwagandha. It is a powerful adaptogen, and it settles the nervous system, reduces cortisol, and supports the adrenal glands. It helps in preventing the menopausal bone density loss. And next is the Yashtimadu. Yashtimadu is one of the Medhya Rasayana. Its cooling nature will help in Pitta Shamaka, and it is effective against hot flashes and night sweats. It also supports the mucosal membranes by mitigating the vaginal dryness and dry mouth. Next is the Guduchi. Guduchi is a potent anti-inflammatory property containing drug. It improves metabolic toxins from the tissues. It removes the metabolic toxins, and it relieves the general body aches and also recurring low grade inflammation. It helps by reducing the hot flashes and general toxicity. Next is the Vidari Kanda. It balances the both Vata and Pitta doshas. It is packed with plant-based isoflavonoids, that is phytoestrogens, which help in softening the impact of missing estrogen, and it mainly acts over severe vaginal dryness, wrinkling, or thinning skin. Next is the Gokshura. Gokshura is a specific rejuvenator for urinary tract and kidneys. It strengthens the bladder wall, prevents the chronic low-grade inflammation, and it stops fluid retention. It mainly acts on recurrent menopausal UTIs. Next is the Triphala. Triphala, it mainly does the Tridosha Shamaka. Mainly Amalaki, it does the Pitta Shamana. It helpful in hot flashes and night sweats, whereas Haritaki balances the Vata dosha. It mainly calms the anxiety, mood swings, and improves sleep quality, whereas Bibitaki controls Kapha. It helps in sluggish menopausal metabolism and manages weight gain and lipid shifts. Now, I'm finally concluding that Rajanivrutti is a predictable bioaging event arising from the Dhatukshaya and Vata Pitta imbalances. Rasayana Chikitsa offers a multi-target alternative to conventional hormonal replacement therapy. By treating at the level of Agni, Shrotas and Rasa, it manages immediate discomforts while preventing long-term bone and metabolic health disorders. Thank you.
Thank you, doctor. Thank you for the well-explained presentation. Next, I'd like to invite Dr. Sindhu Rajabadini from the Dr. NRS Government Ayurveda Medical College.
Doctors and my dear delegates, good morning to all. I am Dr. Sindhu, KCPG second year, and I am from Dr. NRS Government Ayurvedic College, Vijayawada. Today I am going to present topic on Rasayana in psoriasis. We all know in Ayurveda, Rasayana refers to rejuvenation therapies, which is used to promote cellular repair, balance immune responses, and prevent the recurrence of chronic conditions like psoriasis. And psoriasis is a chronic immune-mediated inflammatory skin disease characterized by recurrent episodes of erythematous flakes with dry silvery scales. In Ayurveda, it can be correlated mainly with Kidaba and partially with Ekakusta, included under Shudra Kushta. Ayurveda considers Kushta as a disorder produced by vitiation of all the three doshas along with involvement of Tvat, Rakta, Mamsa and Vasana. Since psoriasis is chronic and relapsing in nature, mere symptomatic treatment is not sufficient. So, we have to give Rasayana therapy. What is Rasayana? The term Rasayana is derived from the words Rasa and Ayana. Rasa refers to the primary nourishing fluid of the body, while Ayana means proper circulation or movement. Therefore, Rasayana therapy refers to measures that improve nourishment of tissues and to promote longevity and resistance against disease. Hence, Labhopayohi Shastana Rasadina Rasayana. How Rasayana therapy acts in psoriasis. In psoriasis, Rasayana therapy acts as a supportive and restorative treatment after purification therapies, that is Shodha. Rasayana therapy plays an important role in by reducing inflammation, regulating immune responses, improving skin health, elevating symptoms like scaling, redness, and itching, enhancing psychological well-being, and reducing stress by promoting long-term remission without adverse effects. In Ayurveda practice, Rasayana is always combined with Shodhana, that is Panchkarma. These therapies detoxify the body and prepare it to absorb the benefits of Rasayana, leading to more effective and sustainable outcomes by improving immunity, rejuvenation of skin tissues, preventing recurrence, correcting Dhatu enhancing quality of life. Mode of action of Rasayana in psoriasis. Agni which corrects impaired metabolism, Amabachana, which removes toxic metabolites, Rakta Prasadana, which purifies blood and improves circulation, immunomodulation, which balances abnormal immune response, Dhatu to nourish skin and tissues, antioxidant action, reduces oxidative stress, anti-inflammatory action, controls cytokine mediated inflammation. So, who can undergo Rasayana? The primary hurdle in the application of Rasayana therapy is the time consumption. It requires proper planning and a well-designed Panchkarma as a must prerequisite. Rasayana therapy is not for everyone. It is best suited for individuals who are in a stable phase of the disease, not during acute flare-ups, who are physically fit to undergo detoxification procedures, that is Shodhana therapies, who are mentally prepared and who committed to dietary and lifestyle recommendations, who can stay under supervision for a 3 to 5 week period. And now we will like to discuss Rasayana herbs for psoriasis. We all know there are many specific herbs potent to be acting as Rasayana in cases of psoriasis. Here are few among many. The drug Bakuchi, which is Sotalia colifolia, consists of soralin, isosoralin, bakuchiol, soralidin, having role in psoriasis as anti-inflammatory, anti-proliferative, antimicrobial, while Ballataka, which is a semicarpous anacardium, consists of anacardic acid, semicarpal flavonoids, having role in psoriasis as anti-inflammatory, immunomodulatory, reducing psoriatic lesion, while Tuvaraka, which is a Hydnocarpus florifolia, consists of hydnocarpic acid, gorbic acid, having role in psoriasis as anti-inflammatory, anti-proliferative and antimicrobial. Chikitsa. Based on the protocol, we have to give chikitsa. Protocol 1. The patients having mild symptoms, recent origin and localized lesions, we have to give Sajjo Virechana with Avipathic Churna 20 grams per 1 day. If Sama Lakshanas are seen, Shadharana Churna 5 grams, Mahatikta Kashayam 15 ml PD for first week, Kaishora Gugulu 1 tablet PD for first week, Manasmitra Vatika 1 tablet BD for 2 weeks, Gandhaka Rasayana 100 mg with honey PD throughout the procedure. Itpala Tiratela external application followed by sun exposure. Protocol 2. Moderate symptoms, history of 2 to 6 months, afflicted to a larger area. Have to give Mahatiktaka Bruta 15 grams according to Agnivala within 7 days. Snehna along with Abhyanga and Sarvanga Svedana. Sajjo Virechana with Avipatti Churna 20 grams per first week. Tiktaka Kashayam 50 ml BD for 2 weeks. If Sama Lakshanas are seen, 5 to 6 grams Shadharna Churna can be given. Kaishora Gugulu 1 tablet TID for 2 weeks. Gandhaka Rasayana 100 mg with honey throughout the procedure. Arodhyavartani Gutika 1 tablet TID for 2 weeks. Haritra Kanda 12 grams BD for 2 weeks. Manas Mitra Vata 2 tablets BD for 2 weeks. Vitpala Kertelam external application followed by sun exposure. For protocol 3, severe symptoms, 6 months history and having extensive lesions with stress, we have to give Deepana Pachna, Snehapana, Abhyanga, Svedana, Nasya, Vamana and Virechana with Madana, Vacha, St, Pippali plus Madhu. Starting with previous protocols according to the Bala Avastha of Roga and Rogi, we have to give the Shodhana procedures. Need of Rasarakta Prasadana. So we have to follow Manobala Vartaka Rasayana Chikitsa Rasarakta Prasadana by providing Mahamanjishtadi Kashaya 15 ml BD for 1 month, Manasmitra Vatika 1 BD for 1 month, Gandhaka Rasayana 1 tablet BD for 1 month, Kalyana Gruta 12 grams at night for 1 month. Pathya, for a minimum of 3 months to control symptoms and relapse, we have to avoid Viruddha Ahara, spicy or oily foods, fermented foods, and to maintain hygiene and have to follow Achara Rasayana. Thank you.
Thank you, Doctor. Thank you for the insightful presentation. Next, I would like to invite Dr. Shivani Paskar Kusambe for the paper presentation.
Good evening, everyone. I am Dr. Shivani Kosambe, and today I am going to present on my topic, Diagnostic Importance of Jiva Pariksha. Jiva Pariksha or tongue examination is an important diagnostic tool described under Ashtavida Pariksha in Ayurveda. It helps in assessing dosha imbalance and the status of Agni, which is digestive fire. According to Ayurveda, the tongue reflects internal pathological changes occurring in the body. The presence of Am and Agni Mandya can be identified through tongue examination. This examination is mainly performed through Trivida Pariksha, which includes Darshan Pariksha, inspection, Sparshan Pariksha, which is palpation or touch, Prashna Pariksha, which is questioning the patient. Background of my study is Darshan Pariksha evaluates the color, coating, and morphology of the tongue. Sparshan Pariksha evaluates the texture of the tongue. Prashna Pariksha evaluates taste, sensation, and patient's complaint. These methods together help in understanding the health condition of the patient. Need for study. The need of the study is very important because dosha imbalance and agni dushti are considered the root cause of many diseases in Ayurveda. Early identification of arm helps in preventing disease progression. Jivha Pariksha is a very simple, economical, and non-invasive diagnostic method. So tongue examination can be very useful in routine clinical practice. Aim of my study to study the diagnostic significance of Jivha Pariksha. The objectives are to assess the dosha imbalance, to understand the tongue coating and agni status, to evaluate the diagnostic importance of tongue examination. Material and methods, Ayurvedic Samhitas, Rog Nidan and Vikruti Vignan textbooks, published review articles. This study was conducted through literary review and an analytical study method. Healthy tongue features include, according to Ayurvedic text, Acharya describes a healthy tongue as having proper length and breadth, smooth texture, thin structure, and normal color. Modern textbooks describe a healthy tongue as symmetrical, evenly pink, slightly moist, supple, and oval in shape. A healthy tongue should also be free from cracks, tremors, patches, foul smell, or abnormal coating. It should protrude straight without deviation and have a thin, transparent coating with normal taste buds. These features indicate a good health and proper digestive function. Procedure of examination. Tongue examination is preferably done in the early morning. Food or medicines taken before examination may interfere with diagnosis. The examination can be performed in sitting or supine position. The patient should protrude the tongue naturally without overstretching. The examination should preferably be carried out in daylight for accurate observations. Darshan Pariksha. Darshan Pariksha includes examination of tongue, color, appearance, and texture according to dosha. According to Vata dosha, tongue appears dry and pale, small, thin, cracked, trembling, rough, and mobile, and may show indentation or scalloped margin. This reflects poor nutrient metabolism and low absorption. Pitta tongue features includes long, narrow, and pointed, red, inflamed, ulcerated, swollen, red edges, blackish red color. Kapha includes large, swollen, thick, soft, and wet, pale in color, white, and greasy coating. Wherein Tridosha's tongue features includes black color, ulceration, fissures, dryness. Dvandvaj mixed features of two doshas are seen. Tongue coating and Agni. The tongue is considered the mirror of the digestive system. A tongue uh, called coated tongue called samjiva indicates the presence of arm due to impaired digestion or Agni-mandya. Coating in the middle part of the tongue suggests arm in the stomach and small intestine. Coating in the posterior part suggests arm in the large intestine. A thick tongue coating indicates progression and severity of disease. Different colors of coating indicates different conditions. White coating indicates impaired digestion. Yellow coating may indicate pitta aggravation. Coming to Sparshan Pariksha, includes assessment of temperature, tenderness, and moisture of the tongue. It helps in understanding internal pathological changes and supports dosha assessment. In Vata, the tongue may be Shita, Ruksha, and Khara. In Pitta, the tongue is usually Ushna, meaning hot. In Tridosha condition, the tongue becomes excessively rough or sakanthak. Prashna Pariksha. It is done by questioning the patient regarding symptoms like altered taste sensation, dryness, burning sensation in mouth, and excessive salivation. In Vata, Kashayasyata, loss of taste sensation. In Pitta, Katukasyata, burning sensation. In Kapha, Mukhamadhuryata, heaviness in mouth. These symptoms helps in understanding dosha predominance. Coming to the discussion, Jivha Pariksha is a simple yet important clinical examination for assessing overall health. Different reflex zones of the tongue indicates abnormalities in specific organs. Darshan Pariksha evaluates tongue color, coating, and appearance. Sparshan Pariksha evaluates texture. Prashna Pariksha evaluates taste and sensations. These findings help in assessing dosha imbalance and Agni status. Assessment of Agni helps in planning proper Pathya and Apathya, meaning diet and lifestyle recommendations. It also helps in understanding disease pathology, differential diagnosis, treatment planning, and prognosis. To conclude, tongue examination should be included in daily clinical assessment as well as self-observation. It is best performed in the morning before brushing or tongue cleaning for accurate findings. Tongue features may vary according to diet, emotions, and health status. Standardization tongue diagnosis systems help reduce diagnostic variations. Computer-aided tongue diagnosis systems with advanced software can improve accurate diagnosis and treatment planning in the future practices. Thank you.
Thank you, Doctor. Thank you for the well explained presentation. Thank you so much, Doctor. Next, we go to the another paper presentation. I'd like to invite Dr. Jinu Somashekhran Nair for the paper presentation on the topic Management of Asrupta case study.
Namaste all. Myself Dr. Jinu Shekharas, PhD scholar, Department of Prasuti Tantra and Sriroga, Sri Swaminarayan Ayurveda College, Khalur, Gandhinagar. Today we are going to discuss a case study of management of Asrupta. Introduction. Asrupta is defined as Pradirana of Raja. It is named as Pradharana, and since there is Dharana of Asrik, it is known as Asrupta. The word Asrupta explains prolonged cyclic or acyclic excessive menstrual bleeding. In this type of bleeding disorder, the quantity and quality of menstrual fluid are mainly affected. Food containing amla, lamana, guru, vidahi, viruddhahara, dadi, sura, etc. causes Agni Vaishamya. In 10 causes Rajodushti leading to Asrupta. If it is not treated properly, it can cause further complications like Balahani, Dadukshinata, Rama, Thamodarshana, etc. As Viparita Lajjalu Kshiravaka is having Kashaya, Legu, Virya is Kadu, Dosha Karma is Kafapittahara, Vadanu is said to have Hridya, Pittahara and Shulavara actions. It is explained in Yogamrita Asriddhara chapter Siddha Prayoga. The present study was carried out Ashwini Ayurveda Specialty Clinic, Omalur, Pathanamthitta, Kerala. Informed and written consent was obtained from the subject, and the case was recorded as per the detailed case performer, which was prepared considering all the points of history taking, physical examination, and lab investigation. Case report. A married female patient of 36 years attended the OPD of Ashwini Ayurveda Specialty Clinic, Omalur, Pathanamthitta, Kerala. Her menstrual history release increased flow during the menstruation associated with clots, headache, which affected her daily routine for 5 months. On inquiry, she said that the duration of menses was 10 to 15 days at the regular interval of 28 to 30 days. Amount was 5 to 6 pads fully soaked XL size whisper company with clots for the initial 5 days, followed by 4 pads per day. No history of abdominal pain. The pain was mild in low back. There was no relevant history of thyroid, diabetic mellitus, hypertension, etc. No surgical intervention and no history of contraceptive use of patient. Clinical findings. Past medical history. In 2018, she had hemorrhoids treated with Ayurvedic medicine. Past surgical history nil. Family history not significant. Personal history. The patient has a good appetite, clear and satisfactory bowel movement, normal maturation and good sleep. General examination, build normal, weight 67 kg, tongue coated, palate absent, pulse rate 74, BP 120 by 80, respiratory rate 18, temperature febrile. Physical examination, Ashtabita Parisha, Nadi 82, Mala once in a day, Mudra 6 to 7 times in a day, Jihvalipta, Shabda Prakrita, Sparsha, Anushna Shida, Drik Prakrita, Agardi Madhyama. Dashivita Parisha, Prakriti Vadapitta, Vikriti Madhyama, Bala Madhyama, Sara Madhyama, Samhanana Madhyama, Satmya Madhyama, Sattva Madhyama. Systemic examination per abdomen on palpation, soft, no tenderness, no organomegaly. CVS, abnormality dictated. CNS, conscious and well. RS, bilateral NVBS heard. Gynecological examination on inspection, vulva, normal and healthy and straining, no genital prolapse was observed. Per speculum vaginal examination, cervix appears normal, healthy. Wide discharging, vagina was normal. On palpation per vaginal examination, cervix firm in consistency, mobile, tenderness absent. No labial swelling detected. No abnormality detected on palpation of vaginal wall. Bimanual examination, uterus anteverted, freely mobile, normal in size, firm in consistency, bilateral form is fairly non tender. After thorough checkup, the following investigation were done to the patient and under mentioned treatment was given. Investigation, blood, HB 11.4 gram percentage, BT 2.2.14, CT 4, ESR 50 mm per hour, platelet count 2.68 lakh, RBS 80 mg per DL, PCV 32.7%, T3 0.85, T4 7.01, TSH 1.08. Urinary, albumin absent, sugar absent, pus in bacteria nil. UST abdomen, uterus anteverted normal size, endometrial thickness is 17.2 mm, right and left ovary are normal in size and volume. Impression, thickened and echogenic endometrial hyperplasia. Treatment administered. Shamana Chikitsa was planned with Viparita Lachalu Ksheerapaga, 40 ml morning and evening on empty stomach. The main aim of the treatment was to minimize cyclic blood flows with the regularization of the cycle and to improve the general condition of the patient. So the treatment was planned as Shamana Chikitsa with Viparita Lachalu Ksheerapaga. This palliative treatment was given for 3 consecutive months with a follow-up of 1 month. Result. The duration of the menstrual cycle was reduced to 10 to 15 days to 3 to 4 days. The amount of menstrual bleeding was reduced to 6 pads per day to 2 to 3 pads per day without clothes, and she remained fully asymptomatic with a regular menstrual cycle during this period. Dietary modification. Rajaswala Parichay was strictly advised in this every cycle discussion. Asudhara condition. In Asudhara condition, there is impairment of Rasa Dhatu by which the Rakta Dhatu Dushti occurs and finally result in the vitiation of Urdhwaga and Rakta Vaha waving to DOB. So correction again at the Dhatu level can help to sustain the equilibrium of dosha and can recently show the dushti and rescue the pathological status. Ayurvedic management is a good alternative to hormonal therapy as it has no side effect with minimal recurrence rate. Viparita Lachalu Ksheerapaga tone up the uterine musculature and regularize the menstrual flow. Viparita Lachalu possesses the multitude of therapeutic potentials. Thank you.
Thank you, Doctor. Thank you for the insightful presentation. Next, we go to the concept of Gulma related paper presentation. I would like to invite Dr. Jambavati for the paper presentation.
Myself, Dr. Jambavati, Assistant Professor, Department of Shalyatantra, Sri Kalabareshwara Swami Ayurvedic Medical College, Bangalore. Today, I like to present the paper on the topic Exploring the Concept of Gulma through Sushruta Samhita. So, to understand Gulma, if we look into the shloka given by Acharya Sushruta, Kupita Anila Mulatvat Udamulo Dayadapi, Gulamavatva Vishaladva Gulma Ityapi Diyate. Gulma is the one which is caused by Kupita Vayu. It is deep rooted. The word meaning of Gulma, means it is just like a shrub. Gulma Samprapti, due to the kopa of doshas, in the koshta, it will produce 5 types of Gulma. And then Rudbastayor Antare Grantihi. But that means Gulma is any mass that is situated between Hridaya and Basti Pradesha. This Granthi means it is a round mass. Sanchari va yadi achalaha. That means sometimes it is movable and sometimes it is immovable. Chayapachayavan, that means sometimes it may be increase in size and sometimes it may decrease in size. Such type of mass is called as gulma. 5 sthanas are told for gulma, just like the quadrants of abdomen mentioned in the modern classics. That is Hrudaya, Nabhi, Basti and Parshva. One more concept regarding gulma is that gulma is not attaining paka. That is explained in this shloka. Sa yasmad atmani chayam gachati apsu iva budbuda. Just like a bubble of water will grow on its own from inside and it is not having contact with other side. Gulma is made up of only of doshas, not of any dhatus. And it is also not attaining any paka. Purva Rupa of Gulma. Purva Rupa of Gulma includes Sadhana and Agnimandya, Atopa, Antrapujana, Vinmutra Nila Sangha, and then Vayar Urdhva. All these are the Purva Rupa of Gulma. Based on the doshas, it is classified into 5 types. That is Vataja, Pittaja, Kafaja, Sannipataja, and Raktaja. Vataja Gulma, the features will be Hrut Kukshishula. There is a dryness of Mukha Kanta, then Vishamagni, and Vataja Pratyatmaka Lakshanas will be there in Gulma, Vataja Gulma. In Pittaja Gulma, there will be Sveda, Jvara, Vidaha, Trushna, Angaraga, Katuvaktra. Such kind of symptoms related to Pitta will be seen in Pittaja Gulma. In Kafaja Gulma, there will be Praseka, Madhurasyata, Chardi, Aruchi, such and Pittaja Lakshanas will be seen in Pittaja Gulma. Sannipataja Gulma, all the kind of symptoms can be seen. Raktaja Gulma is a special type of Gulma that is explained. Navaprasuta, that is those who just delivered the baby. If they are indulging in Ahita Bhojana, then Vayu will get aggravated and it will lead to the formation of something called as Raktaja Gulma. It will have same lakshanas like that of Pittaja Gulma, but na spandate na rodate vruttim bhavati. That means it will mimic the pregnancy, but there will be no pulsation. But all the Garbhini Lakshana the patient will be having. After 9 months, there is no deliver of the baby. That is the Lakshanas of Raktaja Gulma. Gulma Upadrava. If Gulma is not treated, then it will lead to a condition called as Shula, which involves severe pain as if the nail has been struck inside. Chikitsa. For Vataja Gulma, the treatment explained are Snehana, Virechana, Astapana and Anuvasana Basti, Chitrakadi For Pittaja Gulma, Kakulya Snehana, Virechana, Madura Yoga, Niruha Basti, Kingu Adigruta. For Kafaja Gulma, Snehana with Pipalya Digruta, Tikshna Virechana, Niruha Basti and Rasona Digruta. So, Sannipataja Gulma is said to be Asadhya. Raktaja Gulma. So, Raktaja Gulma has to be treated just like Pittaja Gulma. And Palasha Kshara Jala, Pipalyadi Gruta, Ushnavirya Dravyas are helpful. If Raktaja Gulma will burst open, then Rakta Pradara Chikitsa should be given. Why Gulma is discussed under Shalyatantra mainly? Because it involves treatment of all the Anushastra Karma, that is internally Pani Prayoga, Kshara Prayoga, then Rakta Mokshana, Agni Karma, and all Udara Chikitsa also can be adopted in case of Gulma. So all the mass abdominal condition explained in the modern science can be understood in the similar lines. Discussion. Gulma is a unique concept in Ayurveda and it is difficult to establish an exact modern correlation for following reason. Gulma cannot be compared to tumor cyst because all tumor cyst will involve dosha, dhatus also, but Gulma, whatever explained in Sushruta, is only composed of doshas. Gulma cannot be compared to abscess also because Gulma is not attaining Paka according to Acharya Sushruta. And then some more features told by Acharya Sushruta, it is either movable or immovable. It may increase in size and it may decrease in size. Due to all these features, it is very difficult to correlate to exact condition. Conclusion. Gulma can broadly be understood as a condition presenting as abdominal mass However, an exact model correlation according to verses of Sushrutaracharya is not possible. Thank you.
Thank you, Doctor. Thank you for the well explained presentation. Next, we go to the another paper presentation. I would like to invite Dr. Sri Gayatri for the paper presentation.
Good evening. Myself, Dr. Sri Gayatri, second year PG scholar from Department of Kamarabritya, Sri Sri College of Ayurvedic Science and Research. Today, I am going to present a paper on the topic Impact of Caesarean Delivery on Breastfeeding, a Clinical Perspective. These are my table of contents. Coming to the introduction, breastfeeding is a crucial aspect of neonatal care, providing nutrients and promoting bonding between the mother and child. The WHO recommends early initiation of breastfeeding within the first hour of birth and exclusive breastfeeding for the first 6 months of life. However, cesarean section deliveries can delay the breastfeeding initiation due to factors like postoperative pain, reduced skin to skin contact, and maternal stress. These challenges often lead to lower exclusive breastfeeding rates. So, this presentation aims to provide a clinical overview of how cesarean deliveries influence the breastfeeding outcomes and discuss the evidence-based challenges and facilitators and highlight the role of healthcare professionals in promoting successful breastfeeding practices in post-C-section mothers. The importance of breastfeeding includes ensuring optimal nutrition and immunity, enhancing the emotional bonding, reducing the risk of infections and chronic diseases, and supporting the healthy growth and development of a child. Here, it highlights that breast milk is both acts as both food and medicine for the newborn. Coming to the physiology of breastfeeding is a neurodevelopmental reflex which involves two key hormones, namely prolactin and oxytocin. Prolactin is essential for milk production and is secreted by the anterior pituitary, which gets stimulated by the infant sucking and acts on the alveolar cells of the mammary gland to synthesize milk. Oxytocin, on the other hand, is known as the letdown reflex or the milk ejection hormone, which is secreted by the posterior pituitary, triggered by the infant sucking, touch, or even the baby's cry. It causes the contraction of the myoepithelial cells surrounding the alveoli, which pushes the milk into the ducts. So skin to skin contact here enhances the oxytocin release, and the early initiation within 1 hour, which is known as the golden hour, helps establish the hormonal rhythm and successful lactation. So what are the challenges faced in breastfeeding after a C-section? There is delayed initiation of breastfeeding, reduced milk production, difficulty with positioning and latching, limited golden hour opportunity, postpartum fatigue and incision pain, maternal infant bonding related issues, and influences of anesthesia and analgesia. So, when we see this, C-section is a surgical procedure which disrupts the hormonal cascade, which is essential for lactation. During the vaginal delivery, oxytocin and prolactin levels surge due to the uterine contraction, and the nipple gets stimulated, promoting the milk ejection and synthesis. In contrast, under C-section, which is done under general or regional anesthesia, blunts this neuroendocrine response, leading to delayed onset of mature milk production. Key findings from research also highlights that mothers who had C-sections often experience delayed milk production up to 5 days post-surgery, lower exclusive breastfeeding rates upon hospital discharge, and a greater need for psychological and breastfeeding support. So what are the facilitators which we can use to optimize breastfeeding? Early skin to skin contact, rooming in, which is the mother and the child are to be placed in the same room, effective pain management, supportive breastfeeding positions, counseling the mother and educating them upon different breastfeeding techniques, involvement of family and the partner, frequent breastfeeding and demand feeding, hospital policies which support breastfeeding, and kangaroo mother care. So, what is the role of us as healthcare providers for this? Encouraging rooming in and early skin to skin contact, managing the post-operative pain effectively, and offering practical lactation support, monitoring the feeding techniques and the infant cues, and educating on breastfeeding benefits post a cesarean section. So, what are the policies used for implementing C-section deliveries? With the rising trend of cesarean sections, current hospital policies must be reviewed to reduce the unnecessary procedures, C-section should only be done when medically indicated to save the life of the mother or fetus, and if no complications are present, a normal delivery should be encouraged to avoid risks associated with surgical birth. Now, moving on to the Ayurvedic perspective on the same, according to Acharya Kashyapa, similar to Amrita being produced during the Samudra Mantana as an essence of all Aushadhis, Sanya is formed as an essence or nectar in the kukshi of the mother and comes out through the breast. Hence, it is also said to be Jivanam, or one which gives life, and is referred to as Piyusha as it provides complete nourishment, strength, and increases the ojas. Also, according to Acharya Charaka, following the Navajata Shishu Paricharya, or the basic resuscitation procedure, Jatakarma Samskara is performed by giving Madhugrita Prashana to the child, and thereafter the child is allowed to feed milk from the right breast first. So this is a conclusion that Acharya Charaka believed that breastfeeding should be initiated as soon as the baby is ready to suck and the mother is well enough to be feeding. Now, how does Stanya Pravarti exactly occur? Stanya flows out by some sparsha or the touch, darshana or sight, smarana, that is just of remembering the child, grahana, lifting and holding the child. Since all of this is delayed post the cesarean section due to the time taken for suturing and anesthesia effect, it is essential that we look into early rooming in. Coming to the Samprapti, overall, first there is Dhatukshaya Avastha in the mother due to the labor pain and also due to loss of Rakta and Kleda. And since this is a cesarean section, there is also Kshaya of Mamsa, Bala and Agni during the delivery procedure. Here, for reduced Tanya Pravritti, the Nidana will be mainly the effect of anesthesia and the surgical procedure itself, which leads to Vata Pradhana Tridosha Prakopa, causing Jataragni Mandya, which causes vitiation of Rasa Dhatu, which indirectly causes the vitiation of its Upadhatu Stanya, leading to the delayed Stanya Pravritti. So how can we address it as Ayurvedic physicians? So here it is Acharya Kashyapa has mentioned the Stanya Janana Yogya Nari to be one as Shodhanadva Swabhavadva Yasya Kshiram Vishushyati, meaning a physician should give Stanya Janana drugs to those whose breast milk has dried up either by Shodhana or by Swabhava. So here, considering that the effect of the surgical procedure is on the mother by Swabhava, dietary modification is offered in the form of Deepana Pachana, which can be given with Jiraka water, Ajamoda Kashaya or Dashamula Katutraya Kashaya, which is followed by Anulomana with Methika, Triphala Churna or Avipattikara Churna. And once the mother comes out of the nilpar oral condition 8 to 10 hours after the delivery, Ahara, which is Kaphavardaka, Agnivardaka, Vatashamaka and Rasa Pradayaka is to be given, which are mainly Madhura, Amla and Lavana Rasa predominant. Also, Sevana of Shira, Gramya Anupa Udaka Mamsa, Shaka or vegetables, and Dhanyaka, which are cereal or pulses in the form of Yusha or Yavagu, is to be given. Also, when we come to the Aushadhi part, here we have to mainly address the Vata Prakopa which has occurred in the form of Basti Karma, which helps improve the Jataragni strength and vitality of the mother. And also Stanya Janana Mahakashaya can be administered here. Why Stanya Janana as such? Because here again by Swabhava there is drying up of the breast milk. So Stanya Janana will be the first one to be used. So this is the list of Stanya Janana which has been mentioned by Acharya Charaka. So here modern science gives unsatisfactory explanation regarding the galactotherapy, as in there is no straightforward therapy for increasing the breast milk. Instead, we give additional supplements. So in Ayurveda, in the concept of Ayurveda, the approach is more practical as there are certain drugs which are used extensively in day-to-day clinical practice and also as home remedies. So here we can see again that ginger or shunti, lashuna in the form of garlic or dhanyaka, coriander, jeeraka and cumin are all ingredients that we use every day in our kitchens. So all of this helps improve the breast milk. So coming to the discussion part, the cesarean section delivery presents unique barrier to successful breastfeeding, including delayed maternal-infant interaction, altered hormone responses, and increased dependency on clinical support. Hence, these factors necessitate a multidisciplinary approach to ensure timely breastfeeding initiation and sustained lactation. Concluding, enhancing post-cesarean breastfeeding outcomes requires early lactation support, skin-to-skin contact, and targeted maternal education. The Stanya Pravriti depends mainly on the Manasika bhavas of the mother, and lacunas exist in the contemporary remedies. Proactive evidence-based interventions can significantly help improve both the breastfeeding rates as well as the neonatal health. These are my references. Thank you.
Thank you, Doctor. Thank you for the insightful presentation. Thank you so much, Doctor. Next, we go to the another paper and poster presentation. First, we go to the paper presentation. I would like to invite Dr. Jyoti Baban Gunjal for the paper presentation.
Everyone, my name is Dr. Jyoti Gunja. I'm a PG second year student of Ayurveda department from Dr. D.Y. Patil, Ayurvedic College. For today's paper presentation, my topic name is a case study, the Ayurvedic management of cerebral palsy in children. Cerebral palsy is the leading cause of childhood disability affecting function and development. Cerebral palsy is defined as a non-progressive neuromotor disorder of cerebral origin. It cannot be correlated with any single disease or condition in Ayurveda, as it is multifactorial disease with clinical features of a wide variation. According to Bhagavad, it is classified in the disease categories of Surge and Garbhaj and Jatas type of diseases. The many types of and subtypes of CP, none has any cure. Here, an effort was made to treat a 4-year-old male child with spastic type of cerebral palsy using multiple Ayurveda treatment modalities. At the end of 3 months of treatment, Panchakarma procedure along with internal medication resulted in 10 to 5% improvement in the overall effect of therapy. Aim: the management of cerebral palsy in children by an Ayurvedic regimen and Panchakarma. Objectives: to study the efficacy of the Ayurvedic regimen along with Panchakarma in the management of cerebral palsy. Case study: a male patient of 4-year-old reported to the Komarbutte OPD of our college with the following complaints: unable to move left side of the body, seizures on and off. History of present illness: a male patient of 4-year-old reported to the Komarbutte OPD of college in July 2025 with the following complaint: unable to move left side of the body and seizures on and off. Allopathic treatment received but didn't get the satisfactory result. History of the past illness: no history of any major illness or any surgery. Drug history: received the muscle relaxant, injection Botox and injection baclofen. Family history: not significant. Birth history: full term, normal delivery at the hospital. The baby cried delay after the birth, require resuscitation, and ICU stay for 7 days with a birth weight 2.5 kg. Immunization history: all vaccines are given as per age. General examination: pulse was 104 per minute, BP 90 to 60 mg, temperature of febrile RR 22 per minute. Then systemic examination: RS is clear. MRI reports at the 8th month of age, 2 years, 2023, old white matter injury. In a EEG report, in 2023, focal epileptic activity over right occipital region. EG report of 29 November 2024, epileptical activity over right occipital region. Ongoing remedies from the 28th Feb 2024, injection Botox IM once in a month, injection baclofen IM once in 15 days, syrup Neurobion 4 5 ml BD, syrup Alporate 5 ml BD for seizure, and physiotherapy ongoing. Panchakarma treatment given in our OPD. Name of treatment: Sarvangasnehan with Balalakshadi tel, Swedan with Brahmi Growth Pratimarshanasya, 2 drops in each nostril, Nardi sweat. Then we give Vachachurna 125 mg, Brahmichurna 500 mg, Jatamansi 250 mg, empty stomach in the morning. Then oral treatment given: Sasradishtan 7.5 ml with Koshnajal BD. Brahmi Group 7.5 ml with Koshnajal HS, and then Ashtanga Group 2 gram with Koshnajal in morning. Discussion: parameter of growth, gynometric evolution to assess the range of motion, Ashwatha scale to assess the spasticity, spasm scale to assess the intensity of spasm and manual ability, classification system to assess the function of upper and lower limb were taken as the assessment criteria to observe the effect of the therapy. Ashwatha scale shows 20% improvement in spasticity. Spasm scale shows 25% improvement in this conclusion. In this patient, the overall effect was found near 10 to 15%. As this disorder is incurable, this percentage of improvement also helps the patient to improve the quality of life. Treatment of this kind of condition is improvement, and in that we are able to make small improvements in an earlier age, then it will be affects as a major benefit in later age in the form of developing skills. CNS have the ability to repair their neurons. We can conclude that Ayurvedic Panchakarma therapy along with appropriate internal medication can do for the betterment of the patient. References. Thank you.
Thank you, doctor. Thank you for the paper presentation. And one more poster presentation is there.
Okay, sir. My topic for the poster presentation is ADHD, Attention Deficit Hyperactivity Disorder. Attention Deficit Hyperactivity Disorder is a common neurodevelopmental disorder characterized by inattention, hyperactivity, and impulsivity that interferes with the functioning and development. ADHD affects children academically, performance, relationship, and self-esteem. Early identification and holistic management are essential. Inattention means difficulty in focusing, hyperactivity means excessive movement, and impulsivity means acts without thinking. ADHD can be correlated with the symptoms of Dhruti and Branch and Chanchalta of Manas. Predominant involvement of Rajas and Tamas dosh with Visheshan of Vata dosha. Dosh involvement Vata Ruddhi, Raja Ruddhi and Tamas Ruddhi. Mansik Bhav, Chanchalta, Asamyam and Vivekam. Samprapti, Aharaj and Viharaj Nidan means improper diet, sedentary lifestyle, excess screen time leads to Vata Prakop, and Agnimandya leads to Rajas, and Tamastruti leads to Dosha, and Mansik Doshti leads to Dhruti Smruti Pransha. ADHD Lakshanas, inattention, hyperactivity, impulsivity, of course. Then clinical features of ADHD: short attention span, easily distracted, forgetfulness, cannot sit quiet, toxicity, impulsive behavior, poor academic performance, mood swings. Differential diagnoses are learning disabilities, autism spectrum disorder, anxiety disorder, oppositional defiant disorder, thyroid dysfunction. Ayurvedic management principle: deepen pachan to improve Agni, Sroto Shodhan to remove channel obstruction. Medya and Manas Palya drugs, Sattva-Vaja Chikitsa, dietary lifestyle modification, Dincharya and Ritucharya. Medya and Manas Palya dravyas used in ADHD are Brahmi, Shankh, Pushpi, Yashti, Madhu, Vacha, and Tagar. Diet and lifestyle guidelines are sattvic, light, easily digestible diet, or junk food, excessive sugar, colors, preservatives. A regular sleep wake cycle, daily abhyanga and shiro abhyanga, yoga, pranayam, and medication. मन प्रसाद सौम्य मोनोमात्व विनिग्रह भाव संशुद्ध हृदय मानस समुच्चयते means mental tap consists of cheerfulness and mental tranquility, gentleness and calmness, silent when appropriate, self-control, purity of thoughts and emotions. ADHD management conclusion: ADHD management in Ayurveda focuses on balancing doshas, pacifying the mind, improvement concentration, and enhancing overall well-being of the child. A holistic and individualized approach can help the children lead a productive, harmonious life. Thank you.
Thank you, doctor. Thank you for delivering interesting and informative paper and poster presentation. Next, we go to the Rektamokshana and chronic skin disease related paper presentation. I would like to invite Dr. Abhijit Ganesh Maine for the paper presentation.
My session is role of Rektamokshana in chronic skin disorder review study. Introduction, sir. Skin diseases are among the most common chronic disorder affecting quality of life. Ayurveda consider many skin disorder under Kushta and Raktarushti. Rektamokshana is one of the important Shodhan procedure in Ayurveda. It is officially indicates in disorder involving Vaitet, Rakta and Pitta. Acharya Susruta described the Rektamokshana as अर्ध चिकित्सा. Aims and objective. Aim study to study the role of the Rathod in chronic skin disorder. Objective to understand the concept of the Raktadrushti, to review indication of the Rathod in Toka Vikara, to evaluate the modern scientific accept, to assess the clinical importance in the dermatological disease. Next, concept of the Rakta. Rakta Dhatu, one of the Sapta Dhatus, responsible for Jivana, Varma, Toka, Prasadana, Bala. Relation of the Rakta and Toka. Toka is considered Upadhatu, Mamas, and closely associated with the Raktadrushti commonly manifests through the skin disease. Next, Raktadrushti. Causes of Raktadrushti. विकृत आहार, एक्सेस कटू आम्ल लवण आहार, दिवास्वप्न, क्रोध, अल्कोहोल कंजप्शन, एन्व्हायरमेंटल फॅक्टर्स, सिम्टम्स, कंडू, दाह, राह, पिडिका, तोक, डिस्कलरेशन. नेक्स्ट, रक्तमोक्षण डेफिनेशन. Procedure of removing the vitiated blood from the body, therapeutic procedure mentioned in the Sushrut Sahita, Charak Sahita, Ashtang Hriday. Importance: eliminate vitiated rakta, pacified pitta, reduce inflammation. Next, types of Raktamokshan. Types मध्ये जलोकावचरण as a least therapy, श्राविद्ध, प्रच्छान, अलाभू आणि शृंग. Most commonly used जलोकावचरण in skin disease. Next, Jalagavcharan. Application definition. Application of mediclinical leech for blood leaking. Advantages: minimal invoice, safe, useful in delicate patients, effective in inflammatory skin disease. Procedure: पूर्वकर्म, प्रधानकर्म, पश्चात्कर्म. Next, indication of skin disease. Indication: Vicherica is eczema, Petabai kush psoriasis, the Dhuru, Yuvan Pidika is ENS, Pama, Chitpitta, Visarpa. Next, contraindication. Severe anemia, pregnancy, children and elderly, hypotension, bleeding disorder, civil disability. Mode of action: Ayurveda. Ayurvedic view: remove the dushta rakta, pitta shamak, proto, then reduce दाह, कंडू, रंग, importance, improve the local circulation. Mode of action of modern view: modern scientific. Leech saliva contains hirudin, choline, distablance, and halsuridin is effective anti-inflammatory, anticoagulants, analgesic, improve the microcirculation. Disease-wise application: psoriasis, this is Ekupushta, reduce scarring and inflammation. Eczema, Ayurveda considers Vivarchika, relieve the itching. Ants Vargalis, Yavan Pidika, reduce inflammation and cluster. Urticaria as a shit pitta shaman relief. Fungal infection, the Dhuru, reduce redness and burning. Non-healing ulcer, that is Dushtavarna, promotes wound. Next, research evidence. Clinical studies: significant reduction in itching and erythemic observed. Importance in PASI score is psoriasis, better wound healing in the and circulation. Research finding: anti-inflammatory effect proven. Local detoxification and congestion relief noted. Next, advantages: cost effective, minimal side effect, OPD based procedure, better patient compliance, useful in chronic recurrent condition. Next, limitation: requires sterile procedure, risk of infection, patient fear reading for leach multiple sitting needed. Next. Precaution. Use healthy leaches, maintain aseptic condition, proper disposal, monitoring bleeding time, avoid excessive bleed loss. Next, discussion. Chronic skin disorder involve Rakta and Pitta Rushti. Rakta mokshan direct target whited Rakta. Jalagauchar provides both Ayurvedic and scientific benefits. Can be used as adequate therapy in the Shamana Chikitsa with Shaman Chikitsa. Conclusion. Rakta mokshan is an important Shodhan therapy in the skin disease, especially effective in inflammatory and chronic Toka Vikar. Jalagauchar is a safe and clinically beneficial. More evidence-based studies are needed for wider acceptance. Reference: Susru Sahita, Charak Sahita, Ashtang Hruday, APA textbook, review journal article, Ayush research publication. Okay, thank you, sir.
Thank you, Doctor. Thank you for the insightful presentation. Next, we go to the another presentation. I would like to invite Dr. Nikhil Patil for the paper presentation.
Hello, good morning everyone. My name is Dr. Nikhil Patil from Ayurvedic Department from Dr. D.Y. Patil Ayurveda Mahavidyalaya and Research Center, Pimpri, Pune. Today I present my case that is named Ayurvedic Management of the with respect to Tinea corporis case study. Abstracts. The description in Ayurveda textbook shows marks similar of the Dhruva Tinea corporis. I have case of a 65-year-old male having erythematous patches on right leg since 1 year, came for consultation in OPD of Ayurvedic hospital. The treatment regimen, the erythematous patches, which was 7 centimeter as to 4 centimeter, later reduced to 2 centimeter into 1 centimeter after the 28 days of treatment. Significant result was not noted on subjective parameter, but treatment plan along with Raktamokshan therapy. Introduction. According to Ayurveda, all skin disorders are considered under the broad heading of Kushtavati. Acharya Sushruta has considered the two under Mahakushta and Acharya Charak considered under Shudra Kushta. Introduction. According to modern, Tinea corporis is superficial fungal skin infection of the body caused by dermatophytes. It is characterized by patchy red rash, typically present on exposure skin of the neck, trunk, and extremities. Single or multiple lesions, usually circular or awkward in appearance with patches and plaques. These angular lesions demonstrate sharp margination with a raised erythematous scaling edge, which may contain vesicles. The degree of inflammation is variable. The lesion advances centrifugally from a core, leaving a central clearing and mild residual scaling. This appears as a ring-shaped later tested. Presenting complaints a 65-year male having erythematous patches visited for erythematous patches visited for cardiac stoppage with severe itching, burning sensation, constipation, erythematous patches aggregated since 2 months. Past history, there is no history of hypertension or any major illness. हेतु कपकर R7 नित्याहार थ्रू मलचकृमि और द्रव स्निग्ध आम्ल लवण रसात्मक आहार अतिनिहार अष्टमिक परीक्षा नाड़ी 88 पर मिनिट मल मध्य मूत्र प्रभुत जीवा साम वेटी 65 थूक प्रकृत स्पर्श नॉर्मल शब्द नॉर्मल दशमिक परीक्षा दिन that is criteria for assessment that is Kandu if absent grade 1 mild grade 1 sorry, if active, that is grade 0, if mild, grade 1, if moderate, grade 2, if severe, grade 3. Same as Ranga, Purika, Taha, and Raktashaya. Given same grade as is grade 0, grade 1, grade 2, and grade 3. Therapeutic focus, line of treatment is Nidan Parivardan, Aam Pachan, Chidoshi Shamana, Rakta Shodhana, Pathya Palana, Yoga, and Pranayama. We treatment plan given as Nimbati Pata, each 5 gram, 40 ml a day. Rakta Mokshanavati, 2 at morning, 2 at evening. Gandagrasan, same as 2 as morning, 2 as evening. Anything, 10 ml at bedtime. All of this dravya in the Nimro Khadir Sariva, that is the Shitalagu Grahi, the Rakta Shodhana will act as a Rakta Shodhana property that improves digestion. Also, the Erenditela is for laxative, that is Anulomana. The combi other day 3 with the +3 gradation, later after the day 30, it is +1. Decrease the Kandu, also decrease the Rang, Taha, Purata, and Raktashad. Prepare and after images. That is the Shamana Chikitsa with the Rakta Mokshana. Is effective management in Tatru. It is the most suitable therapy for Kapha and Rakta Dosha is might be responsible for which are main cause of disease. In this case, significant symptomatic relief was observed. Patient is all sign and symptom free, doing all these activities by avoiding all dietary substances which can be cause of disease. After that, conclusion, Shamana Chikitsa with Nidana Parivarjan in the form of food shows remarkable symptomatic relief in the picture of Datru. This observation need to study in for a patient for better opinion to manage symptoms of Datru. Thank you.
Thank you, doctor. Thank you for the insightful presentation. Next, we go to the another paper presentation. I would like to invite Dr. Arsu Umesh Deswan for the paper presentation.
Good evening, everyone. Myself, Dr. Arju Umesh Deswal, second year PG resident in Patil College of Ayurveda from Department of Kamar-Bhritya. My guide is Dr. Sachin Bhagwat, sir. I'm going to present a topic here, Fakka Rog. Fakka has been defined as an inability of a child to walk even after the age of 1 year. The word Fakka denotes sluggish movement due to poor physical development associated with psychomotor changes. Fakka Rog is very important disease which happens in this childhood period and only described in Kashyap Samhita. Fakka Rog is a disease classified under Kuposhanjanya Vyadhi. Malnourishment leads to improper formation of rasa. Thus, the body tissue becomes nutrient deficient, which results Atidrava Malpravritti, Atimutrata, and improper utilization of Ahar Rasa. Finally, child becomes malnourished and Fakka Rog occurs. Major issues associated with Fakka Rogas are slothful movements, poor physical development, and malnourishment. Other lakshanas of Fakka Rogas are as follows: fever and dullness, excessive growth of abdomen, weakness and the chesta, astivakrata, bowed legs and knock knees, spinal deformities, and soft skull, etc. Classification according to the Ayurveda are of 3 types: Shiraja Pakka, Garbhaja Pakka, and Vyadhija Pakka. Shiraja Pakka is because of Stanya whited with kapha doshas called as Pakka Dugdha. This Pakka Dugdha cause obstruction in the Rasava Srotas and cause nutrition deficiency in children, resulting in Shiraja Pakka Roga. Treatment of Shiraja Pakka includes Mrudu Shodhan and Bruhanam therapy, Deepan and Pachan drugs, Snehan with Rajatel, Abhyantar Snehan with Kalyanak and Brahmigrit, etc. Garbhaja Pakka Rog, when nourishing Dhatri mother becomes pregnant during breastfeeding period, milk secretions become deficient, child becomes gradually after that the child's get disease and thin condition is called as a Garbhaja Pakka. Treatment of Garbhaja Pakka includes use of Agni Deepan Chikitsa, which helps to control Parigarbhika. Deepen and Pachan Dravyas, including Siddha with Vidari, Yava, Gaudhum, Pipli, and Grita may be recommended. Anupan rich in milk with honey and sugar helps to manage the factor associated with vitamin deficiency. Third is Vyadhija Fakta. Improper care and treatment for this, some diseases leads to emaciations with improper formation of metabolite dhatus. This leads to severe malnourishment associated with weak limbs as well as mobilization of subcutaneous fat from gluteal region, chest, and extremities. This condition of children is known as a Vyadhij Pakka. Treatment of Vyadhij Pakka is the nourishment of the tissue decreases due to Manda Agni and Dushta Grahani, which further leads to Sara Sahanan deterioration. The treatment approaches involves consideration of Ketu and its management, consumption of nutritious food, Shirapaya, Leha Dravya, and Kalpa should be recommended, like Samvardhan Growth. General treatment approaches for Pakka Roga is Shodhan Karma, use of Tirka Chakra for Pakka Ratha, physiotherapy, Abhyanga Basti, Snehapan, Svedan, and Udavartan, Doshanusar Chikitsa, Gritpan, Bruhanam Dravya Sevan, medicated milk sevan, Pachan Dravya Sevan, and Deepanya Dravya Sevan. Ayurvedic formulation used in Pakka Rogas are Samvardhan Growth, as described in Lehan Adhyay, is successfully prescribed, like Mukta Pishti, Shukta Pishti, Kamadugdha Ras, Triphala Churna, Ashwagandha Arishta, Ashwagandha Churna, Amlaki Rasayan, Mahanarayan Tailam, Ashwagandha Avleha. Balasnehan can be accomplished with Rajatel, Abhyantar Snehan with Amruta Grita, Kalyanaka Grita, Shatapala Grita, Brahmi Grita for 7 days can be internally done. After followed by variation can be done with Tibrutta Shir Basti. Basti is best during this period with the predominance of Vata doshas and Masa as well as Vata Rakshana Dravya. Deepana Dravya like Rasna, Madhuka, Siddhagrit, then Pachan for Srutashodan. Milk mixed with the Gomutra for Panadan. Bruhanam Dravya includes Masa Rasa and Shira Siddha. Shatapushpa is indicated. Ahar and Vihar suggested for treatment of Kapha Roga includes exposure to sunlight, consumption of whole grains and beans, dry fruits, almonds and walnuts, fresh fruits and vegetables, tea and coffee should be avoided. Pakkarat has been advocated, which is specifically made by a skilled and technical person, should be manufactured in order to support the disabled balak. This can be resembled by a physiotherapy model. Discussion includes Pakaro is a growth and developmental deficiency. It can also be correlated with protein energy malnutrition, marasmus, rickets, or chronic malabsorption condition. Most of the characters are correlating with marasmic child. Shiraj and Garbhaja Pakka can be classified as an acute malnutrition, while Vyadish Pakka is a state chronic malnutrition with general disabilities and reversible motor disabilities owing to malnourished states. Thank you. Now I would like to present my poster presentation. My poster is on temper tantrums in preschool children's. Introduction. Temper tantrums are commonly in preschool children aging from 1 to 5 years and are part of normal neurodevelopmental. From Ayurvedic view, tantrums reflects imbalances in doshas, Agni, and Manas, along with the parenting and environmental factors. Ayurveda offer a holistic approach addressing root cause, not just symptomatic. What are temper tantrums? A sudden episode of intense anger, frustrations, or irritability, often expressed through crying, shouting, hitting, throwing, or refusal to cooperate. Modern understanding can be overviewed as common between aging 1 to 5 years, triggered by fatigue, hunger, overstimulation, inability to express needs, part of emotional brain development, childlike impulse control, and verbal skill, usually self-limiting but impacts family dynamic if frequent severe. Nidana includes dosha imbalances. Vata pradhan leads to instability, restlessness, fear, insecurities. Pitta leads to irritability, anger, intensity, impatience. And Kapha leads to stubbornness, attachment, resistance to change. Other Nidan includes uh, change in dinacharya, ruksha tikshna ushna ahar, excessive skin exposure, parental factors, nidranash, and adhika raja and tamasa. Samprapti includes Nidan Sevam, leading to Dosh Prakopas, Manavah Srota Dushti, leading to Raja and Tama Prakopa, leading to Mansik Vikar. Vata increases causes restlessness, Pitta increases causes Krodha, then intolerance. Manavah Srotas get whited and affect Manas. Raja and Tamagun Vriddhi leads to child become irritable and aggressive, leads to loss of self-control and leading to temper tantrums. Dushya involves a Rasa, Rakta, Majja Dhatu, Mas, Medha, Sattva, Ojasa. Sign of dosha involvement when the vata is involved, there is frequent crying, fearfulness, clinginess, restlessness, sleep disturbance, inconsistent behavior. When the pitta is involved, there is an anger, shouting, irritability, heat in body, intolerance, competitive, and perfectionist. When kapha is involved, stubbornness, laziness, attachment, slow to adjust, and jealousy. The treatment includes Nidan Parivarjana, establishment of regular routine, avoid of junk food, excessive sugar, artificial colors, limit screen times, ensure adequate sleeps, and create calm, loving environment. Ahar Chikitsa can include, we can add sattvic, warm, freshly prepared food, includes ghee, milk, shatavari, almond, dates, avoid stimulants like caffeine, chocolates, and cold drinks. Dinacharya and Ritucharya can be adapted by doing Abhyanga oil massage daily, which calms walk, Vata, warm bath, regular sleep, week cycle, outdoor play in nature, yoga and breathing exercise. Manas Chikitsa, like positive parenting, avoid excessive praise or criticism, provide choices, not order, stay calm during tantrums, storytelling, bhajana, or satsang. Aushadha and yogic supports like Medhya or Manas Shamak Dravya can be used like Brahmi, Shankapushpi, which improves his memory and calm minds. Jatamansi that reduces irritability. Vacha, which enhances speech and comprehension. Ashwagandha reduces stress and improves resilience. Yoga and pranayam like Bhramri, Nadi Shodhan, Shitali, Balasana, and Vajrasana can be done. Integrative approaches like we can include Ayurveda as well as modern therapy. In Ayurveda, balances doshas, nourishment of dhatu is done, which stabilizes manas and promotes sattva. In modern therapy, behavioral engagement, positive reinforcement, play therapy, communication and training, combining ancient wisdom with modern science for the holistic healing. Tantrum response guides for the parents what to do. Parents can stay calm and patient, ensure the safety of the child, acknowledge feeling of the child, distract gently, offer comfort, and redirect to the positive activity. What parents should not do: do not shout or punish, do not ignore completely, do not give into every demand, do not label the child, or do not compare with others. Tantrum cycles and breaking the cycle, trigger like hunger, fatigue, frustration, etc., leads to the emotional overload, which leads to the tantrum episodes, and then again learning and calming. This cycles goes on. Then phase Sapnot, most probably we see the child of 3.5 years old with daily tantrums, anger, and sleep. Interventions like Nidan Parivarjan, Abhyanga, Sattvic diet, Brahmari, Grita, positive parenting, yoga practice should be done. Outcome in 6 weeks, we see the result like reduced tantrums from daily to occasional, better attention and behavior. Conclusion, temper tantrums are not merely behavioral issue but signal of deeper imbalances. Ayurveda helps in identifying root causes and treating them holistically through body, mind, and behavioral intervention. An integrative approach ensures long-term emotional regulations, strong parents-child bonding, and overall well-being. Thank you.
Thank you, Doctor. Thank you for the well-explained paper and poster presentation. And next we go to the another paper presentation. I'd like to invite Dr. Prathamesh Manoj Kumar Bora for the paper presentation.
Good evening. My paper presentation topic is Panduroga in children, an Ayurvedic aspect on pediatric anemia. Myself, Dr. Prathamesh Bora, second year PG scholar, Department of Home Ayurveda, Dr. D.Y. Patil College of Ayurveda, PM3. What is Panduroga? Pandu, yellowish discoloration, a disease of Rakta and Rasa Dhatu manifesting a pallor, weakness, and fatigue correlated with anemia in modern medicine. Impact on child health, decreased cognitive development and academic performance, decreased immunity that causes recurrent infections, decreased physical growth and weight gain, and increased morbidity and school absenteeism. Ayurvedic significance, Pandu is described as Raktasha Janyavikar, a disease of depleted blood, mentioned in all classical texts with specific pediatric aspects. Pediatric correlation, nutritional anemia is the most prevalent form in children, 6 months to 5 years. Ayurvedic management addresses root cause Agni and Dhatu. Why Ayurveda? Holistic approach Nidan Parivarjan plus Shodhan, Shaman, and Rasayan offers comprehensive and safe management for growing children. Classical references Pandutvat Panduroga, named as Panduroga due to predominant symptom of Panduta. Charak Samhita reference Chikisastan chapter 16 Pandurogi Bhavati Astuhu describes types of Pandu, Pitta predominant etiology, Aharaj causes like Amla, Shar and Lava. Chikisa includes Loha, Amlaki and Rasayan. Shushu Samhita reference Uttar Tantra chapter 44 Rasasruk Dayav Dhatava Shiyante explains Raktava Srotas Dushti, emphasizes Sira Mokshan in adults, mentions Mrittika Bhakshan Janya Pandu specific to pediatric consent. Ashtangridaya Nidan Stan chapter 30 Shine Rasahe Raktamapi Shayeti Rasakshay causes Raktakshay. Wagbhat elaborates on Samprapti clearly, mentions Am Vish as a causative, Brihan, Dipan, Pachan and iron rich herbs from the management. Aharaj Nidan etiology, Aharaj Nidan, excess Amla, Lavan, Kshar intake, Viruddhahara, incompatible foods, nutritional deficiency, malnutrition, excessive junk or processed foods, Abhishandhi or Guru Ahara. Mansik Nidan of Pandurogas, Chinta, Bhay means fear, Krodh, anger, Shok means grief, mental stress. Viharaj Nidan, Devaswap means sleep in the daytime, Ativayam, excessive exercise, Vega Vidharan, suppression of the Vegas, irregular food habits, and sedentary lifestyle. Pediatric specific worm infestation, that is creamy, recurrent infections, poor feeding practices, premature birth or low birth weight babies, maternal malnutrition. Samprapti, Nidan Sevan causes Agni Mandya, causes Am Utpatti. Other Nidan Sevan causes Rasa Dhatudushti, that is causes Raktashay, cause Manduta. Dosh Dusha involvement, Dosha Pitta Pradhana, Vata and Kap Anubandha. Dusha Rasa Rakta primary dhatus. Agni Jatragni Mandya, Dhatu Vaishamya. Srotas Rasavah Raktavah Annavah Srotasa. Component and Samprapti Ghatak. Dosha Pitta Pradhan, Vat Kap Anubandha. दुष्य रस रक्त धातु अग्नि जाठराग्नि भूताग्नि मांद्य आम विषय रसवह स्रोतस स्रोतसः रसवह रक्तवह and अन्नवह स्रोतः उद्भव स्थान of the Pandu is Amasha and Pakvasha अधिष्ठान रस and रक्त धातु व्यक्त स्थान त्वक अक्षि नख and mukha that causes yellowishness. Lakshanas general lakshan Panduta pallor of skin Daurbalya general weakness Shrama easy fatigue levity Aruchi, anorexia or loss of appetite, Brahma, dizziness or vertigo, Haridra Netra means yellowishness of eyes. Pediatric features, irritability and crying space, poor concentration in school, growth and weight retardation, increased fatigue during play, poor appetite and food refusal, Paika means Mrittika Bhakshan, severe symptoms, Shwas, breathlessness, Ridrava, palpitation, Shop edema, Murcha means fainting episode, Kshina Agni means poor digestion. Panduroga classification. There are 5 types of Panduroga. First, Vatash Pandu, Vata predominant, dry, rough skin, blackish or grey color. Second is Pittash Pandu, Pitta predominant, yellow or green tinge, fever, thirst and burning. Kafash Pandu, Kafash predominant, white pallor, heaviness, edema and cold. Fourth is Sanni Patash, all 3 doshas are involved, mixed features, poor prognosis. And 5 is Mridabhakshajanya Pandu, Pica or Zoochopagia in children, worm infestations common in pediatrics. Types Vata, roughness, dryness, tremors, and pain in bones. Prognosis of Vata Pandu is Sadhya, is curable. Pitta Pandu, key symptoms fever, thirst, burning, loose stool, and fainting. Prognosis of the Pitta Pandu is Sadhya, curable. Kafaj, edema, heaviness, nausea, cold, excessive sleep. Prognosis is Sadhya. Sannipataj, all features combined, severe presentation. Prognosis of the Sannipataj Pandu is Kricha Sadhya. Britika Janya, Pika, worm infestation, abdominal distension. Prognosis is Sadhya, creamy. General Ayurvedic medicine principles. Chikitsa Siddhant, Nidar Parivarjan, remove causative factors first. Deepan Pachan, Agni, digest armor. Shodhan, mild virechan, purification. Thereafter, Brihan, nutritive and anabolic therapy. And Rasayana, regeneration and Raktavardak medicine should be applied. Panchakarma in Pandu, Virechan, mild purgation of Pitta type Pandu. Aragvat and Trivrutta should be used. Basti, Anuvasana and Niroha Basti in Vat predominant cases. Tikta Kshir Basti should be preferred. Treatment algorithm, diagnosis of Pandu Roga, identify dosh pradhanya, deepen and pachan for 7 to 14 days, shodhan if indicated. Thereafter, shaman aushadha should given and rasayan therapy. Formulation. There are some formulations used for the Pandu. Punarnava Mandur, Navayas Churna, Dhatri Lohasav, Draksha Rishta, Amlaki Rasayan, Guruchi Swaras, and Pipli Prasayan. All these combinations should be used in Pandu. R and VR, Patyahar, green leafy vegetables, palak or methi, pomegranate, dadim, raktavardak, dates, raisins, anjeer, jaggery means good natural iron source, ragi, high calcium and iron content, sesame seeds, in Ayurveda, til, brihan, and iron rich food, amlaki, highest vitamin C, enhances iron absorption, Godugdha, cow's milk, brihan and anupana, fish, meat, soup, mouse rasa in non-vegetarians, apatya ahara, junk food, ultra processed food, viruddha should be avoided. Excess store, spicy, salty foods, tea, coffee with meals should be avoided. Pathya vihara, adequate sleep, ratri swap means 8 to 10 hours for children. Regular outdoor activities and play, avoid diva swap. Proper meal timing, niyamit aharakram, and personal hygiene, deworming every 6 months. Conclusion: Panduroga is highly prevalent in the pediatric age group and requires prompt recognition and holistic management. Ayurveda provides a comprehensive framework from Nidan to Chikitsa, addressing root causes rather than just symptoms. Aharvihara modification from the cornerstone of treatment, emphasizing iron-rich Raktavardhak fruits and lifestyle correction. Rasayan therapy, Amlaki, Guduchi, Loho compounds offers safe, effective long-term management with added immunomodulatory benefits. Early diagnosis and integrative Ayurveda plus modern approach yield significantly better outcome in preventive, cognitive, and growth sequence. Ayurveda heals not just the body but the root. For children, this means a healthier tomorrow. Thank you.
Thank you, doctor. Thank you for the paper presentation, and one more poster presentation is there.
Yes. My poster presentation topic is liver abscess, Yakrit Vidradi in children, manifestations and management. Definition: localized collection of pus within the liver tissue resulting from bacterial, parasitic, or immune-related infection. Types of the liver abscess: there is pyogenic liver abscess, amoebic liver abscess, and tubercular liver abscess. But the most common is amoebic liver abscess. Causes: portal vein pyremia, bacteremia, biliary infections, invasive procedures, and immunosuppression. Clinical presentations of the liver abscess. Signs are the hepatomegaly, rebound tenderness, and icterus. Symptoms: fever with chills, abdominal pain, right hypochondric abdominal pain, nausea, vomiting, anorexia, and weight loss. Diagnostic evaluation should be laboratory investigation, CBC, amoebic serology, blood culture, inflammatory markers, that is CRP and ESR, and LFT. Radiological investigation, chest X-ray, elevation of right hemidiaphragm or pleural effusion, USG, hypoechoic septation, CT scan. Risk factors are the pre-existing conditions or underlying hepatobiliary pancreatic disease, regular use of PPI, immunosuppression, and geographical factors, that is tropical region. Complications: rupture, sepsis, intra-abdominal spread, pleural effusion should be there, portal vein thrombosis, biliary obstructions, and recurrence. Differential diagnosis: hepatitis, right lower lobe pneumonia, biliary pathology, hepatic hiatus, hepatic hematoma, and liver tumors. Management: antibiotic therapy, antiprotozoal therapy, antifungal therapy, and the percutaneous drainage, surgical drainage, follow-up imaging, and the treatment of underlying cause. अंतर्विद्रदी सान गुदे बस्ती मुखे नाभ्यः कुक्षी भयनस्तोतः वक्रयकृति प्लीह हृदय वातः. Thank you.
Thank you, doctor. Thank you for the well-explained contribution. And next we go to the another presentation. I'd like to invite Dr. Saujanya J for the paper presentation.
Good evening all. Myself Dr. Saujanya, Associate Professor from Department of Kaya Chikitsa, SDMIH Bengaluru. Also pursuing PhD from Ayurveda Mahavidyalaya, Hubli. Today's topic is a comprehensive Ayurvedic management of tennis elbow, a case study. So what is tennis elbow? It is a syndrome which encompasses lateral, medial and posterior elbow symptoms. Especially it is called as lateral tennis elbow when we consider about lateral epicondylitis, and mainly characterized by pain, swelling on lateral side of the elbow joint with difficulty in gripping and lifting object. The main result is from repetitive stress. So the etiology goes on faulty playing techniques and repetitive extension of elbow joints. Usually tennis players are affected with this tennis elbow, but also non-tennis players such as cricketers, a great icon Sachin Tendulkar, Sehwag and all were affected with tennis elbow, and also non-cricketers who plays throw ball, which mainly affects elbow joint, may also get tennis elbow when the playing techniques are faulty in nature. Except from the sports group, even the non-sports group of people like computer professionals, homemakers, painters, miners, drill workers and carpenters may also prone to get tennis elbow due to repetitive extension of elbow joint. So any profession where there is repetitive extension of elbow joint, and in sports players where there is faulty playing techniques, one can end up with tennis elbow. Clinical features are very simple to understand. There will be pain, swelling, and difficulty in lifting and gripping the objects in affected elbow joint. So the affection is only pertaining to elbow joint here. Mainly there are two clinical examinations a clinician should perform, that is Cousin test and Mould's test, to diagnose a condition called as tennis elbow and to confirm it, because none of the specific investigations can say this is a condition of tennis elbow exactly. So Cousin test is mainly to check for lateral epicondylalgia or epicondylitis. Positive findings will be sharp, sudden pain or weakness in lateral epicondyle. Whereas Mould's test is confirmatory test to confirm the clinical diagnosis of tennis elbow, where there will be sudden sharp pain in lateral epicondyle. So the main management here goes on RICE therapy, that is rest. First and foremost, important in case of any sports injury such as tennis elbow is giving rest to the affected joint. Second is ice therapy. Third is compression therapy, and the last one is elevation therapy. When all these things fails, then one has to plan for physiotherapy. Even when physiotherapy doesn't work, then oral conservative management plays an important role, where oral analgesics, oral NSAIDs, then steroidal injection, local anesthetic injections will be useful, but only in 40% of the cases. And when these people doesn't respond to any oral or conservative management, then we will perform Mills maneuver, but only 10% will perform, whereas most of the subjects require surgical management. So with this background about tennis elbow, I'll be presenting a case of male subject age 36 years, software engineer in occupation, non-diabetic, non-hypertensive with no history of surgery and trauma, approached OPD with chief complaints of pain and swelling in right elbow joint since 1 month. The nature of pain is due to repetitive stress to right elbow joint. On examination, tenderness was present in right elbow along with swelling, and range of movement was painful. So patient has undergone contemporary management but couldn't able to find satisfactory results, hence approached Ayurvedic clinic. Systemic examination of CVS, RS, CNS, GIT, integumentary and urogenital were intact, whereas musculoskeletal examination of the affected joint, right elbow joint, swelling was present. There was no scar, discoloration, ulcer or deformity. On palpation, tenderness was present in right elbow joint. Range of movements, that is flexion and extension, were affected. It was painful. Both Cousin test and Mould's test was positive in this case. So assessment criteria have been made based on visual analog scale, which was 8 out of 10, which indicates severity in nature before the treatment, whereas swelling by means of verbal rating scale, where it was 4 out of 10, which was moderate in nature, and mainly criteria is PRTEE, that is patient rated tennis elbow evaluation scale, which was 56 out of 100 in before treatment score. So the treatment adopted was a very simple line of treatment of Sthanika Svedana for 7 days with Rasna Valuka Sveda and internally Nirgundi Gugulo of 1 TID, 1 tab of 250 mg each after food for 7 days, along with Rasna Erindadi Kashaya 15 ml thrice a day with 30 ml warm water after food. So after 7 days, there was improvement in pain, tenderness, swelling, and ROM was improved. So discharge advice was Nirgundi Gugulu 1 BD after food, Rasayana Rendadi Kashaya 15 ml BD with 30 ml warm water after food, and review was there after 30 days. After first follow-up, Nirgundi Gugulu alone have been given for 1 OD, that is 1 in morning after food, and after 30 days of review, there was no medicines for 3 months, and after 3 months, patient was absolutely normal. So these are the pre and post assessments where pain by VAS was 8 before treatment, during it is 4, after treatment it is 2, and after follow-up of 30 days it was 0. Swelling by VRS it was 4 initially, reduced to 2, then 0. And PRTE from 56 have been reduced to 32, and it was 10 after treatment and being 0 after the follow-up. So discussion mainly here, Sthanika Valuka Sweda have been selected being Swedana, that is Shulahara, Stambahara and Shotahara. Mainly Rasna Churna along with Valuka Sweda have been selected as Rasna Vataharanam Shreshtaha, which is best in case of any Vata Roga, which is again Shulahara, Shotahara. And Nirgundi Gugulu, both Nirgundi and Gugulu have properties of Shulanashana, Shofanashana, Vatakafahara, and Gugulu also acts as Rasayana. Whereas Rasna Erendadi Kashaya does Vatahara, Amapachana, Kafahara, Shulahara, and Shofahara. So entire drug and selection of treatment was Shotha Shulahara along with Rasayana in nature. So to conclude, in the present case study, a male patient of age 36 years diagnosed case of tennis elbow was treated successfully by means of potent Ayurvedic external therapy and oral medications. The subject showed significant improvement without any adverse drug reaction, demonstrating the effectiveness of Ayurvedic treatment modalities managing such painful relapsing condition. This is a single case study where further many case studies should be done to confirm the treatment by means of Ayurveda. These are the references. Thank you.
Thank you, Doctor. Thank you for the well-explained presentation, and we appreciate your effort and dedication. Next, we go to the another paper presentation. I'd like to invite Dr. Rachana J for the paper presentation.
Good morning, everyone. Myself, Dr. Rachana J, first year PG scholar from the Department of Kamarabrithya. My topic today is regarding the child nutrition, feeding the future, the power of child nutrition. As every parent desires a healthy child, nutrition plays an important role. A healthy child to a healthy environment is the main focus what we have to be presenting up in the present environment. So these are my contents. Introduction into investing in the early childhood is the necessary surface strategy which will be having up the future benefits that are said to be very much high. So the word nutrition is derived from the word nutrient, which means to feed, nourish, support or foster. So child nutrition has to be majorly focused during the first 1000 days of the life, which will be starting up mainly from the last menstrual cycle till the second birthday of the baby, which is called as the golden window. So during this period, the brain development, body growth, emotional well-being and immunity, future health of the child will be mainly focused up. So during this window, it is very much necessary for the baby to be taken up very well. So then we have the principles of the balanced diet. So mainly when you come across, food is divided into 5 major groups based upon the starchy materials. Group 1, group 2 being fruits and vegetables, group 3 containing regarding the dairy products, group 4 containing regarding the protein food supplements, and group 5 containing of the foods and drinks, which is mainly consisting of the sugar amount. So you have to be making sure that not all these portion size are said to be equally distributed. The servings are said to be equally distributed. So the only difference in the age wise is said to be the portion size will be increasing as the child grows. The nutrient requirement will also be increasing up. The next one is said to be the food square. So food square and the group 5 division, what is the major thing is food square is said to be division into the 4 groups, which is as the energy requirements, body building, protective functions. In that way it has been divided for the purpose of understanding, whereas the group 5 division is mainly for the diet planning, and it is scientific and specific in nature. When we come across the Ayurvedic concept of Ahara and the Poshana, Ahara is a Mahabhaishajya and it is one among the Trayopastambha, and it is mainly acting as a diet only when it fulfills dosha samyata, pathya, hita and that of manasa priyam. So samskaras play an important role in the purpose of nutrition also. Balyavastha being the rapid time period during which the sambardhana takes place. So Vayanusara portion is said to be very much necessary. So now we'll be seeing up regarding the nutrition from the prenatal till the adolescent period. Prenatal nutrition in both Ayurveda and modern, they say that the pregnant women, whatever the ahara she is said to be feeding up, taking up, that will be helping for the growth and development of the baby and also for her. Whereas Ayurveda says up the other important factor also, which will be used for the pushti of sthana also. In case of infants, when we come across 0 to 12 months is the group, both of the sciences says up regarding 0 to 6 months, exclusive breastfeeding has to be given up with the addition of infant feed if the mother is not been fulfilling the needs of the baby. And after the end of the 6 month, complementary feeding or the weaning has to be started up, where you will be basically using up the home-based food substances itself, which is like mono cereals, starting from mono cereals, then later on going up with the multi cereals and the combination of wheat pulses, vegetables, etc. So mainly the cereal choices can be rice, ragi, millets, etc., which is the first choice. And later on in Ayurveda also the same concept being said, prashana being the first step which has been indicated. Later on they'll be starting up regarding the stanapana and falaprashana at the 6th month, and either 5th or 6th or 10th month annaprashana. So falaprashana because the starting of other rasa, because the baby will be samya to the ekarasa. And then coming to the school, preschool and the school age group, so they'll be mainly concentrating of the food articles based upon its appearance and the texture. So we have to be maintaining that there is no nutritional deficiencies occurring in such age group of the people. So we have to be giving up 3 meals with 2 to 3 planned nutritious snacks, where the 5 kinds of food for the 5 times 5 colors with the 5 food groups has to be given up properly. So primary school children will be nutritiously sufficient, whereas secondary school children will be making up certain choices, so they'll be deficient in nature. In case of Ayurveda, they say regarding the same concept of palaprashana, annaprashana, and another with the proper balance diet. Adolescents will be mainly making up their own choices, which will be having up the nutritional deficiency with the engaging of other fast food, soft drinks, and sweet substances, which will be causing up the deficiencies. Ayurveda says lehya, pochya, and pehya ahara with ashtavida ahara with the visheshayatana can be given up. Government policies like ICDS has been implemented, which will be mainly targeting for the health and nutrition of the children from 0 to 6 years with the complementary nutrition, vitamin A, folic acids, immunization, health checkups, Poshan Abhiyan and midday meal scheme, which is also an important factor that has been presented by the government, where they'll be mainly combating the malnutrition and that of the hunger of the children with the improvement of school attendance of the children. So here in Poshan Abhiyan, Poshan trackers will be tracking up the nutrition status of the child with the supplementary nutrition through the Anganwadis. So the object is, as I said earlier, prevention of the malnutrition, undernutrition, stunting, etc. will be reduced. A midday meal scheme where they'll be giving up the region specific foods, and it will be helping to prevent the hunger and increasing the school attendance among the children. So that is the thing. So hence the end is nothing but the child nutrition is very vital for the growth, immunity, and the cognitive development. So both the science approach is same, but the implementation has to be done in such a way that both the science are said to be merged up, giving up the benefits to the child. So therefore integrating both of them will be giving up a holistic, culturally acceptable and sustainable framework to combat the malnutrition and promote the lifelong health of the child. So conclusion is, good nutrition is very much necessary for the child future, as we know that the young age malnutrition will be leading to the future obesity. So that has to be prevented. Holistic approach has to be taken into care of, and also we have to make sure that the family, schools, governments, and NGOs should work together. And improving the child nutrition is not just a health issue; it is a social and economic priority. These are the references. Thank you.
Thank you, Doctor. Thank you for the energetic presentation. Next, I would like to invite Dr. Hrishikesh Behra for the paper presentation.
Good evening, everyone. Today I'm going to present on Churna Kalpana, one of the most important dosage forms in Ayurveda. Churna refers to finely powdered medicine preparations from dried herbal, mineral, or animal origin drugs. Due to its ease of preparation, administration, quick absorption, and longer shelf life, Churna Kalpana holds a significant place in Ayurvedic pharmaceuticals. So let us explain some of the principles and about certain Churna Kalpanas. As the time is restricted, I am going to only 3 Churna Kalpanas. One is Hingwadi Churna. Second one is Eladi Churna. Third one is Dadimastaka Churna. Coming to Hingwadi Churna. Hingu, Granthika, Dhanya Jiraka, Vacha, Chavya, Agni, Patasati, Vrikshamlam, Lavanatrayam, Trikatakam, Ksharadvayam, Dadimam. So among these references from Gulma, Urdhwaga Chikitsa, Udvata Chikitsa, and coming to the ingredients of this Hingwadi Churna. Hingvadi Churna. We're coming to Pipali Mula, Dhanika, Jirika, Vacha, Chabya, Chitraka, Patha, Sati, Vrikshamla, Saindhava Lavana, Savachala Lavana, Bida Lavana, Shunti, Pipali, Maricha, and two Vriksharas, Yavakshara, Sajakshara, Dadima Bija, Pathya, Puksharmula, Pushkarmula, Vetasamla, Hapusha, Ajaji, Svetachiraka, Adrika Rasa, and Bijapura Rasa. Coming to the preparation, all the ingredients should be taken in equal parts and powdered together. The powdered ingredients should be processed with juice and with lemon juice and dried in sun, then soaked in Mathulangasvarasa, dried and then powdered. Anupana should be taken orally before food. Dosage is 1 to 3 grams before food with warm food. Coming to the indications of this Hingvadi Churna. Coming to Admana, Grahani, Ashwas, Gulma, Udavarta, Ashmari, Toni, Pratitoni, Arochaka, Urustamba, Chitravibhramsa, Manasika Vikaras, Badhirya, Asthilaka, Pratyasthilaka, Hrid, Kukshi, Parikshana, Katishula, Udarashula, Astishula, Stanyashula, Urashula, Parshashula, Vatakapachashula, and Mandagni. Coming to contraindications, it is best not advised to hypertension patients as it contains a lot of salts, and also infertility patients contains Kshara as ingredient, which is causes depleted sperm quality and quantity. So it's contraindicated in both infertility patients and also in hypertension patients. Coming to in practice, we will generally Hingvadi Churna is taken along with Takara for Grahani and IBS symptoms, and Hingvadi Churna with Jirakadya Arista can be given in Mandagini with bloating symptoms, and excellent Amavata digestive corrector also before any Shodhana therapy. Coming to the differences between Hingvadi Churna and Hingvastic Churna generally in practice, we will take dosha effect. Hingvadi Churna calms Vata and Pitta, and Hingvastic Churna balances three doshas. And strength-wise, Hingvadi Churna is stronger and Hingvastic Churna is mild. And purpose, it is given in treatment purpose, Hingvadi Churna, and Hingvastic Churna can be given as preventive purpose. In Ama also, it is strong. Hingvadi Churna is strong in Ama digestion, whereas Hingvastic Churna is moderative in action. In Grahani, Hingvadi Churna is best and Hingvastic Churna is supportive only. And Hingvadi Churna cannot be given not ideal for long term because it contains lavanas and ksharas in it, whereas Hingvastic Churna can be safe daily. And Chitraka is not present in Hingvastic Churna, and lavanas, Trilavanas are present in Hingvadi Churna, and Saindhava Lavana is only present in Hingvastic Churna. Next, coming to the research updates regarding Hingvadi Churna, drug review of Hingvadi Churna and Ayurvedic formulation for disorders of gastrointestinal activity. So there are many the ingredients, each ingredient have specific action and hepatotic action, anti-hyperglycemic active, anti-helminthic activity, neuroprotective activity, and antibacterial activity. And the conclusion which says functional gastrointestinal diseases have an unclear and incompletely understood etiology. The disease may be caused by aberrant anorectal contractility, delayed stomach emptying, a reduced gastric volume accommodation following eating, and gastric dysmotility. So higher levels of stress and anxiety are psychological variables that also influence how symptoms manifest. Owing to the complex action of polyherbal formulation, Hingvadi Churna may be a more sensible choice for the secure and efficient management of gastrointestinal conditions. There are many other research bills also. So primary dysmenorrhea, as we all discussed, Kastartava. Kastartava is due to upward movement of Raja. So in this also, Hingvastic Churna works very well. So Kastartava, Udavarta, Univapada also can be correlated with primary dysmenorrhea. So it's beneficiary in primary dysmenorrhea, Hingvadi Churna. There are many other research updates also. And coming to next, Eladi Churna, references Bhajaj Ratnavali, Chaddi Rogadikara, Astanga Hridaya, Sahasra Yogam, Yoga Ratnakara, Amlapitta Chikitsa. Coming to ingredients of Bhajaj Ratnavali, Eladi Churna, Ela, Lavanga, Gajakesara, Kolamaji, Laja, Priyangu, Ghana, Chandana, Pippali, all should be taken in equal parts, and all drugs are equally montes and Kalvayantra and trichutate to obtain the homogeneous mixture. So 1 kasha 12 grams should be the doses in divided doses along with sugar. Indicated in Kasa, Swasa, Vatacha, Pittacha, Kapacha, Sharti. Coming to Sahasra Yoga references, we have Ela, Nagakesara, Shunti, Maricha, Pippali. And first clean all the ingredients and grind them separately and powder in a muslin cloth. Store them in 8 containers in the light. And doses is 1 to 3 grams with honey or sugar. Indications is a lot of appetite, vomiting, nausea, enhances digestive power, respiratory disorders, and expectorant also. Coming to another reference, Ashtanga references, well, Ela, Turuksha, Kusta, Falini, Jatamamsi, and Partijala, Dhyamaka, Shugandhi Trina. And Twak, Patra, Tagara, Jatirasa, Sukti, Vagranaka, Surahwa, Agaru, there's Nagakesara. And these are all ingredients in Ashtanga reference. And coming to the above ingredients are powdered separately and mixed together in a specified quantity. The method of storage is stored in an airtight container and dry place. So, Raw Karma, it is Visha, Varna Prasadana, Kandu, Pitaka, Kota. And dosha karma is Vata Kapahara, karma is Tvachya, Rakta Dushtihara, and Kandugna. In Kerala, the treatment of seborrheic dermatitis, that is 20 grams of Eladi Churna mixed with 100 ml of Ayyapala Kyara Thailam and applied locally. There are certain research updates that is Eladi Churna works better in nephroprotective activity in diabetic kidney diseases also. And these are all the references. So clinical study to evaluate the efficacy of Eladi Churna with Triphala Kvata Gandoshi in tobacco chewing indication. So they have given Eladi Churna along with Triphala Kvata Gandoshi in a patient. So these are the before treatment, after treatment photos. So conventional treatment options, though effective to some extent, often carry the risk of side effects such as mucosal thinning and systemic complications. This highlights the need of safer, holistic, and more effective therapeutic approaches. Coming to Dadimastic Chura, references Chakradatta Grahani Chikitsa and Bhaishyaratnavali Grahani Rogadikara. Coming to ingredients, Vamsalochana, Twak, Sukshmayala, Techapata, Nagakesara, 6 grams each, and the Yamani, Dhanika, Svetacharika, Pipalimuna, 3 to each pala, 40 grams, and Dadima Bija, sugar, 8 pala, 1 pala. It should be homogeneously mixed, and 1 kasha, 12 grams is the divided doses. Along with this, we have the indications Satisara, Grahani, Shara, Ulma, Valaroga, Kasa, Swasa, Aruchi, and Hikka. Ayurvedic review of Dadimastic Churna and the importance. So it is an article published. So Dadimastic Churna is prepared in Acharya Govinda Bhajaratnavali, Grahana Rogadikara. So it helps to pacify Mohur Buddha, Mohur Bala, Pavritti, Alasya, Trishna, Balakshaya, Arochika, and Vairasya. So Dadimastic Churna controls the doshic properties of Klirika Kapha, Pachaka Pitta, and Samana Vayu. Dadimastic Churna improves Agni at various stages: Pachana, Avastha, Paka, Madhura, Amla, Katu, Avastapaka, Vipaka. This literature study revealed that Dadimastic Churna is a very good formulation for the management of diarrhea, dysentery, indigestion, and irritable bowel syndrome. So it is time-tested formulation prescribed in literature review from the classical test revealed that very few changes have been made in the formulation from time to time and was studied in Ashtanga Hridaya. So critical analysis of these ingredients of formulations revealed that all of them target on the Visheshan Agni, thereby correcting functional gastrointestinal disorders. Thank you for this opportunity. Remember, thank you.
Thank you, Doctor. Thank you for the well-explained presentation. Thank you so much, Doctor. Next, we go to another poster presentation. I would like to invite Dr. Tejmala Narayan Kadam for the poster presentation.
Hi, good evening, everyone. Myself, Dr. Tejmala Kadam. Today, I will present a poster presentation on a topic Ayurgenetic for healthy progeny, integrative Ayurveda and modern genetics for healthy generations. First of all, we see a Panchasutra for healthy progeny. First is Ritu, right time, conception in a favorable seasons and time. Second is a Kshetra, healthy womb, healthy reproductive tract and hormonal balance. Third is Ambu, healthy nourishment, sattvic diet, proper nutrition and supplements. Fourth one is a Bija, healthy gamete, physically, mentally and genetically healthy parents. And fifth one is Atma, healthy psychology, stress-free mind and positive thoughts and spirituality. In this condition, first of all, we see a genetic counseling. In this genetic counseling, objective is to assess the genetic risk and guide a couple for informed reproductive choices, include family history analysis, 3 generation, risk assessment of genetic disorder, carrier detection and interpretation, explanatory of inheritance pattern, reproductive options and planning, psychological support and guidance. According to Ayurvedic perspective, examine Prakruti, Vikruti, Kalaj Vadi, Shuddha Bija, healthy gametes, Shuddha Artava, Kshetra Parikshana, Desha Kala Ahara Vihara assessment, mental health and Satvavajay. Modern science perspective, risk evolution, pedigree analysis, career screening, personalized reproductive advices. Second is prenatal diagnostics. Objective is early detection of chromosomal and genetic and structural abnormalities in fetus. Method UHG ultrasonography. Second one is a chorionic villus sampling at the 10 to 13 weeks, amniocentesis 15 to 18 weeks, fetal blood sampling more than 18 weeks, invasive parental testing. According to Ayurvedic perspective, Garbha Rakshana for a healthy fetus, use a Garbha Sapalana medicine, Medhya Rasayana, Sattvic diet, avoid garbhoत्पादक factors, causative agent for fetus defect, regular antenatal care as per the Ayurvedic Garbhini Paricharya, modern science perspective, screening and diagnostic tests help in early detection, treatment planning, and decision making for the better outcome. Third one is an important screening test for parents, preconception and pre-material. In this case, CBC for thalassemia screening, hemoglobinopathy screening, triple H, HIV, HbS, VDRL, blood group, and RH typing. For pregnancy, antenatal, USG, double or triple marker test, non-invasive perinatal test, karyotyping, and in a newborn screening, congenital hypothyroidism, G6PD deficiency, galactosemia, and other inborn disease. Ayurvedic perspective, Garbha Sanskara. In this condition, will Garbha Sanskara, ensuring physical, mental, and spiritual well-being for of fetus. In modern perspective, systematic screening detect the risk factors early and prevent birth of affected children. Fourth one is specific genetic studies, karyotyping, detect chromosomal abnormalities like Down syndrome, Turner syndrome, and Klinefelter syndrome. Second is fish study, fluorescent in situ hybridization, detect duplication. PCR, polymerase chain reaction, detect specific gene mutation. Third one is multiplex ligation probe amplification to detect the duplication or duplication in multiple genes. Fourth one is DNA sequencing. Fifth one is carrier screening to detect the carrier of recessive genetic disorder. According to Ayurveda, Bija Shuddhi, Parikshan, assessment of gamete quality, Coolidge Vadi, hereditary disease in family, Bija Shuddhi, purification through the proper Ahara, Vihara, and Panchakarma. A modern aspect, molecular and cytogenetic study help in precise diagnosis, prognosis, and genetic counseling. Fifth one is inborn error metabolism. Definition: genetic disorder due to enzyme deficiency leading to accumulation of toxic substances or deficiency of essential products. In this, common examples are ketonuria and galactosemia, maple syrup urine disease, homocystinuria. These are the diseases. Clinical feature: failure to thrive, developmental delay, vomiting, lethargic, seizure, organomegaly, and metabolic crisis. Diagnosis: newborn screening. In this, heel to prick test done, and enzyme assess, urine organic acid, genetic studies, and according to Ayurveda management, Garbha Sanskara, Pathya Ahara. In this, sattvic and easy to digest Ahara given, Agni Deepane and Ampachan, Rasayana for Oja and Dhatu Poshana, and supportive herbs like Guduchi, Shankapushpi, Jatamansi, and Amlaki. In this condition, integrated approach for healthy progeny is in preconception care, Shuddha Artava Ahara Vihara, and Manasik Shuddhi is done. In antenatal care, Garbhini Garbha Paricharya, Garbhini Garbha Rakshan, regular checkup, and safe delivery and postnatal care, Sutika Paricharya, breastfeeding, and samskara. And in for healthy child and society, physical, mental, and intellectual development also done. In this condition, benefits: early detection and prevention of genetic disorder, informed reproductive choices, reduction in morbidity and mortality, healthy, intelligent, and responsible generation, integration of Ayurveda, holistic wellness with modern genetic, precious medicine given. Key message is Ayurgenetic combined with wisdom of Ayurveda with the power of modern genetics to ensure the healthy progeny and healthy nation. So remember that prevention is better than cure. A wise couple plan today for a healthy tomorrow. Thank you.
Thank you, Doctor. Thank you for the well-explained presentation.
Yeah, thank you.
Next, I'd like to invite Dr. Krishikesh Suresh Bagare for the paper and poster presentation. First, we go to the paper presentation. I'd like to invite Dr. Krishikesh Suresh Bagare for the paper presentation. Good evening, Doctor.
Good evening, sir. My topic is the role of Jalokacharan in the management of varicose veins, Siraj Granthi, a case study. Introduction: varicose vein torsions, elongated dilated veins due to venous insufficiency. Common in lower limbs, higher prevalence prolonged standing occupations associated with pain, heaviness, and skin changes in the lower limb. To evaluate the efficacy of Jalokacharan, medicinal list therapy in the management of Siraj Granthi, varicose vein with respect to symptomatic relief and clinical improvement. Objective: to assess the effect of Jalokacharan on reduction pain, shula, burning sensation, daha, and swelling, shota in varicose vein. To evaluate the changes in varicose tortuosity and skin alteration following Jalokacharan. To correlate the therapeutic outcome of Jalokacharan with the Ayurvedic principle of Rakta Mokshan in Siraj Granthi. To document the safety, tolerability, and the patient acceptability of Jalokacharan as non-invasive parasurgical procedure. Jalokacharan mechanism of action. Jalokacharan or leech therapy works by utilizing the bioactive substance present in leech saliva to achieve therapeutic effects. These substances, including anti-inflammatory, anticoagulant, and anesthetic compounds, are released into the wound and as the leech feeds, promoting healing and reducing inflammation. Prevalence and risk factor affects 15% in men and 25% in women. Risk factor: prolonged standing, hereditary factors, tight clothing, DVT, pregnancy, and pelvic tumors. Case profile: a 36-year-old housewife with pain, swelling, dilated superficial veins of left leg for 9 months. Symptoms: aching pain, ankle swelling, standing. Relieved by leg elevation. Diagnosis: serious Granthi fibrosis. Treatment: Jalokacharan with Keshar Gugul and Arshikutar Ras. Symptoms: pain, shul, swelling, shoth, itching, heaviness, skin. Investigation: Ashtareksha and systematic examination. Root examination: CBC, ESR, serum uric acid, RA factor, CRP, fasting BSL, LFT, RFT, lipid profile, TFT, VTCT, and urine routine examination. Severity of varicosity was classified in three categories using SIPS classification. SIPS classification is based on clinical, etiological, anatomical, and physiological score. In my case, patient had only C1, telangiectasis and reticular veins. Treatment protocol: internal medicine, Keshar Gugul, Arshikutar Ras 500 mg BID. 4 sittings of Jalokacharan weekly for 1 month. Continue medicine for 1 month post procedure. Assessment: patient feedback plus physician observation. Jalokacharan procedure: Purva Karma, consent investigation, PTCT वगैरह normal. Patient counsel instrument ready. Jaloka. Pradhan Karma: Jaloka applied on leg over most affected site, maximum torsade and pain. 45 minutes of minimum application. Detached naturally or with Haridra, burning sensation noted, side bandage. Observation and result: significant reduction in pain, burning, swelling, and torsity and skin changes. Complete relief from Daha and Shoth 3rd and 4th week. Sustained improvement till 8th week. Before treatment, some photos are there, and during treatment. Observation and result: the stool is completely decreased after decrease. Toxicity completely decrease and skin changes is minimally decreased. Discussion: Jalokacharan effective in vatractivitation. This saliva contains iridines, serotonin, and hyaluronides. Provides anti-inflammatory, anticoagulant, analgesic effect. Internal medicine as a result, anti-inflammatory, with dose balancing. Conclusion: Jalo medicine significant symptoms relief. Classic classical principles yield effective results. Thank you, sir. Hello. Hello.
Thank you, doctor. Thank you for the wonderful presentation.
I will
And
proceed
one
for.
more poster presentation is there.
Yes, sir.
Please continue the poster presentation, doctor.
So my poster presentation topic is Karma in calcaneus spur in Ayurvedic parasurgical approach. Introduction. Calcaneus spur, heel spur is bony overgrowth on the calcaneal bone causing heel pain and difficulty in walking. In Ayurveda correlates with Vata Kantaka. Karma is mentioned by Acharya Sushruta as the best line of treatment for such a painful conditions. Procedure: identify point of maximum tenderness. Heat Panchadhatu Shalaka till red hot. Apply the heated tip in Bindu dot pattern. Each contact steadily lasts only a fraction of second. 5 to 7 dots are usually applied depending on severity. Post-procedure care: application of green, aloe vera pulp, and Shatadav avoiding walking barefoot, long standing on or hard footwear. Use soft soles or heel pads. Rest for 1 to 2 days. Benefits: immediately pain relief, reduce inflammation and stiffness, improves circulation, prevents recurrence, cost effective minimally. Precaution: avoid in diabetic with poor healing, contraindication in bleeding disorders and skin infection. Thank you, sir. Hello.
Thank you, doctor. Thank you for the well-explained, insightful presentation.
Yes, sir.
Thank you, doctor.
Thank you.
Next, we go to the another presentation. I would like to invite Dr. Nikhil Patil for the poster presentation.
Hello, good afternoon, everyone. My name is Dr. Nikhil Patil from Ayurvedic Department from Deka Patil, Ayurveda Mahadhyalaya, Pune, Pimpri. My topic is literacy. Introduction. Literacy is derived from the Sanskrit word gritra, that means vulture. In the disease, the gait of a person resembles to that of vulture. The main aim, that is literature review of treatment principle of literacy according to various acharya. The treatment of various acharya show different activities or karmas. Like Shiravid and Agni karma are indicated or allotted by all the respective acharya like Charak, Sushruta, Ashtangate, Vagrut, and represent as a treatment of Videsi as Nirva Basti and Vasan Basti with Shiravid. Also, Sushruta indicate treatment for Rudrasi is Shiravid, Ashtangrita as Anvasan Basti and Shiravid, and others, that is Vangasin and Chakrartha, also say that Snihana, Svedana, Vamana, Virajana, along with the Basti and Shiraveda. Dhritrasi, the Vatana Atmachavati, it involves Shakti to balance the body dosha. In case of severe dosha accumulation, Sitana Shodhana therapy are recommended to detoxify the body. Dietary recommendation emphasize warm, easy digestive food and pacify Vata and Kapha dosha. The Shamana Chikitsa, that is Chikitsa Brudrasi, includes with Shamana, that is the Nidana Parivartana, Rasayana Sevana, Deepana Pachana Aushadhi, Vata Kapha Shamana Aushadhi, Pathya Apathya Palana. Also, the Shodhana Chikitsa, according to different acharyas, we already mentioned. Literacy is debilitating condition that disrupted a person's ability to sit and walk comfortably, significantly impacting their daily routine. With the help of Ayurvedic principle, one can effectively manage the disease with the help of Shodhana and Shamana Chikitsa, with the help of Bhasti and other Shamana Chikitsa. Thank you.
Thank you, doctor. Thank you for the poster presentation. And next, I would like to invite Dr. Surya Brajesh for the paper presentation.
I'm Dr. Surya Brajesh, Assistant Professor from Department of Samhita and Siddhartha Yanapoya Ayurveda Medical College Hospital. So, I will be presenting you regarding interpretation of dreams and Ayurvedic perspective. So coming to the introduction, interpretation of dreams play a major role in psychoanalysis. Dreams are said to be the royal road to the unconscious. It requires a deep insight to understand the subtle issues the dreams are trying to help with. In this regard, it is interesting to note that ancient system of medicine, Ayurveda, has interpreted swapna in a unique way. It not only focuses to indicate the state of body and mind, but also to diagnose the stage and assess the prognosis of a disease. So by the application of Purva Paksha Tantra Yukti, the following points will be dealt. How do dreams occur? Why do people dream? What are its types? How can dreams be interpreted? And what are its significance? Starting with a contemporary view on dream. So according to modern science, a dream is a succession of image, idea, emotion, and sensation that evolve involuntarily in the mind. It mainly occurs in REM, that is rapid eye movement stage of sleep, where brain activity is high and resembles that of being awake. Dreams may reflect our own underlying thoughts, emotions, deepest desire, fears, and concerns. Based on Ayurvedic view of dream, na ati prasuptaha purushah savalan afalans tata indriyeshena manasa swapnan pashyati anekada. So swapna occurs in na ati prasupta stage, that is like half awake state, due to the prerana of manas leading to palavan or apalavan swapna. Acharya Charaka also considers swapna as the linga of Atma. Interpretation based on the types. So according to modern science, based on the contents, dreams are divided into manifest content and latent content. Manifest content includes information from dream as the dreamer remembers, and latent content is what is interpreted by the analyst based on the symbolic meaning embedded within the dream. And based on this, it's again classified as the hidden desires, fears, and concerns, the day residual effect, and nocturnal sensory stimuli. Based on this, it is interesting to note what Ayurveda says on the types of swapna, which is Saptavida 7, Drishta, Shruta, Anubhuta, Praktita, Kalpita, Bhavika, and Doshaja. Among this, Drishta, Shruta, and Anubhuta is more towards the things seen, heard, and based on the indriyas. Praktita is based on the desires, Kalpita, the imaginative things, Bhavika, which foretells the future, and doshaja, that is caused because of certain abnormality in the doshas. So now coming to dream interpretation. Dream interpretation is the attempt at drawing meaning from dreams and searching for an underlying message. Now, striking similarities between contemporary view and Ayurvedic view. Among the classification, Drishta, Shruta, and Anubhuta is resembling the day residue effect told by contemporary science. Prarthita is also referring to the nocturnal sensory effect and deep hidden desires. Bhavika would be striking similarity with the latent dreams and deep hidden desires. And doshaja are unique contribution of Ayurveda alone that actually help in diagnosing a vyadhi. So there are few interpretations done based on modern view and Ayurvedic view. So all these are told both in Ayurveda and also in dream interpretations according to psychologists. So falling from a distance. According to modern interpretation, when things are out of control, these dreams will occur. And Ayurveda calls this as Ashubha. Dreams of death, it directs towards the end of something. And again, Ayurveda says it as Ashubha. If you dream about falling of teeth, then modern science says it is because of fear of aging, and Ayurveda also considered it as Ashubha. Naked dreams is emotional or psychological exposure. Ayurveda considered it as Ashubha. Flying dreams, sense of freedom or sense of escape. which Ayurveda says as doshajal. Dreaming of snakes is considered to be Shubha and it is healing and transformative. Raktavarna, desire, anger, violence, or warning signs is Raktavarna. Purva Rupa for Raktapitta. Shweta or white signifies love, purity, or peace. It is Shubha Suchata according to Ayurveda. Blackness or Thamak Pravesha signifies depression, which is Apasmara Purva Rupa according to Ayurveda. Blue color is relaxation or honesty, which is Shubha Suchata. And yellow signifies sickness in contemporary science, which is an Arishta Lakshana of Pandu according to Ayurveda. So based on animals and places influencing dreams, also similarly Ayurvedic interpretations. If one sees Deva Brahmana, it brings good. Preta is Ashubha. Suhrut is Shubha. King is Shubha. Samudra brings prosperity and Arogya. If one sees dream chased by dogs or seeing oneself drowned is again Ashubha. So whenever a Ashubha Swapna occurs for a healthy person, it means that he might get a disease. And if a person who already has a disease, if one repeatedly sees such Swapna, it means that it is a Arishta Lakshana. Significance of dreams. Recurring dreams demand attention and interpretation. Dreams that occur during Diva Supna or ones that are Ati Dirgha or Ati Hrisva are said to have no effect. Dreams that are trying to convey the dosha pradanyata or the lakshana of the disease should be differentiated. Absence of Vaikrita Swapna is an indication of good health. So the utility of Swapna to denote Prakriti, to predict gender of unborn child, to diagnose disease, to understand Arishta Lakshana. According to psychology, interpreting dream is like interpreting the inner unconscious self that dictates one's reaction and belief in life. It helps in addressing mental health issues, including depression. Coming to the conclusion, Swapna definitely is a tool to enter the Aturasya Antaratma as told by Charaka. There is a necessity to interpret the Bhavika and Doshaja variety of dreams since they help in deeper understanding of the Vyadhi. In Manasika Vyadhi, the mere interpretation of Swapna and consoling of the patient itself can have tremendous effect. And in Sharirika Vyadhi, Swapna mainly focuses on denoting either the cure or the asadhyata of the Vyadhi and Dosha. Thank you. These are the various references. I thank you for the opportunity provided. Thank you.
Thank you, Doctor. Thank you for the engaging presentation, and we appreciate your effort and dedication. Next, we go to the another paper presentation. I would like to invite Dr. Sheetal Raj for the paper and poster presentation. And first, we go to the paper presentation.
Namaste all. I am Dr. Sheetal Raj, Associate Professor and PhD Scholar from Ayurveda Medical College and Hospital, presenting before you role of Vishajikitsa in urinary bladder cancer with special reference to Basti Amaya. These are the contents of my presentation. Cancer is a disease known for its fatality and detrimental effect from time immemorial. Though we have a well-advanced science and technology, no human being is ever free from the fear of this dreadful disease. There are over 430,000 new cases and 165,000 deaths due to urinary bladder cancer every year. Urinary bladder cancer is the most common cancer of the urinary tract. Though men are more likely to get bladder cancer, women present with an unfavorable prognosis. Next slide, please. The extrinsic factors which can be the cause of bladder cancer are cigarette smoking, alcohol, exposure to chemicals, use of certain medicine, water and air pollution. These can induce genetic mutation, can alter the tumor microenvironment and can cause cancer. Next slide. Role of tobacco as a cause of bladder cancer. Cigarette smoking induces initiation and progression of bladder cancer, mediating epithelial mesenchymal transition and activate ERK half pathway, that is extracellular signal regulated kinase pathway, which is supposed the survival of cancer. It is a strong carcinogen as it contains polycyclic aromatic hydrocarbons, aromatic amines, and N-nitroso compounds. And risk of bladder cancer increases with the increase in frequency and intensity of smoking. Next is the role of chemicals as in the cause of cancer, bladder cancer. There is chemicals like aromatic amines which are present in dye, 4-aminobiphenyl which are present in cosmetic and food color, toluene which is used in the treatment of water and metalworking fluid can lead to cancer. Next is the role of alcohol as a cause of cancer. Please change the slide. Acetaldehyde, which is a toxic metabolite of alcohol, can cause irreversible DNA damage and lead to cancer. Metals as a cause of cancer. Arsenic present in drinking water, trihalomethanes and nitrosamines, which are present in chlorinated water, can be a cause of urinary bladder cancer. Processed meat is considered as a group 1 human carcinogen by World Health Organization. Role of chemicals as a medicines as a cause of cancer. Cyclophosphamide, an alkalizing agent, and pioglitazone, an anti-diabetic medicine, when used for longer duration, can lead to urinary bladder cancer. Polycyclic aromatic hydrocarbons, which are present in motor vehicle engine exhaust, and particle matter present in polluted air can lead to urinary bladder cancer. Moving on to the Garavisha. Garavisha is a combination of non-toxic substances. It is Kalandara Pragopi Visha, which means it remains in the body for a longer period of time until it gets metabolized. Hence, all the etiological factors of urinary bladder cancer can be considered as Garavisha. Next. Next. Next slide. Next slide. To the Chikilsa of Garavisha. Garavisha Chikilsa is the Garate Vandavan Pukta, Tatpatyam Bhana Bhojanam, Shuddha Chile Thema, Sutrasana Videsmare. The treatment principles of Garavisha include Vamana, Patyahara, and Hridayavarana. Vamana can be considered as a purificatory aspect, whereas Patyahara should be considered as a prevention of further exposure of poison, and Hridayavarana is the protection of Hridaya, or it should be considered as protection of all organs of the body. And the formulations mentioned here are Bilvadigalika, Paravada Amisha Rasa, Tapya Suvarnadileha, Vrishadi Siddhagrida, Kalyana Girda, Murvadi Churna, etc. Next slide. Basti Amayandada Grida is one of the best yoga used in urinary bladder disorders. It can be used in acute and chronic ailments. It improves the bladder functioning as well. It is used orally and also in Sneha Karma, that is the Purva Karma of Panchakarma. Grida is considered as an elixir in Vishajikitsa. Nagradam Samsanam Shasam, Pralebo Bhojam Aushadam, Sarveshu, Sarva Avasteshu, Visheshu, Nagradopama. There is nothing which is equivalent to Grida in Vishajikitsa, as Visha can be administered in different mode and different conditions of poisoning. Grida is Vishahara, Ojo Vathaga, and Rasayana. All Agadas are by default Rasayana. The Agadas like Kalyana Grida, Vishadi Siddha Grida, Vilvadi Gulika, etc. can alleviate Visha, enhances Ojas, and thereby arrest DNA damage. Further research should concentrate in the in vitro and in vivo study in this frame of reference. This is all I have to share with you. Thank you.
Thank you, Doctor.
Presenting before you, poster titled An Insight in the Indigenous Snakebite Management in Kerala. Kerala has a geographical condition which was favorable for various types of poisonous and non-poisonous snakes. Some of the very ancient treatises of Vishajikitsa, like Prayoga Samuchaya, Vishavaidya Jyosinga, and Kriya Gaumudi, points out some special treatment techniques of Visha, like Karu Prayogam, Vela Prayogam, Vellotu Prayogam, Vishakallu Prayogam, Jaladhara, Tukudhara, Utijikitsa, etc. Karu is a tubular instrument shaped like the tura flower used to blow medicines into the body. Vela Prayogam, here Vela is a drug called Ganandropis ganandra, which is used to bring back a poisoned person to life, and it is used as Pana, Nasya, Anjana, and Lepa. Vellotu Prayogam, here Ikshwagu is boiled in a bronze vessel that is well-loaded along with goat's milk and is used for Pana. It is indicated in Mandali Visha, and this induces Chardhi and eliminate the poison. Vishakalla Prayogam, a medicated stone is called Vishakalla, and this is applied to the bitten area, which acts as a synthetic magnet that attracts toxins in blood. Tukudhara, here Jaladhara is done in specialized vessel called the Tuku, called the Tuku Patra, or Jaladhara done with a drug called Urduki. See, here Urduki is a drug called Ishiri Mula, and that is the reason why it is called the Tukudhara. Jaladhara is a dhara done immediately after bite before visha spreads to various parts of the body. Here, both Jaladhara and Tukudhara leads to coagulation of blood and arrests virulent spread of poison. Uthu Chikitsa, this is a very special procedure of blowing medicated air into both ears and at murtha by 3 persons at a time up to 115 times. This act is the act of blowing is Utha, and here the drugs like Vishwa, Marija, Dusvarsha, and Vishavega. Vishavega is a synonym for the drug Ishirimola are used. This is done to regain the consciousness and to bring back the life of a person. Moving on to the conclusion, the decline in such Vishaprayogas are because of the misconceptions that the Vaidya should not accept remuneration and Vaidya's family will suffer Sarpashava. The introduction of anti-snake venom and the non-availability of good quality drugs are other major reasons for the decline of traditional treatment techniques of Visha. Though these traditional treatment techniques are not in practice now, further research on this will lead to an innovation in snakebite management. Thank you for your patient hearing.
Thank you, Doctor. Thank you for the well-explained presentation. Thank you so much, Doctor. And we appreciate your effort and dedication. And next we go to another paper presentation. I'd like to invite Dr. Jonagradi Pushpaja for the paper presentation.
Good evening, one and all. Myself, Dr. Jai Pushpaja Devi, third year PhD scholar of RSPK department from NRS Government Ayurvedic College, Vijayawada. Today I am going to discuss about Simhanada Gugulu, Gokshuradi Gugulu, and Kaishwara Gugulu. Next slide, please. Coming to Simhanada Gugulu, references includes Chakradatta, 25th chapter, by Shija Ratnavali, 29th chapter, and AFI part 1. Here, Simhanada is derived from two words, that is Simha, line, Nada, roar. That means roar of a line. This formulation is believed to act powerfully and fearlessly against diseases, especially deep-seated Vata conditions and in severe Amavata. The name implies that consuming this medicine removes debilitating joint weakness and restores a robust, powerful, lion-like gait and vitality to the patient. Next slide, please. Here is Simhanada Gugulu mentioned in Chakradatta as Simhanada Gugulu and Bruha Simhanada Gugulu. Let's see Simhanada Gugulu. It contains Triflakashaya 3 parts, Shuddha Gandhaka 1 part, Gugulu 1 part, Chitrataila, that is Erendataila 4 parts. Coming to method of preparation, to prepare Triflakwata with 3 parts of Triphala in coarse powder form is taken in a decoction vessel along with 8 times of water. It is boiled, reduced to quarter and filtered. All the 4 drugs are taken in a wide-mouthed vessel and boiled over mild fire until the mixture attains thicker consistency. Later, the drug mass is collected and made into pills and then stored in glass container. Coming to dosage and anupana, 4 to 8 rati with Ushnodaka. Next slide, please. Coming to pharmacological actions, it includes Agnivruddhikara, Amapachaka. Indications are the Vatapitta Kafaroga, Kancha, Pangu, severe case of Swasa, Panchavidikasa, Kusta, and rejected cases of Amavatya. Pathya includes during the course, one should take the diet prepared with sali and sastika rice mixed with sarpi, taila, and rasa. Coming to Bruhat Simhanada Gugulu, reference is the Chakradatta 25th chapter. Next slide, please. It contains Shuddha Gugulu 8 parts, Shashaptala 8 parts, Trifla coarse powder form 16 parts each, water 8 times, and Churna Dravyas are the Trikatti Churna and Trifla Churna half part each, Musta, Vidanga, Devadaru, Guduchi, Chitramula, Trivrut Mula, Danti Mula, Chabya, Surana, and Manaka Churna are half part each, and Rasadravyas are Suddhaparada and Gandhaka half part each, Datura Phala Churna obtained from 100 pala. Coming to method of preparation, Shuddha Gugulu should be pounded with Shashapataila and Trifla Mustakwata prepared from Triphala coarse powder and 8 times of water reduced to quarter by boiling. After filtering, it is again heated, and at the end, fine powders of Churna Dravyas are added. On self-cooling, Kajali is prepared from Shuddha Parada and Shuddha Gandhaka along with Dattura Phala Churna are mixed. Prepare its pills of 2 grams by weight uniformly and dry them in shade. Coming to dosage and Anupana, 2 Masha with Tapta Jala, and its pharmacological actions includes Agnidipana, Dhatu Vruddhikara, Vayo Vruddhikara and Bala Vruddhikara. Next slide please. Indications are the Amavata, Sirovata, Dharana Sandhivata, Jhanu Jangashrita Vata, Katigraha, Ashmari, Mutrakrucha, Bagna, Timira, Udara, Amlapitta, Kusta, Prameha, etc. It is mainly indicated in Amavata. Let's see Samprapti of Amavata. Due to Nidana Sevana, it causes Agdimandya. It leads to Ama Utpatti and Vata Prakopa. It causes Vata Ama Samurchana, and it enters Sleshma Sthana and causes Shrotoroda and Sangha. It leads to Amavata. And its manufacturing companies includes Baidyanath Dabur and Dudh Papeshwar. Its overall mode of action is improving digestion and metabolism, eliminating ama, reducing inflammation and pain, correcting vata imbalance, improving joint mobility and function. Next slide, please. Mode of action according to ingredients, Triphala and Eranthila acts as having Amapachana property and helps to digest and eliminate ama, which is the main cause of Amavata. Vata Kapha Shamana property, and Gugulu is having Shotahara property, and it having Shrotoshodhana. It removes obstruction in the body channels caused by ama and kapha, improving circulation and nourishment to joints. Eranthila having Virechana effect, and Triphala is having Rasayana and Dipana action, acts as a rejuvenator and improving digestive fire, preventing further ama formation. Next slide, please. These are the research updates. That is a clinical study on Amavata with Simhanada Gugulu and Satapushpa Dilepa. And another one is clinical efficacy of Taranavasti along with the Simhanada Gugulu and Rasna Saptakakwata in the management of Amavata. Next slide, please. Coming to Gokshura the Gugulu, its references include Sharangadhara Madhyamakanda 7th chapter and AFI part 1. It contains Gokshura 28 parts, water for decoction 6 times and reduce it to half to the total quantity. Gugulu 7 parts, Triphala 1 part, Trikatu 1 part and Musta 1 part. Its a method of preparation is 28 parts of Gokshura is added with 6 times more water, boiled and reduce it to half to the total quantity. The filtered liquid is added with 7 parts of Gugulu and again boiled to jaggery consistency and added with 1 part each of Trikatu, Triphala and Musta, pounded well and made into pills. Coming to dosage and Anupana, 3 grams with Mustakwata, Pashana Bedakwata, Ushira Kwata, and its indications are the Prameha, Mutrakrucha, Mutragata, Ashmari, Pradara, Vatarakta, Vataroga and Supradosha. Next slide, please. Its manufacturing companies are the Baidyanath Dabur, Dudh Papeshwar. Its overall mode of action is Gokshura the Gugulu works by increasing urine flow to wash away toxins, breaking down mineral crystals before they become large stones, and clearing out the inflammatory waste that causes joint and urinary pain. Mode of action according to ingredients, Gokshura acts as a natural and gentle diuretic. It increases the urine output, which mechanically flushes out bacteria. Excess salts and vitiated Apanavata and Pachkapitta can cause crystal aggregation. And Gugulu has a Lekana property. It breaking ama, excess fat, and prevents minerals like calcium oxalate from binding together to form new crystals and effectively clearing the Shrotoroda. Next slide, please. Here, Triphala acts as a shield. It means by clearing the physical barrier within the nephrons and urinary tracts, it creates a clear path for Gokshura's Mutrala property. In conditions like urolithiasis or benign prostate hyperplasia, and microchannels are blocked by an accumulation of kapha, meda, and ama, Triphala literally scrapes and dissolves this soft, sticky, and mucoid obstruction. Trikatu acts as a bioenhancer, and Musta having Mutrala property. It enhances the renal clearance and excretion of uric acid, preventing the supersaturation and crystallization of monosodium urate in intra-articular spaces. Next slide, please. These are the research updates. Includes a comparative clinical study of Gokshura the Gugulu with Anupana Beda in the management of Vatarakta with a special reference to gout. And another one is diuretic activity of Gokshura the Gugulu in rats. Next slide, please. Coming to Kaishora Gugulu, references are the Sarangdara Madhyamakanda 7th chapter, Chakradatta Vataraktadikara and AFI part 1. It contains Kwatadravya, Trifla 32 part each, Guduchi 32 parts, water for decoction 8 times and reduce it to half. Mooladravya, the base drug Shuddha Gugulu is 32 parts and Prakshepa Dravyas, the fine powders of Trifla, Trikatu, Guduchi, Vidanga and Dantimula and Trivruta. Next slide please. Coming to method of preparation, initially take gugulu in a potali and put in water along with trifala and guduchi and boil by stirring constantly with a ladle till it is reduced to half to the quantity. Then strain it with a clean cloth and again cook gugulu till it becomes thick. Afterwards, when it is in the lukewarm state, add the above mentioned prakshepa dravya in the specified quantity. Then the mass is mixed thoroughly and kept in a vessel stained with ghee. Pills of 1 shana, that is 1.25 grams each, are prepared and preserved. Its doses and anupana are the 3 to 4 pills along with Ushnodaka, Kshira and Manjista Kvata. Its indications are it is indicated in all types of Kushtaroga, Tridoshaja Vatarakta and all types of Prana, all types of Gulma, Prameha Pidaka, Prameha Udaroga, Mandagni, Kasaswasa, Pandroga, etc. With different anupanas, it is indicated as with a Vasa Kvata cures all types of Netra Roga, with Varanadi Kvata cures all types of Gulma Roga, with Kadira Kvata cures all types of Rana and Kushtaroga. Coming to it, karma, it's having Rasayana, Varnya, Amapachana, Srota Shodhana, Rakta Shodhaka, Shodhaharam, Rudu Virechaka, and Vata Pitta Shamaka. Apatya, the one should avoid taking Amla, Tikshna, Vyayama, Shrama, Atapa, intake of Madhya and Krodha during its consumption. Next slide, please. Its manufacturing companies include Baidyanath Dabur, Sri Dudpapeshwar, Kotakal Arya Vaidyashala. Its mode of action according to ingredients, Trikatu is having Deepana Pachana Srotoshodhana property, Trifla is having Tridosha Shamaka Anulomana property, Vedanga is Krimigna, Kustagna, Agnivardaka, Trivrut is Shukavirechana, and Danti is having Tikshna Rechana, Guduchi is Deepana Pachana, Rasayana and Tridosha Shamaka. Here Guduchi is the premier Vatarakta Hara herb. It acts as an immunomodulator and powerful anti-inflammatory in action. Trifala, it corrects the Agdimandya at the tissue level, preventing ongoing formation of pharma. Gugulu is a Yogavahi, that is an enhancer that carries the properties of Guduchi and Trifala deep into the microchannels. Next slide, please. These are the research updates. That is a comparative pharmaceutical clinical study of Kaishora Gugulu and Rasabra Gugulu and Vatarakta. And another one is combined efficacy of Kaishora Gugulu and Punarnavadi Gugulu in the management of Vatarakta. Next slide, please. Coming to conclusion, here the primary target system of Simhanada Gugulu, it is mainly acts on musculoskeletal system and digestive system. Gugulu acts on genitourinary system. Kaishara Gugulu acts on vascular, lymphatic and integumentary system. Key ingredients of Simhanada Gugulu are Erenda Taila, Shuddha Gandhaka and Trifala. Gokshura contains Gokshura the Gugulu contains Gokshura, Trikatu, Trifala and Musta. Kaishara Gugulu contains Guduchi, Trifala, Trikatu, Vidanga, Danti and Triprut. It's Simhanada Gugulu mainly acts on Vata and Kapha, specifically acts on Ama, and Gokshura the Gugulu acts on Vata and Pitta, focuses on Apana Vayu. Kaishura Gugulu acts on Pitta and Rakta. Simhanada Gugulu main mode of action is Dipana, Amapachana and Rechana. Gokshura the Gugulu is Mutrala and Lekana property. Kaishura Gugulu having Rakta Shodhaka and Ruchya property. Coming to modern mechanism, Simhanada Gugulu inactivates pro-inflammatory cytokinins, provides antioxidant defense and lubricate joints while accelerating the intestinal elimination. Gokshura the Gugulu restores renal blood flow, prevents protein leakage, alters the urinary pH, and acts as an anti-urolytic property. Kaishara Gugulu inhibits xanthine oxidase, neutralizes the free radicals, and exerts broad antimicrobial and anti-gout properties. Simhanada Gugulu main indication are the Amavata and severe constipation, chronic joint stiffness and pain. Gokshura the Gugulu is indicated in Mutrashmari, dysuria and BPH. Kaishara Gugulu is indicated in Vatarakta, Vichachika, Kushtaroga and having high uric acid levels. Next slide. Thank you.
Thank you, Doctor. Thank you for the well explained and detailed presentation. Thank you so much, Doctor. Next, I would like to invite Dr. Sai Chandni for the paper presentation.
Thank you, Doctor. Good evening. Myself, Dr. Chandni, final year PG scholar. Today, my topic is Vriksha Ayurveda, an ancient approach for plant growth and production. Coming to the introduction, India is rich in biodiversity of medicinal plants regarding in our traditional medicine like Ayurveda, Unani, Siddha, and Sovarika. We use a wild diversity of plants in our day-to-day life and in our medicinal preparations and all. So one of our regarding in our subject Vriksha Ayurveda is a basic key role subject in our traditional medicine. Vriksha Ayurveda, Ayurveda for the plant life, which deals with the procurement, preservation, and treatment of seeds, plantation, selection of soils, irrigation, and ways to locate the underground water, how to prepare the natural fertilizers, and how to treat the plant diseases, and how to lay out the gardens, etc. And Vriksha Ayurveda is not a separate science which we which now we are learning. It earlier mentioned in our Samhitas and Vedas also. In later periods, independent books on Vriksha Ayurveda were written by various authors like Kashyapa, Shalihotra, and Surapala. In regarding coming to the Vriksha Ayurveda, many books are there, but Shalihotras and Surapala's Vriksha Ayurveda is very important. Next slide, please. Coming to the historical content, as I mentioned previously, there are so many books regarding on Vriksha Ayurveda. One of some are I mentioned here: Upavana Vinoda, Bruhat Samhita, and Krishi Sukta, Amarakosha, Krishi Prasahara, Lokopakara, and Shalihotra's Vriksha Ayurveda, Surapala's Vriksha Ayurveda. Last mentioned what two books are very important, and in our current now present trend, we are using the Shalihotra's Vriksha Ayurveda, Surapala's, and Sharangadara's Upavana Vinoda, which deals with the glory of trees, selection of soils, and classification of plants, and which techniques mentioned in agriculture based, and which is dedicated to the science of plant life, which is how to treat the plant diseases and all. Next slide, please. And now coming to one of the important which we considered in main basic textbook in Vriksha Ayurveda is Surapala's Vriksha Ayurveda. In this, mainly there are mentioned 12 chapters which are named as Taru Mahima, Nivas Asanna Taru Subha Lakshana, means where we have to plant, which plants are planted around our homes, near the temples, near our gardens, which plants are we have to plant, and Bhumi Nirupanam means this land is fitted for agriculture or fitted for plantation, like that, and classification of Bhumi, which deals with different types of based on the vegetation, we will classify the Bhumi like Jangala, Anupa, like that, and Padapa Viviksha means classification of plants based on the morphological characters. So we will in our basically we will classify the plants like that only based on the morphological climbers, creepers, herbs, like that. We will based on that Padapa Viviksha and Bijotpatti Vidhi, and means sowing seeds and preservation rules. Ropana Vidhana means method of plantation. Gatra Vidhi, Taru Raksha, Roga Janya Adhyaya means that there are based on like humans also, plants are having diseases. Like that, Bahya and Abhyantara. We also suffer Bahya and Abhyantara rogas. Like that, only plants are having two types of Vyadhi, Bahya and Abhyantara. Roga Upashamana Adhyaya and Vichitra Adhya. And Upavana Kriya means planning how to plant the plants around our home, and how to do gardening, and how to how much feet of plantation soil we have to select, like all mentioned in the last 3 chapters. Next slide, please. Now coming to the selection of soil, as I previously mentioned, Bhumi Bhumi Nirupanam means soil is divided into 3 classes: Jangala, Anupa, and Sadharana. Jangala means scanty water and less waste, like desert places. And next coming to Anupa Desha, which are rich and fertile lands, which are used for irrigation, agriculture purposes. And third one is Sadharana, which are ordinary lands, neither fertile nor non-fertile. These three are further classified into 6 subdivisions based on the color of mud and flavor. Means black soil, clay soil, like the different types of like the 6 types of soils are there. Next slide, please. Now coming to the germination, according to Ayurveda, they mentioned how much time for germination and which part we has to keep like which procedure we has to keep the germination, how it comes, they mentioned in the Ayurveda. First one, well matured fruits, sprinkle milk and clarified butter over them, then keep them for aside for 5 days, then germination will start. And for that, apply powder of bruhati, tila mixed with ghee and dry them, and then mix with the cow dung and fumigate with fat of an animal. Then we has to keep uh, in the soil. Then the germination will start. Like that, if we take stem cuttings, cut the end and mix with honey, butter, cow dung, and fat of hogs. Like that, bulbous root, honey, and clarified butter ensure the growth of the stem. And in Varsha, which we use widely in Manasika Rogas and all, is actually acts as fungicide for the plants which we use for germination. And now coming to the seed beds, sow the seeds and spread the grass over it and sprinkle milk and water. Then the germination process will be more easier and faster than normally when we sow the seeds. Next slide, please. Now coming to the fertilizers, which are natural fertilizers mentioned in the Ayurveda. In that, Panchagavya is using in some of the states in India like Karnataka, and some other states are using Panchagavya method. First one is Kunapajala. It contains powder droppings of goat and sheep meat, and one adaka of sesamum and wheat and beef. These all are fermented for 7 nights. So these later that these liquid which obtained is used as a fertilizer. And now next coming as Panchagavya, cow urine, cow dung, and cow milk, cow ghee, cow curd. These are 7 are fermented for 7 days, and we has to tristrate it for twice a day. This liquid which obtained after the 7th day is used as fertilizers for uh, uh, majority of for enhancing the natural growth and attaining more for bioavailability of plants. Next slide, please. Now coming to the diseases and treatment of plants, as I previously mentioned, there are 2 types: Bahya, Abhyantara Vyadis. Here Abhyantara Vyadi comes under Vataja, Pittaja and Kaphaja type, and Bahya is Krimija. How we can identify Vataja Vyadi means the leaves are withery leaves will be there and light in weight, and the bark is very rough and slender and tall. For this, we has to use Kunapajala treatment. Like in that Kunapajala, we use mamsa of goat and sheep and all. Now coming to the Pittaja Vyadi, here in Pittaja Vyadi, we will see very weak branches and having abundant flowers and fruits. But fruits may be seen in off season, and which may fall prematurely. For this treatment, we has to give sheet and madhura dravyas like yashti madhu and kshira, like that formulations. Now coming to Kaphaja Vyadi means it possesses bulky branches and abundant flowers and fruits, and the leaves are seen in like dwarf condition. Now coming to the treatment, administration of Panchamula Kwada, decoction made from Panchamula, and the decoction of made from Kashaya Katutikta Rasas, which are which are having Kafahara action. Now coming to Krimija Vyadi, Krimi means we will see regularly like fungicide or anything, or any insect eating the leaves of nectar of the plants. For this, sprinkling of cold water on the trees, roots, branches for 7 days. And we can use Vacha, Kushta and Ativisha Lepa on the infected side. Next, fumigation can be done with Vacha, Vidanga. As previously I mentioned, Vacha is used as a fungicide. Next slide, please. These are the some of the pictures. As first I mentioned, Vataja Vyadhi, we can see the withery leaves and stem are somewhat rough and slender and tall. And coming to Kafaja Vyadhi, the leaves are dwarf and fruits are having abundant fruits. And now next coming to Pittaja Vyadhi, the leaves are somewhat green and yellow color, and you can see the fruits which are prematurely fallen. Next slide, please. Now coming to the conclusion, nowadays we are using the harmful fertilizers and pesticides for the for more yield and for early yield of the crop. So by using those, we are having our what we use the chemical pesticides, and we are having that food only. Nowadays, awareness is creating that organic manures are preparing, organic farming has developing. So for getting more awareness, these Vriksha were
Thank you, Doctor. Thank you for the well-explained presentation. Thank you so much, Doctor. And next we go to the another presentation. I'd like to invite Dr. Karishma Dinesh Shukla for the paper presentation.
Good evening, everyone. I am Dr. Karishma Shukla, PG second year scholar from Bhattya department from PDS College of Ayurveda and Research Center. So today I am going to present my topic, which is adjuvant management of juvenile diabetes mellitus, a case report. We have case of diabetes mellitus in which we are giving Ayurvedic treatment management along with modern medicines. Next slide. Okay, so type 1 diabetes is a chronic autoimmune condition in which body's immune system start to attack insulin producing beta cells in the pancreas, and it is one of the most common endocrine disorder in children. It mainly present with decay symptoms in children, and it affects the growth, development, school performance, and quality of life. So along with modern medicine, with Ayurveda, we can help in the growth and development and also reduce significant amount of sugar fluctuation which is faced by toddlers and adolescent children. Next slide, please. Okay, etiology and risk factor. So main cause is unknown, but we have risk factor like genetic susceptibility of type 1. It has strong genetic component like HLA genes, and it has 50% chances of having producing this type 1 diabetes, and also other so very genes are present, genetic variants and mutations are present which causes type 1 diabetes. Environmental factor is there, infection which can trigger the immune system like mumps, rubella, etc. We have so many infection which trigger the autoimmune cells, and it lead to increased insulin demand, and thereafter the insulin is attacked, and pancreatic beta cell directed autoimmunity, in which humoral immunity and cell mediated immunity is destructed. So this create the autoantibodies, and we have the stages. So pathogenesis in stage 0, 1, 2, and 3 stages. In stage 0, we have triggering factors and genetic susceptibility cause, but the insulin level are normal. In stage 1, we have this insulin level are normal, but the triggering factor start to attack the insulin and beta cells. In stage 2, we have dysglycemia, in which sugar fluctuation gets started, and but insulin is present, it is not actually absent. And in stage 3, insulin level are negligible. Next slide. Ayurveda perspective. So according to Ayurveda, Kashyap has given that Prabhut avil mutrata prameha, means it increases the excessive urination and avil mutra. Also, it is due to Bijdushti, maternal cause, congenital metabolic tendencies. Kashyap said is mostly a Sahaj Vyadhi. Next slide. Samprapti, we have Nidan Sevan, Kaf Prakopa, Agni Mandya. So it affects our Dhatu, Med Mans, Kleda, Vriddhi, and Mutravas Rutas is the main Dushti. And we have increase in Kleda and like Mutra Marg se Nishkashan hota hai, then it leads to Prameha. Also in children, it is important that genetic factor is the main thing, and it is included in Sahaj or Kulaj Vyadhi. Next slide. So here I'm going to present 3-year male patient who came in the OPD with complaints of abdominal pain, which was intermittent in between, and failure to thrive. I mean, he has less height for age. Weight was normal, but height was less for age. Polyphagia. He has deep cravings for to eat thing in every 2 hours to 3 hours, and daily sugar fluctuations, which was highest 480 or 500, and it mainly got increase in lunchtime or our snacks timing. And the patient got detected with diabetes mellitus at the age of 1 year, where he presented with decay symptoms of breathlessness, polyuria, abdominal pain in his nearby hospital, and then he got detected. We had seen brief history where patient's birth history was normal, full-term LACS child, cried immediately after birth with normal weight and no NICU stay. Next slide, please. Developmental history was normal, like speech was normal, all the developmental milestones was normal. Just the height was not increasing as per age. Immunization history was immunization was completed till date, and family history he have no any significant cases of diabetes mellitus in his family. In general examination, the child was normal with conscious, alert, well-oriented appearance, and build was normal as per age. Nutrition was actually it was like controlled with controlled diet, because of parents give actually controlled diet, but still after doing everything, he was having sugar fluctuation daily. Next slide, please. Vitals was within normal limit. Growth and development was normal, but sugar in case of sugar status, persistent hyperglycemia was seen on a daily routine, and he was on insulin, short acting and long acting insulin. Signs of decay was absent, and systemic examinations was normal. Next slide, please. Our type 1 DM has a diagnostic criteria of fasting blood sugar greater than 126 mg per dl, HbA1c 6.5% or higher, random blood sugar greater than 200 with symptoms of diabetes, C-peptide level are low, and autoantibody test to confirm the diagnosis are GAD antibodies, ICA antibodies, IA2, Z and T8 antibodies. In our case, the patient was already diagnosed with type 1 diabetes at 1 year of age, and also his HbA1c level was 9.1, so he was already a diagnosed case. Next slide, please. I have shared the OPD papers of the patient and also the daily sugar chart of 3 months recorded by the parents on daily basis before breakfast, lunch, dinner, and along with the insulin given. Next slide, please. So our management approach in modern management, it is like lifelong we have to give insulin therapy is the main treatment. In insulin therapy, we give short acting and long acting insulin. Short acting is usually given before meals, and long acting is given at bedtime or in the morning, which act 24 hours along the day to keep the sugar spikes normal. Management of hypoglycemia or diabetic ketoacidosis, and also we can give continuous glucose monitoring and insulin pump in selected patients. Next slide, please. Management approach in our given case. So in our given case, we were giving modern treatment along with Ayurveda treatment. In modern treatment, we were giving insulin, short acting and long acting. Short acting insulin was given before meals, before breakfast, lunch, and dinner. And also the long acting insulin, which is Bezalog, was given at bedtime to keep the sugars normal. In our Ayurveda treatment, we started with Deepan Pachan Dravya to decrease the harm caused by the imbalanced doshas and to improve Dhatu Agni, as the metabolism was also very high of the patient. Kleda Shoshak Dravya was given as diabetes is caused by increased Kleda, and Shrotorod was improved. Cough and Medohar Chikitsa was started. Approach to improve the metabolism and strength of the patient, because all the dhatu was imbalanced, and we have started all the uh, Rasayan treatment. Next slide, please. So in our Samprapti Bhangajanya Chikitsa, we had given Nishadhatre Adi Yog, which have cough made the Pachan action, improves Agni, reduces Kleda, Suvarnmakshik Bhasma for deepen Pachan and Rasayan effect, also to improve the metabolism of the patient. Pravalpishti tablets to improve the symptoms like fatigue and the tissue depletion. So it is like improving the dhatu. Gayatri Adi Kashaya, which is Kaph Har Medhar, Mutral action, main action on diabetes. Faltrik Adi Kashaya, it improves the Akani and reduces cough. Gudmar Churn was given, which have anti-madhur effect, reduces sugar, and have hypoglycemic effect, helps in direct blood sugar control, and reduces sugar cravings and absorption. Next slide, please. We have seen the follow-up and result after 3 months. So the recurrent episodes of abdominal pain was decreased, and the craving which the child had, it decreased to significant level, and Deepan Pachan improved. And the main action was that the sugar fluctuation, which was around 400, it was touching greater than 400, which reduced to a significant level of less than 200 per day before lunch. Next slide, please. Conclusion. So management of type 1 diabetes require insulin treatment, insulin therapy, as we all know. It will require insulin as a mainstay of a treatment, but along with insulin, we can help with Ayurveda management to improve the fluctuating sugar level, to improve the metabolism, and also it helps for further growth and development of the children. It is the significant age to have good growth and development. Also, regular sugar monitoring and blood glucose level is essential for effective and safety and effective treatment. So our combined effect of Ayurveda and modern treatment, and with proper diet and education, we can help in the better quality of life of children, toddlers, and adolescents. Next slide, please. Discussion. Type 1 diabetes is a chronic autoimmune condition requiring lifelong insulin therapy. In our case, the child is clinically stable with normal growth and development, but shows persistent hyperglycemia on insulin treatment. He always had hyperglycemia even after being on insulin treatment. So this suggests the need of reassessment, that insulin doses should be readjusted, diet and carbohydrate intake, and also the injection technique and timing. So along with these things, we had added Ayurveda medicines, management, and diet to improve the sugar level. Next slide, please. Along with modern insulin therapy, Ayurvedic management is given in our patient, which improves the Agni, reduces the cough, made the involvement in Prameya, also supporting overall strength and immunity. So integrated management aims to achieve better glycemic stability, reduce fluctuation, and improve long-term metabolic control for good growth and development. Thank you, sir.
Good evening, sir. Myself, Pinky Yadav from Prasuti Tantra and Serog Department from Dr. D.Y. Patil College of Ayurveda. I would like to present my paper on endometriosis, an integrative review of Ayurvedic and modern perspectives. So, what is endometriosis? Endometriosis is a chronic estrogen dependent inflammatory condition in which endometrial like tissue implants and growth outside the uterine cavity. It primarily affects women of reproductive age and it is associated with uh, symptoms like chronic pelvic pain, dysmenorrhea, that is painful menstruation, dyspareunia, painful intercourse, infertility, 30 to 50% of affected women, significant impairment of quality of life. Next slide, sir, please. Definition according to American College of Obstetrics and Gynecology and American Society of Reproductive Medicine. Endometriosis is defined as the presence of endometrial glands and stroma outside the uterine cavity, most commonly on pelvic peritoneum, ovaries, and rectovaginal septum. These ectopic implants respond to hormonal stimulation causing cyclic bleeding, inflammation, and adhesions and fibrosis. So American Society of Reproductive Medicine has given classification and it comes under stages. Stage 1 minimal, that is associated with isolated implants and no adhesion. Stage 2 is mild, superficial implants, that is less than 5 centimeter. Stage 3 is moderate, multiple implants and peritubal adhesion. Stage 4 is severe, large ovarian endometriomas and dense adhesions. Next slide, sir, please. So according to Sanskrit reference, when Vata moves in reverse, that is Pratiloma, it vitiates Artav, menstrual blood causing pain. It is mentioned in Charak Samhita, Chikitsastan 30. Udavarta Yoni Vyapad, retrograde flow of vitiated Vata correlates with retrograde menstrual theory. Vata Yoni Vyapad, Vata dominant uterine disorder with severe cyclic pain, that is Udar Shul, Rakta Dushti, vitiation of Rakta Dhatu, explains inflammatory ectopic blood implants. Artav Dushti, impure menstrual flow with discomfort, parallels abnormal endometrial tissue behavior. Granthi formation, nodular fibrous swelling corresponds to endometriomas and adhesions. Vandhyatva, infertility due to vitiation of Artavaha Srotas. Primary complications. So these were the Ayurvedic conceptual correlations. Next slide, sir, please. Ayurvedic samprapti. So from causative factor arise doshas imbalance. From Agni impairment arises arm, leading to channel obstruction and tissue depletion or accumulation. It is mentioned in Vimansthan, 5th chapter, 3rd shlok. Nidan, so Samprapti is Nidan Sevan, that is Vata, aggravating diet, stress, Veg Dharan, Atiruksha Ahar, Agnimanda and arm formation, impaired digestive fire, arm accumulation, systemic toxicity, Vata Prakop, especially Apan Vata, reverse flow of Apan Vata, Udavarta, retrograde menstrual flow, Rakta and Artha Dushti, vitiation of blood and menstrual fluid, abnormal implantation outside uterus, Srotorod and Arthavaha Srota Dushti, obstruction of gynecological channels, pain, adhesions, and infertility. Next slide, please. So risk factors according to modern and Ayurvedic. Modern risk factors are early menarche, less than 5 years, nulliparity, delayed childbearing, short menstrual cycle, that is less than 25 days, family history increased by 7x, Mullerian abnormalities, obstructed outflow, low BMI, sedentary lifestyle. According to Ayurvedic, so previous slide, please. According to Ayurvedic, Vegadharan, suppression of natural urges, Atiruksha Ahar, excessive dry food intake, Shoka Chinta, that is grief, stress, Vata provocators, Ati Vyam, Divaswap, overexertion, day sleep, Asatmya Ahar, incompatible food, Prajna Parat, that is violation of wisdom, lifestyle errors. Next slide, please. Clinical features, modern and Ayurvedic. Dysmenorrhea, that is severe progressive cyclic pain. In Ayurvedic, Kastarthav or Udavarta Shul. Dyspareunia, deep insertion pain, especially mid-cycle, Yoni Shul during Samsarga. Chronic pelvic pain, persistent pain more than 6 months, non-cyclic, Vata Chula upon Vata predominant, infertility, 30 to 50% of endometriosis patients, Vandatva Artha Vahasrotas Dushti, heavy menstrual bleeding, in modern menorrhagia, irregular cycles, and in Ayurvedic, Ati Arthav, that is Rakta Pradar, fatigue and systematic symptoms like bloating, diarrhea, urinary symptoms, Alasya, in according to Ayurveda, Alasya, Agnimandya, Amjanya, Lakshans. Next slide, sir. A diagnosis according to modern and Ayurvedic Pariksha, modern diagnostic modalities, clinical history and examination, like cyclic pelvic pain, painful defecation, uterosacral nodularity on bimanual examination, transvaginal ultrasound, TVUS, that is, first line imaging detects ovarian endometrioma's ground glass appearance, deep infiltrating endometriosis. MRI pelvis, gold standard for deep infiltrating endometriosis, superior soft tissue contrast, T1 way hyperintensity, diagnostic laparoscopy, definitive gold standard, direct visualization plus histopathological confirmation of ectopic endometrial tissue, CA125 biomarker, elevated in modern severe disease, limited sensitivity 50% and specificity useful for monitoring. And in Ayurvedic Pariksha methods, Trivrat Pariksha, that is Darshan, inspection, Sparshan, palpation, and Prashna, that is interrogation. Primary assessment framework, Astavit Pariksha, that is Nadi, that is pulse, Mutra, Mala, Jivha, Shabda, Sparsha, Drika, Akruti, 8 folds, constitutional examination, Yoni Pariksha, gynecological examination of vaginal secretion, cervix, and uterus per Shushruta guidelines. Arthav assessment, color, quantity, odor, consistency, timing of menstruation to assess Arthav Dushti and Dosha predominance. Dosha Dushya Samurchana, identifying specific dosha, Vata Rakta predominance, Dushya Arthav Rakta Mamsa, and Srotas involved. Next slide, please. Complications of endometriosis. So complications are infertility. 30 to 50% of endometriosis patients experience infertility. Mechanism, anatomical distortion, impaired oocyte quality, reduced endometrial receptivity, inflammatory cytokinin milieu. Ovarian endometrioma, chocolate cyst. These are this is one of the most found complication. Blood-filled ovarian cyst with characteristic ground glass ultrasound appearance, risk of cyst rupture, secondary infection, and compromise of ovarian reserve, that is AMH reduction. Pelvic adhesions in frozen pelvis, progressive fibrosis obliterates normal pelvic anatomy, dense adhesions between uterus, ovaries, bladder, bowel may create frozen pelvis, a severe surgical challenge, chronic pain syndrome, central sensitization and neuroplastic changes leads to pain persisting beyond tissue pathology associated with anxiety, depression, social isolation, significant psychosocial burden, bowel and bladder involvement, deep infiltrating endometriosis of rectosigmoid, that is 14%, bladder is 1%, cyclic rectal bleeding, catamenial pneumothorax, urethral obstructions are rare but severe manifestations. Next slide, sir, please. Modern management, evidence-based treatment hierarchy. Step 1, analgesia, NSAIDs like ibuprofen, naproxen. First line of mild dysmenorrhea, no effect on disease progression. Hormonal operations, combined OC pills, that is oral contraceptive pills, progestins, norethindrone, Dynogest, LNG, IUS, continuous hormonal cyclic to reduce the retrograde flow. Step 3 is GnRH agonist or antagonist, leprolide neferilin agonist, elagolix, antagonist, medical oophorectomy use with add back HRT, that is hormonal replacement therapy to prevent bone loss, surgical management, laparoscopic excision, ablation of implant, cystectomy of endometriomas, ediciolysis, laparoscopic uterine nerve ablation, that is LUNA for the short form. Step 5 is the definitive surgery, severe refractive, total hysterectomy with or without bilateral salpingo-oophorectomy, reserved for completed family, failed all therapies. Disease may persist on peritoneal surfaces. Next slide, sir, please. Ayurvedic management. Treatment principles, Nidan Parivarjan, eliminate causative factors like diet, stress, lifestyle modification, Vata Shaman, pacify Apan Vata, central to all therapeutic interventions, Deepan Pachan, kindle Agni, digest arm, prerequisite of all the Shodhan therapies, Lekhan Chikitsa, scraping therapy for Granthi, that is endometriomas and adhesions, Shodhan Chikitsa, purification via Panchakarma for chronic and deeply seated disease. Classical formulations can be given are Kanchanar Gugul, it helps in Lekhan, anti-proliferative, reduces Granthi and endometriomas. Ashoka Arista, it is uterine tonic, Vata Pitta Shamak, regulates Arthav. Pushyanuk Churna is homeostatic, anti-inflammatory, indicated in Ati Arthav. Kumarasa, digestive, estrogenic activity of yellow Arthav regulator. Chandra Prabhavati Tridosh Shamak addresses pelvic pain and urinary symptoms. Panchakarma protocol, Basti, medicated, that is medicated enema, Anuasan Basti with Mahanara and tail, plus Niruha Basti with Dashmul Kwat, most effective treatment for Vata disorders, addresses Apan Vata directly. Uttar Basti, uterine Basti, sorry, intrauterine Basti, medicated oils, decoctions administered intravaginally, intrauterинally, highly effective for Vandhyatva, Arthavdushti and adhesion management. Duration is 3 to 7 sessions. Next slide, please. So, next slide. Diet and lifestyle. What diet can be given and what to avoid. So recommended are diet, warm, freshly cooked, easily digestible food, grita, that is clarified butter lubricates Apan Vata and helps in its normal flow. Turmeric, haridra, and it is anti-inflammatory. Curcumin, ginger, garlic, black pepper should be included in diet for armor digestives. Pomegranate, figs, rakta prasadan fruits, dark leafy green, sesame seeds and flax seeds. So lifestyle we can say is we can advise is yoga, Saptabuddha, Konasan, and Viparit Karani. Pranayam, Anulom Vilom for Vata balance, regular sleep schedule, avoid night shifts, warm oil, Abhyanga self massage with Dhanvantaram tail, stress management by meditation and counseling, Pathya, that is to avoid in diet, junk food, processed food, trans fats, excess spicy, pungent, acidic foods, red meat, dairy in large quantity, alcohol, caffeine, aggravate pitta rakta, cold, refrigerated, stale, and incompatible food. Lifestyle to avoid is sleep deprivation. Vata, that aggravates Vata, suppression of natural urges, that is Vegadharan, excessive physical or mental exertion, sedentary lifestyle promotes formation of kapha and arm, irregular eating schedule, and skipping meals. Next slide, sir, please. So, in conclusion, endometriosis is a chronic multifactorial condition affecting 10% of the reproductive age women globally, with significant impact on fertility and quality of life. Ayurveda offers comprehensive conceptual framework, Udavarta, Vata, Jioni Vyapad, Rakta, Arthavdushti, that parallels with modern pathophysiological understanding. An integrative approach combining evidence-based pharmaco sorry for pharmacotherapy with Ayurvedic chikitsa like Panchakarma, and classic formulation demonstrates superior holistic outcomes. Early diagnosis remains critical. The 7 to 10 years diagnostic delay must be reduced through awareness, clinical education, and patient advocacy. Future high quality RCTs are needed to validate Ayurvedic interventions, standardized protocols, and enable inclusion in the global clinical practice guidelines. Thank you, sir.
Thank you, doctor. And one more poster presentation is there.
Okay, sir. So, role of Uttarbasti in infertility. That is my poster presentation. A holistic Ayurvedic approach to reproductive health. So, for the background, infertility, that is in Ayurvedic known as Bandhitva, is a major reproductive health challenge affecting millions worldwide. Ayurveda aims at restoring fertility by addressing the root cause by balancing doshas and nourishing artavas and garbhashay. So, in Charak Samhita Sutrastan, 4th chapter and 8th shlok says healthy seed, a proper season, and healthy uterine field leads to conception. So, what is Uttarbasti? Uttarbasti is specialized Ayurvedic procedure in which medicated oil, ghee, or herbal decoction is instilled into the uterine cavity through vaginal route. It acts directly on Artavaha, Srotas, and Garbhashay to promote fertility, and classical reference is given in Charak Samhita Siddhantsan 8 chapter 18 shlok. Medicated oil or decoction instilled into uterus is called Uttarbasti, and Uttarbasti is highly recommended in condition of infertility and uterine disorders. Vandhatva in infertility in Ayurveda, Vata Pitta Kapha and Rakta Dusti, Artav Dusti, Bija Dusti, Garbhashay Dusti, Mansic factors like stress, anxiety, Avaran of Artava Srotas leads to infertility. So, action of Uttarbasti and infertility. It does Shodhan and Shaman of Artava Srotas, nourishes Garbhashay and improves endometrial receptivity, balances dosha, especially Apan Vata, reduces inflammation and adhesion, promotes quality of Artavaha and conception. So, indications are primary and secondary infertility, Artav Dushti, anovulation, that is PCOD, tubal factor infertility, repeated implantation failure, thin endometrium, habitual abortion. And procedure of Uttarbasti is a Purva Karma we do by Snehan, Swedan, and Yoni Prakshalan. A Pradhan Karma, that is main procedure, is medicated oil decoction around 5 to 20 ml. Usually 5 ml is taken instilled in uterus using sterile Uttarbasti device. Paschat Karma, rest for 30 to 45 minutes, followed by Pathya and Apathya. Course is it can be done for 3 to 6 sittings, starting from Shuddha Ritu, that is 4th to 12th day of menstrual cycle. And procedure should be done under expert supervision with strict aseptic precaution. Drug used in Uttarbasti are Sheetbala Tel, Falagrita, Jivanya, Gana Kwath, Dashamul Kwath, Lodhra, Ashoka, Kwat, and Balatel. Evidence and research. A study have shown that Uttarbasti improves endometrial thickness, hormonal balance, and pregnancy rates. Helps in reducing chronic pelvic inflammation and adhesions. Enhances quality of life and psychological life being. Although main clinical research is needed to establish standardized protocols. So benefits of Uttarbasti in infertility is that it improves uterine environment, enhances fertility and conception rate, regulates menstrual cycle, reduces stress and promotes relaxation, supports healthy pregnancy outcome, and it is safe, natural, and holistic approach. Thank you, sir. My poster presentation has been done.
Thank you, doctor. Thank you for the detailed paper and poster presentation. Thank you so much, doctor. And next we go to the another presentation. I would like to invite Dr. Sodhi S. Rane for the paper presentation.
Evening everyone, myself Dr. Swati Rane, and today my topic of presentation is role of Sthanik Chikitsa in treatment of cervical factor infertility. Next. So introduction, as we all know that nowadays infertility has become a growing reproductive health problem which is affecting a considerable number of couples worldwide. Among female factors, we can see that cervical factor infertility, it contributes approximately 5 to 10% of cases. The cervix play crucial role in sperm transport, its protection, nourishment as well as survival. But if there is any alteration in cervical mucus quantity, quality or consistency, it can prevent sperm penetration. Modern management options are very limited and they are mostly invasive procedures. But in Ayurveda, we have a special concept which is called as an Sthanik Chikitsa, where we do a localized therapeutic approach which targets the site of pathology directly, and it is beneficial in treating cervical factor infertility in females. Next. So, cervical factor infertility, exactly what it means. Cervical factor infertility mainly refers to infertility which is caused by abnormalities of the cervix or cervical mucus. Common causes include thick or scanty cervical mucus, sometimes the cervical infection, inflammation, cervical stenosis, and hostile mucus. Hostile mucus in a sense which is not suitable for the sperms. This condition impairs the sperm motility, survival, and its entry into the uterine cavity, and thus it prevents the fertilization. So we have some special tests for this, like we have PCT, that is postcoital test, and we have SMIT, that is sperm mucus interaction test. These often indicate the cervical factor involvement in the disease. Restoration of healthy cervical environment is very much essential for fertilization and successful conception. Sthanik chikitsas or local therapies, they play an important role in managing these conditions. Next. So, if we consider Ayurvedic view of cervical factor infertility, cervical factor infertility can be mainly correlated with Yoni Vyapada, which is described in Ayurveda. It mainly involves Vata and Kapha dosha, dushti, and sometimes it is also associated with Pitta also. So, Lakshanas which we can see mainly are like Kandu, Pichilata, Rukshata, Yoni Srava, and some inflammatory symptoms which resembles the cervical pathology. There will be involvement of Garbhashaya and Yoni Marga, hence the treatment should be directed locally at the affected site. Next. So, how is the cervical factor is a cause of Vandatva? Ashuddha Yoni, first of all. According to Acharya Bhela, the woman will remain infertile due to Vata vitiation and also due to Yoni dosha. We have Suchimukhi Yoni Vyapad. According to Acharya Charaka, due to Rukshahara Sevana, which leads to Vata Dushti, and here it causes the pinhole cervix, which is leading to infertility. Next, we have Karnini Yoni Vyapad, where the Karnikas, that is small Mamsankura resembling things, are caused, and it causes the obstruction of the Rakta Marga. Kapha and Rakta are mainly vitiated along with Vata dosha, and it causes Karnini Yoni Vyapad. Next, we have one more common Yoni Vyapad which we can see, that is Shleshmiki Yoni Vyapad, where there will be excessive Srava. Excessive Yoni Srava is the main Lakshana here, associated with the other symptoms like Yoni Kandu. Next, we have Garbhashaya Griva Mukhagrata Brana, that is also seen nowadays in most of the females. That is, here the cervix is unhealthy, where there is discharges like blood, mucus, and these may not allow the sperm to ascend up, leading to Vandatva. Next. So, what is the need for Sthanik Chikitsa in cervical factor infertility and what is its mode of action? So, let us understand. Cervical pathology is mainly localized, and here oral medication may not sufficiently reach the cervix. So, Sthanik Chikitsa ensures the direct drug delivery to cervical tissues, and it provides faster relief, and it has very minimal side effects. So, these are its benefits. It enhances the local circulation of that area. It does the activity of cleansing and healing also, and it is very much suitable for cervical factor infertility. The drugs that gets absorbed locally and act on the affected tissues and acts as anti-inflammatory, antimicrobial, and tissue regenerative actions are also there because of this certain procedures. It improves the cervical mucus quality and also restores the physiological environment, which is very much favorable for conception. Next. So first we have in this is Uttar Basti. Uttar Basti is mainly described as the main line of treatment for Vandatva, especially when Vata is predominant dosha. This acts directly on the uterus, cervix, and vaginal tract also. It corrects the local pathologies, structural and functional abnormalities of the female reproductive tract. We use the different medicated drugs in Uttar Basti, and it has the actions like Shodhana, Snehana, Ropana, Vatahara properties according to the condition of the female, and it improves the uterine receptivity and fertility potential. Next. Next, we have another procedure called as an Yoni Dhavana. It refers to vaginal douching, where we use the Kashaya, Swarasa, Godugdha, etc. This is mainly indicated in Yoni Srava, Yoni Pichilata, Yoni Shotha, Yoni Durgandha, and Yoni Shola. These are the main indications. And in case of Dushta Srava, that is any abnormal vaginal discharges, Shitala Yoni, the Yoni should be washed with Tikta Kashaya Dravyas. Mainly Tikta Kashaya and Snigdha Dravyas are indicated here. But in other conditions like Daha, that is burning sensation, the yoni should be cleaned with some of the shita dravyas, that is cold liquids, which are mainly amla, lavana, and snigdha in nature. And if there is dushta strava, we generally use tikta and kashaya dravyas. But we have the most of the dravyas like means generally used dravyas for yoni dhavana or yoni cleansing are like triphala, panchavalkala, nimba, lodra, daru haridra, and musta. Mainly in kashaya forms they are used. Next. Next, we have Yoni Pichu. This is another local therapeutic procedure where Yoni Pichu is provides a sustained and unctuous environment to cervical mucosa. It is mainly used in dry, inflamed, and irritated cervix. It is mainly useful in treatment of Vata dosha, and it improves the elasticity of that particular area. And Yoni Pichu provides the snigdha and ruduta to cervical mucosa and is useful in Vataja and Ruksha conditions. And it also provides the further it prevents the further irritation and dryness, and it enhances the sperm survival and entry into the cervix. Mainly the tailas which are used are like bala taila, kshira bala taila, shatavari grita for mainly for yoni shosha, upapluta, and shula type of conditions. Next, we have Yoni Dhupana. Yoni Dhupana is mainly indicated in some of the infectious conditions like Yoni Kandu, Srava, and Shota. If these are the symptoms, we use Yoni Dhupana. Drugs used are mainly Surasa, Vacha, Hingu, Patha, and Vatamula. And Dhupana has the action like it is Krimigna and it is Kapha Shoshana action, and it does the Yoni Shuddhi. It improves the local circulation by its Ushnavirya. As we know that Dhupana has Ushnavirya, and it reduces the infection which is mainly caused due to Kapha dosha and abnormal vaginal discharge. Next. So we have another one condition, another one treatment, that is Yoni Varti. Yoni Varti, it allows the prolonged contact of the medicine with the cervix. Like these drugs mainly possess the Lekana, Shodhana, or Ropana guna. It is useful in Yoni Srava, Krimi associated with associated conditions, and it also reduces the infection and inflammation also. And it improves the cervical tissue health, and it is used in Kafaja and Pittaja Yoni Vyapat. Next, we have Yonik Shara. Yonik Shara is mainly indicated in Medha Gratita Yoni, where the Medha is more or Kapha is more. It acts as Chedana, Lekana, and Shoshana. These are its main actions, and it removes the abnormal tissue and thick discharge, that is any Srava, mainly in Kafaja Yoni Vyapat. And after Sneha, Pichu is advised mainly to restore its normalcy, and it is used in chronic cervical pathology conditions mainly. So these some of the studies were there which were done for, and these are the clinical evidences in Ayurveda for cervical factor infertility. Next. So these are the articles which were published, like role of Varsha drugs on cervical mucus in management of infertility, and one more, how the cervical factors are cause of Vandhatva, importance of cervical factor infertility they have mentioned along with treatment also. Next. So conclusion, if we come, cervical factor infertility, it is a sthanik vikara. So here we require sthanik chikitsa only. Sthanik chikitsa is most rational line of treatment here, and it bridges the gap between the shamana and shodhana therapy. It is sthanik chikitsa. It is different from shamana as well as shodhana, and it is safe, effective, and it is economical, and it also has support of many classical references from various samhitas, and hence it plays a vital role in managing the cervical factor infertility. Next. So these are my references. Thank you.
Thank you, Doctor. Thank you for the well explained and insightful presentation. And next we go to the another poster presentation. I would like to invite Dr. Disha Devendra Jain for the Poster presentation.
Good evening, everyone. Myself, Dr. Disha Devendra Jain, PG scholar from Panchakarma Department from Dr. D.Y. Patil College of Ayurveda and Research Center, Pimpri, Pune. Today, I am presenting a poster entitled Significance of Panchakarma in Gynecological Disorders. Recently, on 20th of May 2026, we observed Menstrual Hygiene Day, a global initiative dedicated to raising awareness about menstrual health and hygiene. The day itself is symbolic. May, the fifth of the month of the year, represents the average duration of menstruation, which is approximately 5 days, while 28 signifies the average length of the menstrual cycle. Menstrual hygiene refers to maintaining cleanliness, adopting appropriate hygienic practices during menstruation to prevent infections and promote reproductive health. Despite increasing awareness, menstrual hygiene remains a neglected aspect of healthcare, especially in developing countries. Limited access to sanitation facilities, social stigma, cultural taboos, lack of awareness, and inadequate menstrual education continue to affect men's health. As the saying goes, prevention is better than cure. Ayurveda emphasizes preventive healthcare and describes a specific regimen known as Rajaswala Paricharya, which outlines dietary, lifestyle, and behavioral guidelines to be followed during menstruation for following reproductive health and preventing disease. Historically, women led relatively simple lifestyles, balanced diets, adequate physical activity, and lower levels of psychological stress. However, in the modern era, lifestyle patterns have changed drastically. Irregular food habits, excessive consumption of processed and fast food, lack of exercise, sedentary occupation, sleep disturbances, mental stress and anxiety, excessive physical exertion, and suppression of natural urges have become increasingly common. According to Ayurvedic principle, these factors contribute the vitiation of Apan Vata, a subtype of Vata dosha, which is responsible for menstruation, ovulation, conception, childbirth, and proper functioning of pelvic organs. When the Apan Vata becomes disturbed, normal reproductive physiology is affected, leading to various gynecological disorders. Therefore, maintaining good gynecological health is essential for every woman. Healthy reproductive functions helps regulate menstrual cycle, maintain hormonal balance, support fertility, and improve overall physical, mental, and emotional well-being. Although modern medicine offers several treatment modalities such as hormonal therapy, insulin sensitizers, etc., Ayurveda provides a holistic and root cause oriented approach through Panchakarma. Panchakarma is a specialized biopurificatory therapy designed to eliminate vitiated doshas and accumulated harm from the body. It helps remove strotorod or obstruction of body channels, restoring normal physiology and rejuvenating the reproductive system. Now, I would like to briefly discuss the significance of different Panchakarma therapies in gynecological disorders. The first one here is Vaman Karma. It is primarily indicated in kapha dominant disorders. It is useful in conditions such as PMOS, hormonal imbalance, kapha utklesha, and euphoria. By eliminating excess kapha, it improves metabolism, clears channels, and supports hormonal regulation. The second one here is Virechan Karma. It is considered best therapy for pitta-related disorders. It is beneficial in heavy menstrual bleeding associated with Rakta imbalance and Pitta imbalance and certain hormonal disturbances. It reduces inflammation and promotes hormonal equilibrium. Basti therapy. It is regarded as the prime therapy for Vata disorders. Since most gynecological conditions involve vitiation of Apan Vayu, Basti plays a crucial role. It is highly effective in dysmenorrhea and infertility, helping regulate pelvic function and improving reproductive health. Uttar Basti, it is a specialized Panchakarma procedure designed for gynecological and reproductive disorders. It is indicated in PMOS, PID, recurrent miscarriages. It directly acts on reproductive organs and enhances uterine health. Nasya, it influences the neuroendocrine system and helps maintain hormonal balance. It is beneficial in stress-related menstrual irregularities, hormonal imbalance, and infertility by regulating the HPO axis. Shirodhara. With increasing exposure to stress, Shirodhara has become very relevant in today's generation. It calms nervous system, reduces stress and anxiety, improves sleep quality, and is particularly useful in stress-related infertility, hormonal imbalance, and PMOS. Yoni Prakshalan. It is not a Panchakarma therapy, but it is a stanic procedure which can be used for chronic PID and leukorrhea. It helps to cleanse the reproductive tract, reduces inflammation, improves local hygiene, and promote healing. Through these therapies, Panchakarma not only provides symptomatic relief but also addresses the underlying pathogenesis of disease by balancing the doshas, improving circulation, reducing inflammation, and regenerating reproductive tissues. To conclude, gynecological disorders are increasingly prevalent due to modern lifestyle factors that contribute to vitation of Apan Vata and disturbances of reproductive physiology. Panchakarma offers a holistic, preventive, and therapeutic approach by addressing the root cause of diseases rather than merely controlling the symptoms. Through therapies such as Vaman Virechan, Basti, Uttar Basti Nasya Shirodhara, Panchakarma helps restore reproductive health, improve fertility, and enhances the overall quality of life in women. Thank you.
Okay, doctor. Thank you for the well-explained poster presentation. And next, I would like to invite Dr. JSVS Nandakishore for the paper presentation.
Good evening, sir. Myself, Dr. J. Nandakishore, final year PG scholar, Department of Dravyaguna from Dr. Adarsh Government Ayurvedic College, Vijayawada. Today, my topic is complete prescription writing in Ayurveda. Here we deal with introduction, objectives of prescription writing, types of prescription, parts of prescription, and pre-prescription assessment, guidelines for prescription writing, and conclusion. Next, coming to definition, a prescription is a written order by the registered physician with the direction for preparation or dispensing of the prescribed drug and their use by the patients. Prescription mainly gives details about patient, the chief complaint, disease condition, provisional diagnosis, treatment, how to take the medicine, restriction of diet. Objectives of prescription writing: to provide clear and complete instructions for treatment, to ensure patient safety, to serve as a legal record of treatment, to ensure continuity of care and follow-ups, to reflect rational practice. Types of prescription. There are two types of prescription: pre-compounded prescription and compounded prescription. Coming to first one, in this, like Triphala Churna, Apathya, these type of formulations are directly prescribed to the patient. In compounded prescription, some raw drugs or ingredients are prescribed to prepare a formulations like Chokchinyadi Churna, Vata Gajangus Ras, and Samir Panagras. These three drugs are prepared to prepare another formulation. In this type of preparation, the physician has to use his yukti for specific individual. These are examples. In pre-compounded prescription, directly Ashwagandha Churna, Yogaraj Guggulu formulations are directly prescribed. In compounded prescription, Ashwagandha Churna, Arjuna, Kokshora. Then instructions to be given: make Churna and dispense 100 grams, like that. Next, parts of prescription. Here we deal with physician or prescriber office information, date, patient data, superscription, inscription, subscription, and prescriber signature and registration number. Here, physician information. Name of the physician along with address, phone number, and email should be mentioned, because in case of any emergency, these details are useful. Then date. The top of the prescription should have the date. As a result, the pharmacist can quickly determine the date of prescription. And patient data. It includes name, age, sex, and address of the patient. This helps in identification of the patient and dosage adjustments. Superscription. It consists of symbol RX, which means recipe, or recipe, which means to take. Next, inscription. This is the main part of the prescription, which deals with drug dosage form, strength required for the patient. Then subscription. In compounded prescription, method of preparation and dosage of the drug to be dispensed can be dealt in this subscription. Next, physician signature and details. This includes physician's name, qualification, registration number, seal, and signature. Next, this name of physician information, patient information, superscription. Inscription contains drug and dosage form. Then subscription contains the direction to pharmacist. Then signature are instructions to patients, physician details. Pre-prescription assessment. This assessment helps in examination of the patient and examination of the disease. In Charaka Vimanasthana, 8th chapter, it is mentioned, Parikshastu Kalu Prayojanam Pratipatti Jnanam. Means examination of the patient helps in deciding the proper line of treatment for the correction of morbidity. In Charaka Vimanasthana, 8th chapter, 94th sloka, which explains that examination of patient is helpful in obtaining knowledge regarding the span of the life, strength, and intensity of morbidity and strength of the individual. On the basis of this, the dosage of the therapy can be determined. These assessments are systematically performed through Trivida Pariksha, Ashtasthana Pariksha, Dashivida Pariksha, and Vidhana Panchakam. Let us deal with an example. Suppose a patient came with complaints of sore belching, burning sensation in heart. Then the doctor has no idea what to prescribe. Then he has to examine the patient. By examining the patient, he knows about the details of history of intake of Ati Amla Katu Lavana Ahara, symptoms of Amlodgara Hruddhaha, Pitta Janadi, light white coating on the tongue, Ushna Sparsa. By examination of the patient, he gets the details like Pitta Prakopa Nidana, Pitta predominance plus mild ama, Mridu Costa, Madhyama Bala, disease in active stage, Agni Dushti. By seeing all these symptoms, he diagnosed the disease as Amlapitta. Later, he has to plan for the treatment like Nidhan Parvajana, which deals with avoid intake of Ati Amla, Katu Ahara, Amapachana, Pitta Shamana, Deepana Pachana drugs, Pitta Shamana, Sita Virya formulations. Next, Lagu Shita Madura Ahara. By planning the treatment, he prescribed Avipattikar Churna, Kamadudras, Shankabasma, Gudish Sattva, and Drakshadi Kashaya. And diet advice he has given rice gruel, milk, green grams, sweet fruits, like that. And Apathya, the patient must avoid spicy, sour, fried food, tea, coffee, night awakening, stress and anger. Like that. Next, guidelines for prescription writing. Even if prescription is typed or printed, the doctor must sign with date. Must sign as close as possible to last drug listed in prescription. Overwriting on a prescription should be avoided. We must always examine first. Prescription must be clear, complete, and legible. It should contain patient details, diagnosis, and assessment, which contains pradhana dosha, dusha, srotas involved, and agni status. The medicine should contain drug name, dosage form, dose, anupana, time of intake, and duration. Then he has to suggest ahara and vihara, panchakarma procedures if needed, follow-up, and physician details. Next, prescribe only when there is clean need. Next, use the lowest effective dose, limit duration of therapy, avoid unnecessary refills, proper documentation, and patient counseling must be needed. Doctor should avoid recommending medicines on telephone or SMS. Write the prescription for family members and relatives also. Discourage them from asking for medicines without a prescription. Doctor should always encourage the pharmacist to call them up in case of any problems, doubts, queries in their prescription. Next, a ideal prescription should be like this: physician details and clinic address, mobile number, and email. Patient details should contain name, date, age, gender, and vitals. It should contain diagnosis and assessment, which contains pradhana dosha, srotas involved, dusha, agni status. Next, main part of the prescription like drug, dosage form, dose, anupana, time of intake. Next, ahara vihara advice, follow up. Conclusion. Prescription writing in Ayurveda is a rational and ethical clinical process, not a mechanical act of listing medicines. It is the final outcome of thorough pre-prescription assessment, including proper examination of the disease and the patient. Every prescription is the beginning of a new experiment. Begin it carefully. Remain vigilant, make the patient healthy. Thus, a good Ayurvedic prescription reflects the yukti, responsibility, and ethics of the physician, ensuring patient safety and therapeutic success. Thank you.
Thank you, Doctor. Thank you for the well-explained and informative presentation. Next, we go to another paper and poster presentation. I would like to invite Dr. Ashutosh Parphane for the paper presentation on the topic Shaya Mudra.
Good evening, everyone. I'm Dr. Aishwarya. PG Scholar, Department of Commerce from Dr. D.Y. Patil, College of Ayurveda and Research Center, Pimpri, Pune. Am I audible, sir?
Yes, Doctor. Audible, Doctor.
Yes. I'm going to present a paper on case study on Shayyamatra, an Ayurvedic perspective on nocturnal enuresis. Next slide, please. Introduction and clinical case. Shayyamatra is a pediatric disorder characterized by involuntary passage of urine during sleep, severely affecting the mental and social well-being of children, which includes involuntary urination during sleep for past 2 years, bedwetting frequency of 4 to 5 times a week, unusually deep sleep pattern, significant anxiety and emotional embarrassment, no history of daytime urinary incontinence or burning menstruation. Next slide. Profile and medical history of the patient. A 8-year male child was presented with complaints of excessive urination or nighttime urination since last 2 years for a frequency of 4 to 5 times a day at nighttime. Historical context was past history, no history of diabetes, urinary tract infections, or major illness or hospitalization. Family history included no any history or relevance. Personal history, normal appetite, regular bowel habits, mixed diet, and deep sleep patterns. Next slide. Clinical examination showed general vitals. General vitals were within normal limits for the age. Systemic examination showed no abnormalities and functioning normally. Abdominal examination reveals a soft and non-tender structure with no palpable masses. Genitourinary. Thorough examination of the genitourinary system indicates no anatomical or functional abnormalities detected that would mechanically explain the involuntary micturition. Next slide. Assessment and diagnosis of the patient was done on basis of the Ayurvedic parameters that is dosh, dishya, strotas, adhisthana, and 5 diagnosis. Dosha was Vata predominant, Apan Vata with Kapha association. Dishya was Mutra, Strotas, Mutra was Strotas, Adhisthana Basti. Final diagnosis was Shayyamatra, which can be correlated with modern primary nocturnal enuresis. Next slide. Advised treatment plan for the patient was first was Nidhan Parivarjan, that was elimination of positive factors involving restricting excessive fluid intake before bedtime, completely avoiding cold drinks at night, and establishing a proper, consistent sleep routine. And a Shaman Chikitsa for 6 weeks was given, in which Chandraprabhavati, 1 tablet administered daily twice, ashwagandha churna 2 grams mixed with milk at night for nervous system strengthening. Milk which was usually warm, avoided cold milk. Next slide. Therapy and lifestyle changes were also given because nocturnal enuresis is considered a behavioral disease in pediatrics. So behavioral training was given, implementing structured wake-up training during night to condition the child. Physiological support was also given, utilizing positive reinforcement to encourage dry nights, providing active counseling to significantly reduce the child's underlying anxiety, guilt, and social embarrassment. Pathya was also told, consuming a light dinner with only a moderate quantity of warm milk, practicing evening yoga and relaxing techniques while adhering to strict regular sleeping schedule. Next slide. Follow-up timeline was recorded. A baseline, because the patient was started on treatment. Patient experiencing 4 to 5 bedwetting episodes weekly, coupled with high anxiety and disruptive sleep patterns. After 2 weeks of medication, noticeable reduction in symptoms. The frequency of bedwetting episodes successfully reduced to 3 times per week. After 4 weeks, clinically improved bladder control observed at night. The patient displayed significantly reduced levels of stress and anxiety, which was told by the parents. After 6 weeks of medications, major milestone was achieved. Bedwetting reduced to nearly once weekly. The child confidence and overall social well-being had improved significantly. Next slide. Discussion. Holistic management. Shayyamutra arises from vital Apanvata and weakened bladder mechanisms, compounded by hereditary and psychological factors. This case demonstrated targeted Ayurvedic treatments combining dose balancing, bladder strengthening, and behavioral modification provide highly effective and holistic management for pediatric nocturnal illness. Next slide. Conclusion. Ayurveda offers a safe, effective, and holistic approach to managing Shayyamutra, integrating herbal medicines, lifestyle modification, and psychological counseling greatly improves both the physical condition and the mental well-being of the pediatric patient as well as the parents of the patient. Next slide. Thank you. Sir, I also have
Thank you,
a poster.
doctor. And one more poster presentation is there.
Ayurvedic management of functional constipation in children. So I have chosen this topic because now the constipation in children has significantly increased. Under the able guidance of Dr. Priyanka Damkarna, I'm going to present this poster. So introduction of functional constipation is a common gastrointestinal problem in children characterized by infrequent hard stools, painful defecation, and incomplete evacuation of the bladder. In Ayurveda, this condition can be correlated with malbadhata, mainly due to Vata, Mandagni, and improper ahar. Correlation with malbadhata, Nidan, Shushka or Rukshahar, low fiber diet, Veg Dharana, Alpa. So, can you zoom it a little bit? Yes. Excess dairy and junk food and mental stress. Samprapti or pathogenesis, according to Ayurveda, Nidan Sevan, which causes Agni Dushri, which causes Vatrapok, Apan Vayu Dushri, and which causes Malbadhata. Lakshana includes hard or dry stools, infrequent bowel movement, straining, pain during defecation, abdominal discomfort or bloating, dietary habits and gut health, which contribute or which the factors which are contributing according to medical science, low fiber intake, inadequate water, excess food, excess junk food, irregular meal timings, sedentary lifestyle, poor sleep, psychological stress, and stool withholding behavior. Modern management, non-pharmacological and pharmacological are different. Non-pharmacological is actually the behavioral training, which is toilet training, adequate fluid intake, high fiber diet, regular physical activity, positive reinforcement, and behavioral therapy. Pharmacological included osmotic laxatives, stool softener, lubricants, probiotics, and short-term use. The guidance. Foods which need to be avoided: junk food, bakery items, cold and dry foods, excess dairy and cheese, and processed foods. Ayurvedic management included Nidan Parivarjan, Shamana Chikitsa, Ahar, and Vihar. Nidan Parivarjan, which includes avoid causative factors like Ruksha Ahar, cold foods, excess dairy, late night eating, and vague dharana. Shaman Chikitsa, in which Tripura Churna, Gandharva Hariti, Draksha Avleya, Avaya Arishta, Vashtak Churna was used. Erandathale is not used in pediatrics. Ahar, warm, freshly prepared food, fiber-rich diet. Ghee was used. Ghee was advised to be used in food. Soap presence in food. Avoid heavy processed food. A case series, observational case series of 3 cases was recorded. A 5-year male child with presenting symptoms of hard stools in 6 months, stool once in 3 to 4 days, straining with straining. Intervention which was used: Tripura Churna half teaspoon HS with warm water and abdominal massage during night, which resulted in outcome improved stool frequency, soft stools in 4 days. Similarly, 2 more cases in which Gandharva Rithyam in Vashtak Churna was used, which also gave a good outcome of regular bowel habit, pain relief, appetite improvement, symptom relief, and improved digestion in under 1 month. So, key takeaway points are: early intervention prevent complications, diet plus lifestyle modification is a key, and Ayurvedic addresses root causes. Individual approach gives best results. References are given in the below. Thank you, sir.
Thank you, Doctor. Thank you for the well-explained paper and poster presentation, and thank you so much, Doctor.
Thank you.
And next, I'd like to invite Dr. D. Sheda for the paper presentation.
Good evening everyone. Myself Dr. Deshweta, Department of Kaya Chikitsa from Dr. NRS Government Ayurvedic College, Vijayawada. My presentation topic is atherosclerosis through the lens of Ayurveda. Introduction. Cardiovascular diseases remain the leading cause of mortality worldwide. Atherosclerosis generally is a disease condition leading to serious consequences such as ischemic heart disease and stroke. It is a disease in which plaque gets built up inside arteries, resulting in atherosclerosis. Plaque is generally formed by fat, cholesterol, calcium, or other substances found in the blood. It hardens and narrows the arteries over time. The passage of oxygen-rich blood to the heart and other regions of the body are hampered as a result. Ayurveda actually conceptualizes this condition as Dhamani Pratichaya, Medo Roga, and Margavaroda. Ayurveda views plaque formation not as an isolated vascular event but as a systemic metabolic failure where impaired digestive fire, that is Agni-mandya, creates production of ama, that is toxic byproducts, and this infiltrates and blocks the circulatory channels. Now this presentation aims to bridge ancient wisdom with modern science, demonstrating how combined Ayurvedic therapies with modern diagnostics offer a superior integrative approach to reversing arterial disease. Ayurveda understands atherosclerosis as a kapha-dominant Urdhwaga as it begins due to accumulation of kapha dosha and medas, that is lipids, in the major arteries. Dhamani Pratichaya is a condition described as upalepa, that is coating of the internal walls of the dhamani by excessive medas and kapha causing sanga or obstruction in the dhamani, affecting the normal flow of Vyanavata, which is responsible for the pumping action of the heart that propagates the circulation of blood in the body. Here are some of the causative factors of Dhamani Pratichaya. In Aharaja, excessive intake of Guru, Atisnigdha, Abhishyande, Madhur Rasa aggravate Kapha and Medas. And in Viharaja, Abhyayama, Divaswapna, Alasya, Shaya and Asana Sukha also aggravate Kapha and Medas. In Manasika factors, Atichinta, Udvega, Krodha, Bhaya and Shoka aggravate Pitta and Vata. Next is Bija Dosha, that is any genetic factors. Family history of Urdhwaga, hypertension, dyslipidemia and other genetic factors are responsible for Vata vitiation, which leads to defects in Shrotas and fat metabolism. Vyadijanya, that is any pre-existing medical conditions like Prameha, Staulya, Abaddamedas, Raktachapa lead to atherosclerosis. Agantuja, that is any exogenous causes like exposure to toxins, tobacco products and pollutants may also cause Shrota Dushti and Dosha vitiation, and they may also be classified as Vishaja Nidhana. All these etiological factors described above lead to vitiation of all doshas, especially kapha and medas, causing Shrota Dushti in dhamanis and accumulation of excessive abadda medas in rasa rakta dhatus, leading to Dhamani Pratishaya and eventually Urdhwaga. Next is the stage-wise progression of Dhamani Pratishaya. That is, in Sanchaya stage, the kapha pradhana tridoshas get vitiated due to the nidhana factors, leading to accumulation of doshas, especially in the Ura Pradesha. And in Prakopa stage, these doshas aggravate further and fill up their sites, resulting in the formation of ama due to Mandagni. And in Prasara stage, the doshas overflow from their site and start circulating all over the body along with Rakta. At this stage, there may be hypertension or hyperlipidemia or both, leading to Kavaigunya of Rasavaha Dhamani, supplying the heart, which may be understood as endothelial dysfunction of the coronary artery. In Sthana Samshaya, the Abadha Medas, mainly LDL cholesterol and Kapha dosha macrophages, they get lodged at the site of Kavaigunya, leading to Dhamani Pratichaya. Next, in Vyakta stage, this stage shows symptoms such as Hritshula or angina, Gaurava, Alasya, etc. In Beda stage, the complication starts arising, leading to Marma Beda, that is irreversible damage to the heart. Some of the lakshanas of Dhamani Pratichaya are Gaurava, that is heaviness in the body, Alasya means excessive tiredness or lack of enthusiasm, Angamardha is generalized body pain due to Shrotarodha, Hritshula is chest discomfort or tightness in chest, Shwasa is difficulty in breathing during exertion, Atisveda means excessive perspiration, especially on exertion. Dhamani Katinya is hardening of vessels, that is, there will be loss of elasticity in arteries and stiffness of arteries occur. Chikitsa, Nidhana Parivarjana. Avoiding all the dietary and lifestyle causes is the first and foremost step towards a treatment. Avoiding those that increase kapha and medas, regular physical activities, healthy sleep habits, avoiding smoking, alcohol, and other narcotics are the lifestyle modifications that need to be adopted. Apart from this, it is important to maintain pleasant environment and practice yoga and meditation to avoid stress and anxiety. Next comes Amapachana and Agni Deepanam, Vatanulomanam, Katutikta Rasa Pradhana Dravyas. Katu Rasa helps reduce plaque formation, digest ama, and improve lipid metabolism. Tikta Rasa is mainly Lekhana, Shoto Shodhana. It helps digest ama, reduce kapha and medas. It purifies blood and improve vascular circulation. Thereby, it prevents progression of atherosclerotic plaque formation. Next is Shota Shodhana and Lekhana Aushadas, that is scraping of pathological fat accumulation, Rakta Prasadaka Dravyas, Medohara Chikitsa, Mutrala Aushadas like Gokshura, which acts like diuretic, can be given. Yukti Vyapashraya. While treating atherosclerotic disease, it is important to know that acute and severe manifestations should be treated according to established modern medical protocol for emergency management. Chronic conditions and patients who have been stabilized after an acute phase can be rehabilitated effectively, integrating with Ayurvedic treatment principles. At last, it comes the Sadvritta and Rasayana Chikitsa. Following healthy daily and seasonal regimen, that is Dinacharya and Ritucharya, help in preventing reoccurrence of cardiovascular disease. Shodhana Chikitsa. Shodhana procedures must be done mildly with caution and may be avoided in patients who have advanced cardiovascular disease. The heart being a vital marma, all Shodhana procedures, especially Vamana, is normally contraindicated. In certain conditions, when the patient has good strength to withstand the treatment procedure and when the disease is not very severe and acute, Shodhana procedures may be administered. In Vataja and Pittaja condition, Virechana is preferred, and in Kafaja condition, Vamana may be administered, but with caution. Basti can be administered in Vataja Urdhwaga in early stages and for prevention. Lekana Basti is useful in Medo Dushti. Shamana Chikitsa. After Shodhana Karma or for patients who cannot withstand Shodhana procedures, Shamana Chikitsa is advised. Hrudya Dravyas are beneficial in cardiovascular diseases. Here are some of the Hrudya Dravyas based on their action. Stiran Dashamula act as Vatahara. Padmaka, Kushmanda, Vidhari and Yashtimadu act as Pittahara Dravya. Arjuna, Guggulu and Lashana act as Kafahara. Here are some formulations indicated in atherosclerosis like Chintamani Ras, Hridayarnavaras, Nagarjuna Abraras, Guggulu Panchapala Gulika, Prabhakaravati, Shivagulika, Arjunadi Kwata, Nayopaya Kwata, Indukanda Kwata, Ashtachurna, Pushkaramula Churna, and in Lehya Dashamula Haritaki Lehyam, Gomutra Haritaki Lehyam, Arjunadi Grita. Conclusion: atherosclerosis is understood in Ayurveda as Samani Pratichaya caused by Agnimandya, Ama, Kapha, and Medo Dushti, leading to Shrotorodha and vascular dysfunction. Ayurvedic management like Nidhana Parivarjana, Katutikta Rasa Pradhana Dravyas, Shodhana, Shamana, Rasayana, and lifestyle modifications improve circulation, reduce plaque formation, prevent complication, and promote long-term cardiovascular health through a holistic and preventive approach. Thank you, everyone.
Thank you, Doctor. Thank you for the well articulated presentation. Next, we go to the paper and poster presentation. I'd like to invite Dr. Mahima Sharma for the paper and poster presentation. First, we go to the paper presentation. I would like to invite Dr. Mahima Sharma.
Hello everyone, myself Dr. Mahima Sharma in Dr. D.Y. Patil College, Ayurveda College, Pimpri, Pune. My topic a holistic approach to recurrent pregnancy loss, Ayurvedic management of habitual abortion. Introduction. Recurrent pregnancy loss is clinically defined the occurrence of two or more conceived miscarriages before 20 weeks of gestation. It affects approximately 1 to 2% couple worldwide, posing emotional, physical, and physiological distress. Financial management of family identified cause nearby half of cases classified in allopathic. In Ayurvedic classics, its condition correspond to Putragni Univyapa Garbhastari Vanya disorder contributed to variation of dosa, primary vata and pitta. Pitta causative factor disrupt the four essential elements of constitution. Ritu, timing of constitution. Kshetra, मतलब uterine environment. Angu, मतलब nutrition fact. Visa, मतलब quality of ovum and sperm. Ayurveda attributed recurrent pregnancy loss mainly as vata विटेशन म्हणजे अपान वात का डिस्ट्रीब्यूशन होता है उसके बाद है वृक्ष डिपोजिशन ऑफ वीक रिप्रोडक्टिव टिश्यू अग्निमांद्य मतलब फीमेल न्यूट्रिशन गर्भसंया मतलब वीक यूट्रस स्ट्रेस एंड मेंटल स्ट्रेस ओके इसमें aim है to prevent recurrent pregnancy loss by strengthening the गर्भसंया correcting dosha दुष्टि enhancing the quality of बीज मतलब शुक्र और आर्तक दो बीज की क्वालिटी को बढ़ाना एंड सपोर्ट स्टेबल फीटल डेवलपमेंट एंड थ्रू आयुर्वेदिक प्रिंसिपल्स तो अभी इसका ऑब्जेक्टिव है टू करेक्ट डोसा इम्बैलेंस स्पेसिफिकली वात अपान वायु टू प्यूरिफाई द ऑप्टिमाइज बीज मतलब गेमेट्स क्वालिटी टू इम्प्रूव रस रक्त धातु एंड ओवरऑल न्यूट्रिशन स्टेबल टू एनहांस ओजस एंड मेंटेनिंग हार्मोनल स्टेबिलिटी टू इम्प्रूव प्रोडक्टिव्ह हेल्थ थ्रू समस्थना आणि रसायना म्हणजे समशोधना म्हणजे रसायना इससे भी हेल्दी रहता है ठीक है मेथड्स है इसका शोधन चिकित्सा ठीक है प्यूरिफाइंग थेरेपी तो उसमें प्रिकॉश conceptual purification is about to correct both imbalance and purity reproductive channel म्हणजे आर्तव स्रोतस्की reproductive जो है आर्तव स्रोत precorder include वमन Virochana, Basti, and Uttarbasti, uterine administration of medical iron. This helps improve uterine tone, correct upon what function, and enhancing receptivity. अभी गर्भ स्थापक चिकित्सा म्हणजे फिटल स्पेस मतलब स्टेबलाइजेशन थेरेपी फिटल को स्टेबलाइज करने के लिए जो थेरेपी दी जाती है वो फोकस ऑन sustaining pregnancy by nurturing uterine and fetal tissue using herbs like shatavari, lodra, ashwagandha, and yashtimadu, poisoning madura, sheetal, balya, and rasayan papadi. Ahar, VR, and sattva. The diet, lifestyle, and mind therapy. A nutritional diet, yoga, pranayam, adequate rest, and fatally chicken. Understood the mental discipline जो रहता है promote systemic balance of physiological well-being. Mode of action of पंचकर्मा ही है विचलभूषण तो वमन का मोड ऑफ एक्शन रहेगा क्लियर एक्सेस कफ डॉट ऑब्स्ट्रक्ट रिप्रोडक्टिव कैनाल्स उसके बाद इंप्रूव मेटाबॉलिक रिगुलेशन मतलब बेटर फॉलिकुलर जोमेसिस फिर एनहेंस न्यूट्रिशन एब्जॉर्प्शन फिर विरेचन विरेचन क्या करता है तो एलिमेंट और पित्त विच मे कॉज हीट ब्लीडिंग टेंडेंसी एंड इम्प्लांटेशन फेलुलर enhance liver function improve quality of रक्त and recurrent sperm reducing inflammatory medicine report implantation of placental confinement basti a balance upon what main cause of fabulous abortion control downward movement and relation function of pregnancy Tatra karma panvat reduce uterine irritability and spontaneous tenderness फिर उसके बाद आता है सेंटर ऑफ एंडोमेट्रियम एंड यूट्रम ठीक है मेडिकेटेड ऑयल और घी absorbed through colon, nutrient, reproductive organ. फिर improve endometrial thickness and mobility, anti-inflammatory and immunometry effect, improve local circulation of pelvic organ. Tarbasti, तो direct strengthening of lubrication of uterus and endometrium और remove blockage of आर्तव इससे होता है उसके बाद मोड ऑफ एक्शन ऑफ आयुर्वेदिक हर्ब के मोड ऑफ एक्शन इस अपने इसमें दिया हुआ जैसे शतावरी अश्वगंधा लूद्र अशोका और फलक इसके मोड ऑफ एक्शन इसके अकॉर्डिंग टू है उसके बाद डिस्कशन आयुर्वेदा प्रोवाइड्स अ होलिस्टिक paradigm of addressing RPL by rectifying systematic imbalance rather than treating isolated symptom. Shodhan Chikitsa removes accumulated toxins. गर्भ स्थापक चिकित्सा अनुसार uterine nutrition and fetal stabilization, where आर्तव आहार विहार सत्वावजय promote psychosomatic harmony. ठीक है when applying the modern diagnostic this inequity approach often prevent preventive and supportive care of the official love. इसका कंक्लूजन में आता है द आयुर्वेदिक मैनेजमेंट ऑफ पुत्रग्नि योनि व्यापक presenting a holistic, personalized and non-invasive alternative of recurrent pregnancy loss through Shodhan, Garbha Stapak and life correction. Its total imbalance, uterine disability, and mental distress, a supportive healthy conceptional and fetal retention. This reference will be all taken in this PPT. Thank you for everyone.
Thank you, Doctor. Thank you for the paper presentation. I don't more poster presentation is there.
Hello everyone, myself Dr. Mahima Sharma from Dr. D.Y. Patil Ayurvedic College in Pune. My poster topic is Rajaswala Paricharya. Application is today's life. ऋतु प्रथम दिवसात प्रगती ब्रह्मचारिणी निवास स्वप्न प्रजनाशा तुपात स्तनानादुकेने पाक्षछेदन प्रथा वनः सनकरा नाति शब्द श्रवण लेखनानि दासयान परिहे सुषुप शारीरिक स्थान दूसरा 36 अध्याय का दूसरा श्लोक Right. Eat food like yawa, gothuma, wheat, rice, मसूर, मूंग, संधा, घी, उसके बाद लघु आहार, अग्नि दीपन आहार in proper quantity, easily digestible and दीपन पाचन, अग्नि प्रदीप्ति एंड वातानुलोम। ये डाइट अपन अगर रजस्वा परिचर्या में लेते हैं तो ये सब लघु आहार लेने के लिए बताया गया है। इसके बाद क्या नहीं करना है तो नो रनिंग, no laughing, no excess talking, no outing. Avoid physical work and take rest so much as possible. Ever stand while traveling long working hours. उसके बाद नो स्लीप ड्यूरिंग द डे टाइम, डे के टाइम में कभी भी सोना नहीं है क्योंकि इट प्रिवेंशन ऑफ इंक्रीज इन कफ एंड पित्त फॉर्मेशन ऑफ आर्म. नॉट adorn on self, not wear ornaments, not apply makeup in ascetic group. ओके उसके बाद करना है गुड एंड ऑलवेज गुड एंड वेरियस टॉकिंग, नो क्राइंग, कीप माइंड क्लीन, रिलैक्सिंग एंड पॉसिबल अवॉइड एंजाइटी एंड स्ट्रेस, नो लिसनिंग टू म्यूजिक टू प्रिवेंट वात प्रकोप एंड रसदुष्टि, नो हैविंग बाथ, तो बात लेने से क्या होता है, not have a complete bath, follow basic hygiene, cleaning genital, hands, leg and face, not applying any cream oil on body, left and abhyam considering in Agni Mandir. About nails and Guardian, no cutting nails, no apply column. According to सुश्रुत शास्त्र के अकॉर्डिंग ये अपना रजस्वला परिचर्या के अंदर बताया गया है। ये फॉलो करने से जो रजस्वला स्त्री है उसको अपना जो गर्भाशय वगैरह सब अपना मेंटल हेल्थ वगैरह सब अच्छा रहता है आयुर्वेद के अकॉर्डिंग। थैंक यू सो मच।
Thank you, Doctor. Thank you for the remarkable paper and poster presentation. Next, we go to the another paper and poster presentation. I would like to invite Dr. Anishka Sharma for the paper presentation.
Good morning, everyone. Today I will be presenting a case on Bahuk with special reference to frozen shoulder. Bahuk is one of the Vata Vyadhi. It is a disease that hampers daily activity of an individual, and we know that it affects shoulder joint. Its nirukti comes from Avu and Bahuk, in which Avu means view and Bahu means upper limb. It was the term which was first coined in Niramaya by Sushrutaracharya. Bahuk is grossly correlated with frozen shoulder. Its Paribhasha states that it is a disease caused by radiated Vata dosha localizing around the Amsa Pradesh, causing the Shoshana of Amsa Sandhi, thereby leading to Akunjan of Sira at that site and giving rise to Bahu Praspandanam Hritvam. Bahu's Praspandanam Hritvam is also one of the cardinal features of Bahu. It means restricted range of motion of shoulder joint. Along with that, the other cardinal features are Amsapandan Shosha, wasting of shoulder muscles, Sira Kunjan, stiffness, shoe, pain. Modern perspective relates Bahu with frozen shoulder, which is a synovial inflammation and fibrosis of shoulder joint capsule. There are three phases of clinical presentation on this, like painful, freezing, and recovery phase. Its Nidan includes a Viharaj Nidan, which is due to Amsamarmo injury. Aharaj Nidan includes Tikta Ruksha Kashaya and Pathogen. Viharaj Nidan includes Lavan, Bahar Vahan, Balvat Vigriha, Dukshaya. Mansik Nidan includes Ati Chinta, Shok, Krodh, Bhay. In Nidan Panchak, Samprapti, Acharya Sushruta said that vitiated vat around the shoulder joint depletes structure of tissues in and around it, and vasoconstriction of vessels leads to pain and stiffness of the joint, which ultimately results in restricted shoulder movements. Samprapti Ghatak. Udbhav Sthan is Varsha, Adhishthan is Pradesh, Dosh is Vyana Vayu Shishaka, Dosha is Sira Snayu Mansakandarasti, and Strotudushti is Sandra. Now, the case presentation. A 62-year-old male came to our OPD at Dr. D.Y. Patil College of Ayurveda, Pemshri, Pune with complaints of restricted movements and pain in the right shoulder joint. Initially, it was intermittent type of Dilip, but it increased during night time, sleeping on the same side and in cold weather. There was tenderness in both the shoulder joint with restricted adduction, flexion, internal rotation with decreased muscle power and muscle tone along with shoulder muscle wasting. Apley's scratch test was found positive, sensory perceptions were present, deep stimuli and temperature were found normal. And according to the above presentation, the patient was diagnosed as Urdhwaga. There was no history of trauma, swelling, or weightlifting. All routine investigations were normal, and X-ray bilateral shoulder joint showed osteopenia. Our differential diagnosis of Urdhwaga was conducted with Vishwachi, Amsashosha Ikagavad, and Sandhi in which Avavahuk and Nadanas of Avaratavad, Sandhigatavat Nidan is Avataj, Vishvachis Nadan, and Ansashosha Ikangapat Nadan are all Vataj. Understand, in Avavahuk it is Amsa Sandhi, in Vishvachi it is Bahu, in Amsashosha it is Amsa Sandhi, and in Ikangavat it is Murdha, and Sandhigatavat it is any affected Sandhi. Shul is located in Ansashandi and Avavahut, and in Vishwaji, it is located from Manya to Hastu. Amsashosh occurs in later stage of the disease in Avavahut, and Shoth and Atop can occur sometimes. It is not necessary that the case will present with Shoth and Atop always. However, in Sandhigatavat, Shoth and Atop are commonly seen. Chikitsa Sutra of Avahok, Acharya Vangasen told Deepan, Pajan, Svedan, Mardan, Basti Upnaha Vaman, Virejan, Agni Karma. Acharya Chakravarti told Pajan, Shodhan, Basti Shastra Karma. Acharya Prakash told Vaman, Virejan, and Basti. Now, Shodhan Chikitsa, patient was given Tanik Snehan with Valatil, Peti Svet with Dashmol Adikwat, and Griva Basti with Valatil for 21 days. Basti enema was performed with Anuvasan Basti with Balatil 80 ml and Haru Basti with Dashmukwat on alternate days, starting from Anuvasan Basti and ending with Anuvasan for 14 days. Agnikarma was done at an interval of 7 days, which means day 0, day 14, and day 21. Grohan Nasa with Tarpantel was given for 14 days. Upanaha with Narugundi Patrikalika was done on alternate days, and with the Karma 2 angle above Shapra and 4 angle above and below Kurpa Sandhi was done for 21 days. In Shaman Chikitsa, we gave Kashaya, which included the Shmoon, Vala, and Arandamol. It was given to the patient for 21 days to 20 ml BD. Parijata Dhanvati was given 2 VD to 50 mg. After food, again the PD was given in 15 ml before sleep with lukewarm water, and Ekanvi rest was given 125 mg 2 VD after food with lukewarm water. The mechanism of action of Dashmulas, it is Kapavadavara, Balle, Shodhavara, Deepaniya, Pachniya nature, which acts as Ampachak and Shurnashaka. Bala has Pradoshaghana properties. It treats various Vata disorders due to its Niduguna and Vajarasa. Ashwagandha balances Tridosha, especially Kapha and Vata. Some practice of Bahu can be defined as Dhatu Shain Marga Avarodhajanya. And due to its fresh properties and enhanced repellent properties, it helps to break pathogenesis and is the major causes dhatu shaya. Arendelle has purgative and analgesic action. Along with it also provides snehan. Moreover, purgatives present in market are usually ruksha, which increases vata disorders. So hence, Arendelle is preferred in Ramavastha. Snehan was done because it improves circulation and it helps in eliminating pain. It has Snigdha Guru and Mrida properties, which reduces vitiation of vata, and it possesses Snigdha Gun and vata head properties, Balate. Swadan does dilation of blood vessels, which improves circulation, and it also gives obstruction of channels. Now, Basti was done. Purishadhara Phala is nothing but Pakvasha. Since Vata dosh originated from Pakvasha, Basti helps in pacifying the Vata. In return, it will also pacify the pain, which is caused in Avbahaka. Nasya was done with Indriya Tarpantil, and Acharya Valbhat has stated that Nasahi Shashwadwaram, which means Nasya usually adds to absorption by Shingatak Marma, and Manyastam is one of the indication of Nasya. Greva Basti was done, which helped to pacify Vatadushti and Kapatushti, in which we poured medicated hot oil on the site of disease, which ultimately helped against Shitaguna of Vata, which along with Kapha causes stiffness. Upnaha was done to pacify Vata and Kapha, in which leaves of Nirgundi and Erenditeri were used. Nirgundi possessed Vedana Sthapan properties and Shodhar properties. Agni Karma works on Vata by its Ushna and Tikshna gun, and Kaphadosh by Laghu, Sukshma, Tikshna, and Ushna gun. However, it is contraindicated in Pitta Prakriti, child, old age, Grishma Ritu, and those people having multiple wounds. Vidya Karma was done to remove obstruction of blood vessels and establish normal circulation. It also reduces the load of pathogens circulating in the blood. Now, before treatment, the patient was having pain and right shoulder, which was absent after treatment. Restricted movement was improved. Pain went from VAS scale 6 to VAS scale 1. Tenderness went from grade 2 to grade 0. Swelling was present at first, but after treatment, swelling was absent. Abduction was done by the patient at 90° before treatment and at 160° after treatment. Flexion, patient was able to flex his hand at 90°, but after treatment, he was able to flex at 150°. Muscle power remained same. Sensory examination was normal before the treatment, and after treatment too, it was normal. These are the pictures of the patient before the treatment and after the treatment, and you can see the results clearly. This pathogenesis of this case was mainly Dhatu Shaya Janma because the patient was old. It is concluded that combination of Ayurvedic formulations along with Panchakarma therapies like Nasya, Sneham, Svedan, Vasti, Upnaha, Agni Karma, Vidya Karma, Marma synergistically proved to be effective in management of Avbahak. Thank you.
Thank you, doctor. Thank you for the paper presentation. And one more poster presentation is there.
Good afternoon, everyone. Today I'll be presenting a poster on integrated study of osteoarthritis and Sandhigat Vata. As we know in modern medicine, osteoarthritis represents microscopic loss of cartilage, low-grade inflammation, which results in joint space narrowing, as well as its risk factor is mainly mechanical overload. In Ayurveda, Sandhigat Vata is represented as vitiated Vata, Dhatu Shaya, loss of Shleshak Kapha, which means lubrication in the joints, and Vata Bhava Dhriti Sparsh, which is a cardinal feature of Sandhigat Vata. Now, if we talk about integrated synergy for optimal care of patients, we can include personalized lifestyle plan, including Ayurveda and modern NSAIDs, NSAIDs for flares, plus herbal mineral preparations like bhasmas, etc. for long term. Physical therapy as well as Abhyanga massage can also be included. In physical therapy, we can include physiotherapy, and in Abhyanga massage, we can complement it with use of external oils like Balashogandhadi oil, Sehchar tel, etc. Disease modifying Rasayanas therapy will also target the root cause of it. Plus,
integrated diagnostic approach, which means imaging and ruling out the nidanas, is going to prevent the reoccurrence of the disease. Thank you.
Thank you, doctor. Thank you for the well explained and informative presentation. Thank you so much, doctor. Next, we go to the another paper and poster presentation. I would like to invite Dr. Neha Phosale for the paper presentation.
Myself, Dr. Neha Bhosle, Department of Kasuri Tantra and Stree Yoga. So my topic of paper is Effects of Yoga in Pregnancy. Introduction. The word yoga can be defined as a spiritual and ascetic discipline associated with controlling breaths, meditation, along with specific bodily postures carried out in order to maintain good health as well as relaxation in all aspects. Pregnancy is the period of numerous physiological as well as biochemical changes. Apart these changes, she suffers changes on emotional backgrounds also due to endocrinological swaps. Hence, in that specific span of period, accompanying all these changes also, yoga plays an important part in assisting the female with such changes. Traditional views on pregnancy, so Garbhopanishad, it is an exposition of embryology that explains the complete systematic growth of the embryo in womb in the second chapter of Sushruta Samhita. Development of the fetus systematically in detail, then factors that determine the gender of the fetus, prohibited codes of conduct during gestational period, matras pitras bhavas developed in fetus. So these all are explained in Sushrut Samhita Sharirsthan. Then practicing yoga in pregnancy has shown promising results in enhancing pregnancy outcomes like an increase in birth weight as it increases good blood perfusion and exchange of nutrients, combating fetal hypoxic conditions to some extent as seen in cases of neuroplacental and or fetoplacental insufficiencies as it indulges breathing exercises. Then, yogic practices includes exercises which increases joint flexibility, which further prepares the maternal pelvis for vaginal delivery trials. Again, reduces the complaints of excessive low backache. Okay? Then increased joint flexibility also facilitates optimum circulation of blood and lymphatic fluids in the body, thereby reducing fluid retention and swelling problems faced by pregnant lady due to increased blood dilution. Then, women adopting and practicing yoga in the second trimester show significant reductions in physical pain. Women in the third trimester reported with reductions in the trait of perceived stress and anxiety, and so reduced complications along with decrease in number of cesarean sections on maternal request from last few years. Then yogic tools for fitomaternal health and care. So what are the yogic tools? Asanas, pranayam, mudras and bandhas, and meditation. Then asanas and body postures for loosening of muscles and relaxations. Pranayam, which helps for psychosomatic hormone, more synthesis of ATPs and energization of every cell of body. Mudras and bandhas, which helps to tones of the pelvic musculature. And meditation induces inner peace and develops maternal mind to deal with all the stress and anxiety factors during pregnancy. There are some contraindications to aerobic exercises also during pregnancy, which are compiled as follows. So, in that, which two categories are the absolute contraindications to aerobic exercises during pregnancy and related contraindications to aerobic exercises during pregnancy. What are the absolute contraindications? Where yogas are strictly prohibited. When the woman is suffering from hemodynamically significant heart disease, restricted lung disease, incompetent cervix, where a woman undergone with cervical encerclage, then multiple pregnancies with risk of preterm labor, then persistent pervaginal bleeding during second or third trimester, and placenta previa after 26 weeks, where the yoga is strictly contraindicated. Then relative contraindications to aerobic exercises during pregnancy, severe anemia, chronic bronchitis, pregnant female associated with severe orthopedic deformities, extreme underweight, where women having BMI less than 12, and poorly controlled hypertension, and poorly controlled type 1 diabetes. So, aims and objective of this paper. The purpose of this paper is to highlight and embark the importance of yoga during antenatal period of pregnancy, to describe the necessity of such activities in antenatal duration in order to reduce the risk of various maternal and neonatal complications. Yoga practices are scientifically proven and depicted in our traditional contexts by our acharyas. These practices were earlier followed, but as we adopted Western culture started flourishing, we also overlooked their importance, due to which, even with advancements of modern sciences, the rate of complications have surged. Moreover, it has also been observed that the rate of LSS, especially on maternal request, has also declined in females practicing yoga in antenatal period. To some extent, as yoga strengthens the mother on mental and emotional backgrounds, also along with physical and spiritual ones. Then methods. A thorough analysis on yoga practices in pregnancy was carried out, including Ayurveda and modern texts, and was concluded. Data was collected and compiled from a number of publications and articles published in outline journals, etc. Various internet sources were read and used to pile up all the data. So, what are the results? A variety of randomized control trials were studied and evaluated. The findings consistently suggest that yoga interventions came across with lower incidence of prenatal disorders, then reduced duration of active phase of labor with increased threshold for pain and stress, leading to decreased number of cesarean sections on maternal request during past few years. It includes breathing exercises, also ensures the enriched supply of oxygen to the intrauterine baby, and so indirectly helping in treating the cases of uteroplacental or fetoplacental insufficiencies also. Then conclusion of this subject or topic. The observations indicate that yoga is safe and more effective during pregnancy for both maternal and child health. However, the future studies and trials are needed to provide its more add-on effects and implications, along with specific evidences regarding the diverse utility and validity of such interventions in pregnancy period. Thank you.
Thank you, doctor. Thank you for the wonderful paper presentation. One more poster presentation is there.
Hello everyone, myself Dr. Neha Bhosle, and my topic of poster is Garbha Sanskar and its benefits in AMC. So the introduction, Garbha is means Garbha is womb and Sanskar means education. So education in womb is its eternal meaning. And the Garbha Sanskar is an ancient Ayurvedic practice that translates to educating the mind of the fetus when integrated into antenatal care. So it involves means following of appropriate ahar, vihar, yoga and meditation, music, reading a spiritual positive book, and along with following Gargini Paricharya. So ahara in that proper means sattvic fruits, that is fruits, whole grains, dairy, and soaked nuts. The Garbini should follow to ensure optimal fetal growth. And then Garbha Yoga and Pranayama, gentle stretching and breathing exercises. Example like Anulom Vilom, then Bhramari Pranayama. So these all to manage blood pressure and reduce physical discomfort, to reduce physical discomforts like back pain and build pelvic strength for delivery. Then means reading spiritual and positive book. So by this, conscious bonding through talking, singing, and positive visualization to help the unborn baby to recognize the parent's voice. So it helps to get healthy and good progeny. Then, following Garbhani Paricharya, it is good throughout the ANC, that is antenatal care. And along with this, means Gautam Bij and Kshetra, Ritu, Ambu, along with mother's Mansik Avastha, that is stressful condition of mother during ANC, should be there. And by these, means getting benefits in which overall mental and behavioral development of fetus, then chances of normal vaginal delivery increases, reduces risk of congenital birth defects, decreases poor pregnancy outcome, and enhance the growth of baby in overall way. So, with the help of this all, we can get healthy conception with good pregnancy outcome. Thank you.
Thank you, Doctor. Thank you for the well explained paper and poster presentation. Thank you so much, Doctor. And next we go to the another paper presentation. I would like to invite Dr. Apta SM for the paper presentation.
Good afternoon. Myself, Dr. Apta SM from Karnataka Ayurveda Medical College, Mangalore. Today's topic for presentation is Rasaushadhis in Prameha. It is a case study. As the Prameha is one of the Sandarpana Janya Vyadhi. It starts from the Amashaya and leads to Sarva Sareera Vyapya due to the Nidana Sevana. And it does the Dushana of Dhatus, Mamsa Medha. And due to the Kledadi Guna, it reaches the basti. If it is left untreated, it is very difficult to treat them. Prameha, as it is one of the well-known lifestyle disorder, which should be treated with firstly with Nidana Parimarjanam Eva Chikitsa. As with the prostate area, there is a scope with the Rasaushadhis studies as the formulations which are given in an alpha matra, which is having an aruchi and shukram arogyakari, as people are less prone to take pitta rasa directly. So the case study history is here. A 34-year-old patient with the history of diabetes mellitus with his parents. He has been consuming the outside food since 80 years, and he is not doing any exercises, and he's taking the food without properly digestion. He's taking more prone to the fried, spicy chicken, etc. He's most of the time uses the vehicles instead of walking. He stays in AC more and does Ratri Jagarana. So this result has increased in his weight, bloating, or is also seen. His clinical history, as he's not taking any medications for anything, as it has got under control, and hyperlipidemia, hypertension is also under control. His blood sugar is fluctuating since he had taken Nishakatakadi, which was not got that much result. He has left discontinuing the medication. And Samanya Pariksha vitals are noted down here. And Rogi Pariksha is done. His Prakriti Sara, those analysis is done. Agni is done. And Astavida Pariksha is also done. His Mudra 7 to 8 times per day, Mala, Adi. And he giving internal medications is given with the Sadhya Virechana before giving the Rasaushadhis with the Trivrit Lehyam. After Samsarga Chikitsa, he was advised to take Asanadi Gana Kashaya, BD 15 ml with 30 ml of warm water before food, along with Rasa Sindhura and Vanga Basma and Kapikachu Churna, which is capsulated and given to the patient. Rasa Dravya, where Vangeshwara Rasa, there are many combinations, but those are follows with the Rasa Sindhura and Vanga Basma. So primarily, so this is also which is known as the Prameha Hari Rasa, is the drug of choice in this case. And as the Vanga Basma possesses Rasayana property and also removes the Avrita Vata, which is helpful in the this condition, and also it is having a cell regenerative potential and acts as an nerve tonic, so helps in repairing of the damaged nerves. So as I told, management is very important. That's why there's some of the corrections in his daily life is done, and he is quietly following that. His sleeping time and wake up early, and he does 3 kilometer walk daily. And according to his strength, it is advised. Day sleep is completely avoided. Drinking hot water early in the morning, and also for the stress management, pranayama meditation is also advised. And food is advised, especially with the easy, light, not too heavy, avoiding sweets, curds, and rice, especially at night time, and replace it with the rich source of protein, freshly green vegetables, fibers, vitamins, fruits like oranges and all included in his diet. And while coming to a subjective parameter, before his treatment, hunger was very intolerable. Now it is reduced. Excessive sweating was seen. Presently, it is moderate, and the heaviness of his body is now a turn to lightness. And traveling after the urination was on and off. Now it is absent. And tiredness and loss of interest in doing his activities. Now he is actively participating in his work. Next slide, that is the objective parameters before treatment in his blood reports. FBS that was 277, now it is 135, and PTBS 400, now it is has come to 169, and HbA1c that is 10.8%, now it is 8.2. After the after 2 months it is checked. Weight has also reduced for 4 kgs. The importance of Vangeshwara Rasa is also listed here according to the Guna. The Rasa Sindhura is having Vatanulomaka, Vangabhasma is having Kapha Pitta Hara, which is having Rasa Katu Rasa, Tikta Rasa. Katu Tikta Kashti is very helpful for treating the diabetes condition, as the Kashaya and as they gains control over the Dravita Kapha or the Shleshma and also the Medas. That's why the usage of Kashaya Tikta Rasa is very important here. And also due to the Lagu Ruksha Guna, it does the Dravita Kapha gets dies up very fast. Agni Deepana, Yoga Vahi, Vata Anulomana of Rasa Sindhura is very helpful in this metabolic sluggishness is helpful for the removing, as the Vata Kapha is the main culprit in this Prameha. So the Samprapti Vikatana is done in the proper way. And Vanga Basma is having the Lekana Medo Hara property. Stoto Avaroda Dhato Shaitilyakara property helps here. Coming to the discussion part, that is only what I told. The Kashaya Rasa does the rice of the Dravita Shleshma and also the Meda get ready. Use of Kapika Churna is mainly as it is neuroprotective in nature. And while coming to the conclusion, as this is the documented and got a very nice result. Further toxicological and also pharmaceutical studies and also clinical documentation is very necessary. As I present study, the medication used was without creating any side effects in his treatment. It was very safe to give in this condition. Thank you for the wonderful opportunity. Thank you.
Thank you, Doctor. Thank you for the remarkable presentation. And next we go to the another paper presentation. I would like to invite Dr. Snehal Devanand alone for the paper presentation.
What they are proposing. The introduction is proposing influences physical, physiological, and psychological behavior of the person. Regarding the concept of intelligence and process of acquiring knowledge, minute and detailed questions predictions are mentioned in different topics. Specific Rasayana that is described for specific purposes. Medical Rasayana is one such type of Rasayana which majorly emphasizes on the improvement of health along with the other general benefits of Rasayana. So this study attempts to analyze any changes in IQ due to consumption of estimable Rasayana, which will be contributing for noble cause and upliftment of the society. Aim of my study is to advise the use of Rasayana according to the type of Prakriti, to study the effect of estimable Rasayana, different Prakriti with special reference to innate Kamal scale. Objectives are to advise the use of estimable Rasayana according to type of Prakriti, to study the effect of estimable Rasayana according to the Ayurvedic ancient texts, to evaluate the intellect of different Deha proposals, to help in improving the quality of educational aspect of society. So my inclusion criteria is normal and healthy individuals from the age group of 16 to 30 years. No history of major illness and should be taking any kind of medications. Male and female both sexes are inclusive. Subjects having IQ above 70. Both male and females. The volunteer willing to avoid them by the trial rules and give written informed consent. Exclusion will be person suffering from major illness or taking any medication, person of age less than 16 years and greater than 14 years are all excluded from the study. Illiterate person also, person has past history of at present suffering from any mental disorder, pregnant and lactating women are excluded. Withdrawal criteria is subject not willing to continue the trial. The researcher feels that the protocol had been violated or subject become non-cooperative. Occurrence of unexpected harmful effect regarding given drug administration and other planning. Trial drug is Yashtamadu Rasayan Kalpana in the form of churna. Method of preparation according to Churna Nirman Vidhi described in Sharandar Singha, the dry and fine powder which is churna of Yashtamadu was prepared from the its source powder which is bharat often from a reliable local vendor. Matra is 10 grams, Shira, which is 50 ml, Sneha, 7 kalis Pratah Kal, Kala within 60 days, Pathya, general Pathya regarding Dincharya and Ritu was advised. Plan of study, which is after taking the written informed consent, Prakriti was evaluated using the proforma previously approved by the university in the synopsis. In the proforma Prakriti version, all the characters were not included. Only those characters which are significantly useful for the evaluation of the Prakriti have been taken. Percentage of each dosha is calculated. Individuals having 60% or more than 60% of the characters of a particular dosha will be included as dosha pradhan of that respect to dosha with Anubandha dosha. Post Shodhana, administration of necessary before Rasayana was performed by the oral administration of Harit in the dosage of 3 grams for 3 days at Nishaka. Oral administration of Yeshtu Madhu Rasayan in different day Prakriti. Analysis of changes in intellect quotient before and after the administration of above said drug was performed. Correlation of Prakriti with intelligent quotient water. Observation and results from her. The data collected from the study was analyzed under 2 headings. First is demographics analysis to study the relation between Prakriti and intelligence. Discussion is Prakriti is formed by combinations of three doshas. Meta is related to intelligence and grasping power. IQ and Binet's common scale help assess intelligence. Study observations were made on 60 subjects. Subjects were classified as Vata, Pitta, and Kapha, Pradhana Prakriti. Conclusion will be Yashtimadu Rasayana shows Medya, that is intelligence enhancing properties effect depending on Deha Prakriti. Maximum improvement was seen in Pitta Pradhan Prakriti objects. Minimal improvement was observed in Vata Pradhana and Kapha Pradhana Prakriti. Yashtimadu Rasayana is more beneficial for Pitta Pradhan individuals. Thank you.
Thank you, Doctor. Thank you for the well explained presentation. Thank you so much, Doctor. Next, I'd like to invite Dr. Harshal Kamble for the paper presentation on the topic Conceptual and Research Studies on Autism.
Shri Kamble, second year PG resident of the Department of Ayurveda, PD's College of Ayurveda and Research Center in Pune. Today, I am going to present on a topic named Conceptual and Research Studies on Autism. So let's start. First slide is an introduction. Autism spectrum disorder is characterized by persistent deficits in social communication and social interaction, along with restricted and repetitive behavioral patterns. Early identification and intervention are essential for improving the developmental outcome for autistic children. Objectives for today's presentation are to understand the conceptual aspects of autism, to study modern as well as Ayurvedic views regarding autism, to review the current research studies ongoing on autism, and to understand the integrative management approach and its importance in autistic children. Clinical manifestations. How clinically autism is manifested in children. So it shows signs like poor eye contact, delayed speech and language, impaired social reciprocity, poor response to the name call, hyperactivity should be there, reduced social interaction. These are the clinical manifestations. The next slide of etiology. So autism is considered as a multifactorial in origin. Genetic factors, environmental factors, neurobiological factors are responsible for the manifestation of autism. Genetic factors mainly include multiple gene mutations, syndromes like Fragile X syndrome, Turner syndrome, Angelman syndrome. Environmental factors, the infections to the mother during the pregnancy, maternal infections, prenatal exposure to the toxins. Neurobiological factors include the abnormal neurotransmitter activity, which leads to the autism. And next slide is a Ayurvedic conceptual understanding. So Ayurveda does not describe autism directly, but it features can be correlated with diseases like Urdhwaga, Manovirus Rotodrushti. Dosh involvement in autism according to Ayurveda, Vardosha is the main dose which is involved. It causes the speech delay and hyperactivity. If Pitta dosha or predominant Pitta dosha is there, then there is irritability, aggressive behavior. Kapha dosha is there, then there will be social withdrawal, poor responsiveness, lethargic, uninterested in doing anything. These clinical manifestations. Next slide on is of Ayurvedic research studies. So Panchakarma research has been done and its studies shows the benefits of Shirodhara, Abhanga, Nasya, Basti. All these procedures may help improve attention, sleep, hyperactivity, and social behavior. Vaidya like Brahmi, Ashwagandha, Santupushpi helps in cognitive and neuroprotective effects. Then next slide is of integrated management approach. So integrated management approach is a modern management and of Ayurvedic management. Modern management includes behavioral therapy, speech therapy, occupational therapy, which is considered now as a mainstay for autism treatment. But along with that, Ayurvedic management like Shodha and Shaman. In Shodhana, Basti and Nasya are mostly considered useful for autism. Shaman Chikitsa includes various Rasayana drugs, Sarasat Churna, Kaldanagri, Brahmi Grid, Mahapashchachik Grid, Manasmutra Vatakam, Brahmi Vati. These all are Rasayana drugs, which all are Rasayana. And these drugs helps to improve your cognition and also in the neurodevelopment of the child. Pharmacological treatment, these include antipsychotic drugs like risperidone, albuterol. Other supplements include vitamin B6 supplements, magnesium supplements, omega-3 or zinc supplements. Diet in autistic children like gluten and casein free is also important. Then various research studies on autism, communication and language studies. Many autistic individuals experience the language, social communication, and pragmatic language skills are deficient, they are unexpressive, and they don't know how to express their feelings through language. So research demonstrate early communication focused intervention, which can improve their language development, social engagement, functional communication, as well as studies on persuasive writing intervention also show positive outcomes on reasoning abilities among the autistic students. Behavioral intervention research like blood behavioral analysis, pivotal response treatment, or restart Denver model are widely studied. These behavioral findings indicate that behavioral interventions may improve the adaptive functioning, communication, social interaction, learning skills. Modern intervention research increasingly emphasizes on child-centered approaches, their consent, dignity, emotional regulation, and meaningful participation in activities. What are the challenges we face in autism research? Although autism research has been expanded and many work has been going on in the autism, still there are several challenges remain. One is of heterogeneity. Autism presents different across different individuals, so it makes very difficult to create universal model or intervention protocol for as a autism as a disease. So we need a personal intervention in autism through Ayurveda. Diagnostic complexity, diagnostic criteria is continually evolving and it is still evolving. So, and especially in females or adults, it remains undiagnosed or misdiagnosed. These are the challenge. Ethical concerns, ethical issues regarding informed consent, masking and camouflaging, stigma regarding the autism, representation of autistic voices. These are the ethical concerns. Methodological limitations, small sample sizes, inconsistent diagnostic measures. There are various tests available for the diagnosis of autism, wherein research designs can also affect the reliability of the findings. Future directions in autism studies, we should focus on personalized intervention through Ayurvedic perspective, lifespan perspectives, mental health and autism, which is most important, inclusive education for the autistic children, participatory research, employment, and independent living for the autistic children, technological accessibility. These are the future directions in the autism studies. Discussion is the next slide. ASD affects communication, behavior, social interaction in children. So Ayurvedic management is aims at balancing doshas as well as improving these cognitive as well as behavioral functions. Panchakarma procedures, like we mentioned, Vasti or Matra Vasti we usually give in children, which help to regulate the vata and improve the neurological function. Rasayana drugs support speech, cognition, and adaptive behavior. Early multidisciplinary intervention plays a major role in improving outcomes in ASD or within their brain development age, which is up to 6 years. Panchakarma procedure such as Matravasti, which may help to regulate the path and improve the neurological function. The next slide is of preferences. Diagnostic and statistical manual of mental disorders, 5th edition DSM-5. From this, we can get the definition of autism. Ayurvedic concepts are taken from the Charak Samhita and some ongoing research studies as well as the integrative management is taken from the recent literature which is available through various publications and articles uh, available on the internet.
Thank you, Doctor. Thank you for the excellent presentation. Next, we go to the another paper presentation. I would like to invite Dr. Hima VH for the paper presentation.
Here I present the topic, a comparative clinical trial to evaluate the effectiveness of Tambulapatra Saindava Leba against the Shikha Punarnayadi Leba in Vrishchiga Damsha. Moving to the introduction, so usually the scorpions are found in the burrows of rats and other burrowing animals under the brick, stones, pile of garbages and all. So there are more than 1,250 species of scorpions. About 100 species are found in India. The commonest varieties are red and black variety of scorpion. The red one is Mesobuthus camellus and the black one is Calanus ramadani. So in our Samhita, Vrishika Visha and Vrishika Daksha has been described in detail under the Kida Visha Prakarana. And based on their toxicity, they are classified as Manda Visha, Madhyama Visha and Mahavisha Vrishikas. In Ashtanga Hridaya Uttarasthana 37 chapter, Vrishchikasya Samanya Lakshana is mentioned, that is Vrishchikasya Visham Tishnam Ado Dahadi Vanyavar Urdhwaga Shipram Damshe Paschata Tishtadi Damshana Sadhya Adirukshava Studyades Kudadivaja. So it is Vrishchika Visha, it is Tishna in nature. Initially it will cause us Vanyavadaha and then it does acute Urdhva Rohana and later settles at the Damshasthana, resulting in Adiruksha, Vatoda and Spudana. Shigravarana Leba, it is the most accepted and scientifically proven Leba Yoga in Kida Visha, that is mainly indicated for Sarva Kida Visha Shofa. Then Tambula Patra Saindava Leba, it is mentioned in the Kriya Komadi, it is a Leba preparation for the Vrishchiga Damsha. Thus, coming to the aim of the study, to provide an effective and easily available labor preparation in the Vrishchiga Damsha. Objectives of the study are to evaluate the effectiveness of Tambulapatra Saindava labor along with Dashanga Agada in the management of Vrishchiga Damsha. To evaluate the effectiveness of Shigra Vilanavadi labor along with Dashanga Agada in the management of Vrishchiga Damsha. And to compare the effectiveness of Tambulapatra Saindava labor against the Shigra Vilanavadi labor along with Dashanga Agada in the management of the Vrishchiga Damsha. About the research question, does Tambulapatra Saindava labor possess equal or more effectiveness than Shigrapuranadi labor along with Dashanga Agada in the management of Vrishchiga Damsha in 40 patients? Participants randomly selected in two groups of 20 each, which satisfies the diagnostic and inclusion criteria from the Papanisheri Vishajigisa Kendra. Coming to the hypothesis, the null hypothesis is Tambulapatra Saindava labor along with Dashanga Agada is not effective than Shigrapunanavadi along with intake of Dashanga Agada in the management of Vrishchiga Damsha. Alternate hypothesis, Tambulapatra Saindava labor along with Dashanga Agada is equally or more effective than Shigrapunanavadi labor along with Dashanga Agada in Vrishchiga Damsha. Coming to the methodology, the drugs given for both groups are Dashanga Agada internally, and for the trial group, external application was Tambulapatra Saindava Lema, and for control group, the external application was Shigrapunanavadi Lema. So all the cases were written according to the case record format, and the consent form was prepared in the panel, and the participants satisfying the diagnostic and inclusion criteria are selected. The different phases of study are preparation of case performer and consent form, preparation of medicine like Dashanga Gada, Shigrapuranavadi Churna, Tambulapatra Saindava Lema, then clinical study settings and data analysis. Next, regarding the drug sources, the drugs of Dashanga and Shigrapuranavadi Churna are purchased and from market, and it is identified and authenticated from the Dravya department of MVRMC Parashmikara College, and the preparation it was conducted under the pharmacy as per the GMP guidelines. And the preparation of Tambulapatra Saindava labor, it is done by PG scholar. Next, regarding the ingredients of Dashanga Gada, Vajarhinga Vidangani, Saindavam Kasipipali, Pada, Pradvisha Vyosha, Kasyapena Vidyarvidam, Dashanga Akatam Pitwa, Sarva Kida Visham Jayir. So that is Dashanga Gada mainly indicated for Sarva Kida Visha. Then coming to Shigrapuranavadi Labor Churnam, Shigrapuranava Manya Vayandum, Chandana Pada Ishwara Muli, Yishti Shidisha Medingila Mokum, Tekuridan Visha Vika Madangam. So it is mainly indicated especially for the inflammation that happened due to Visha. Next is Tambulapatra Saindava. That is both two ingredients are there, both Tambula and Saindava. So this Tambulapatra it is taken in the Galva Yantra and it is mixed with Saindava Lavana and it is grinded well and labor is prepared as per the need at the time of application. So this is the preparation of the drug. Next, coming to the study design, it is a randomized comparative clinical trial study sitting on the PVCK control. Study population of participants, 40 participants, satisfying the inclusion and exclusion criteria selected from the PVCK. So diagnostic criteria, history of acute scorpion sting, pain, burning sensation, swelling and redness. Inclusion criteria, that is scorpion cases within scorpion sting cases within 48 hours. Then participants of the age group 16 to 60. Participants with symptoms like pain, burning sensation, swelling and redness. And then participants irrespective of gender, caste, religion and economic status. Coming to exclusion criteria, participants who have already undergone any other treatment for this condition that is not selected, and pregnant woman, lactating mother, and participants with some complications like anaphylactic reaction also that is also not taken. Coming to the clinical intervention, group 1 is the trial group and group 2 is the control group. 20 participants of both the trial group and the control group are selected. The Dashanga Gulliga was given internally at a dose of 2 gram TDS with a lukewarm water for 2 days. And the external application for trial group was Tambulapatra Saindava and then for control group was Shigruguranadi that is applied at a thickness of 1/3 angula 3 times daily. So the assessment, the findings are recorded on the first and second day and observation was done on the third day, followed on the fourth day. So these are the outcome measurement. Subjective variables like burning sensation, pain. Objective variables are swelling and erythema. Plan of analysis. The 4 main symptoms like pain, burning sensation, edema, erythema are analyzed and changes in the above said parameters are noted at specific intervals and assessment is done accordingly. Overall relief obtained is assessed based on the result of the statistical analysis. Coming to observational result. Here the 4 parameters like pain, erythema, swelling, burning sensation. Here the p-value is less than 0.001. So here the null hypothesis not accepted. Here the alternate hypothesis accepted. There is no significant difference between the trial and control group in the 4 parameters like pain, erythema, swelling and burning sensation. This is the overall effect of therapy. 100% cure in both trial and the control group. These are some of the photographs of the patients taken during the study. Coming to the discussion, in Dashanga almost all drugs are having Detanahara and Shofahara property, and some of the drugs have the Daha Prashavana, Vishakna, Rekta Shodaka, and Srodha Shodaka properties. And 80% of the drugs in Shikra and Annavadi are Ushnavirya, and its action is mainly due to Vishahara property. And coming to Tamala, it is Vatakasa Shamana, Shofahara, Vedana Stabana that helps in reducing the pain, edema produced by Prashiganamsha. Sanjanavana process Madhuri Rasa, Lagu, Snigdha, Sukshma Guna, Shita Virya, Tridosha Heta and Avidahi property. Here the combination of these 2 drugs in the yoga when applied externally that will reduce the main symptoms like pain, erythema, edema and the burning sensation. Now coming to the conclusion, all the parameters like pain, erythema, edema, burning sensation were equally effective in both groups. Hence, the null hypothesis can be rejected, accepting the alternate hypothesis. The statistically it is derived that Tambulapatra Saindava labor is equally effective when compared with Shikrapuranavadi labor in the management of Vristigadamsha. These are the references. Thank you.
Thank you, Doctor. Thank you for the well explained presentation. And next, I'd like to invite Dr. Deepthi Pawan for the paper and poster presentation.
Good afternoon, one and all. This is Dr. Deepthi Pawan, PG Scholar, Department of PTSR, Kaher, Sri PMK Ayurveda Mahavidyalaya, Belgavi. Today I'm here for my paper presentation and the topic is abnormal uterine bleeding in adolescents, correlation with model concepts with Ayurvedic perspective and management. Aims and objective. Aim is to study abnormal uterine bleeding in adolescents with Ayurvedic correlation, and objectives are to understand the causes and clinical features of AUB in adolescents, to correlate AUB with acidic thera, to study modern and Ayurvedic management approaches, to evaluate integrative management for holistic care. Introduction. Adolescence is the transitional phase between childhood and adulthood. Menstrual irregularities common due to immaturity of HPO axis. AUB is one of the most common gynecological problems among adolescents. Affect physical health, emotional well-being, academic performance, and social life. Easy diagnosis and holistic management are crucial. So the Ayurvedic correlation is AOB can be correlated with acidic thara or rakta pradhara. In this condition, pradhana dosha is pitta, and vata aggravation is also there, that causes rakta and artava dushti, and mainly strotas involved is artapah strotas. So, according to FIGO, AOB is bleeding from the uterine corpus that is abnormal in regularity, volume, frequency, or duration, occurring in absence of pregnancy. So, the normal pregnancy, normal menstrual parameters are cycle interval is 21 to 45 days, duration lasting for 2 to 7 days, and blood loss is 30 to 80 ml per cycle. But AOB includes heavy menstrual bleeding, frequent bleeding, infrequent bleeding, prolonged bleeding, and irregular bleeding. So, according to FIGO, PALM coin classification is there. PALM is structural causes and coin is non-structural causes. P stand for polyp, adenomyosis, leiomyoma, malignancy, and hyperplasia. C for coagulopathy. O is for ovulatory dysfunction. E for endometrial, estrogenic, and N is stand for not yet classified. So, most common in adolescent is AUBO, that is abnormal uterine bleeding due to ovulatory dysfunction. So the etiology of AUB in adolescents is mainly it is due to immature HPO axis and anovulatory cycles, endocrine causes like PCOS, thyroid, and hyperlactemia, hematological causes like coagulopathies, von Wickelbach disease, and psychological causes like stress, anxiety, emotional disturbances, nutrition causes like obesity, eating disorders, malnutrition, and other causes like medications, pregnancy complications, and infections. So the pathophysiology in this condition mainly involves failure of ovulation that leads to no corpus luteum. Hence, there will be no estrogen for progesterone formation that leads to persistent estrogen. That affects on endometrium that will lead to excessive endometrium proliferation, fragile endometrium formation, irregular shedding pattern, heavy prolonged bleeding, and hence clinically outcomes shows that irregular menstrual cycle, menorrhagia, that is heavy bleeding, passage of clots, iron deficiency anemia. So the clinical features and complications involved in such a conditions, menstrual symptoms like heavy bleeding, irregular cycles, prolonged menstruation, passage of clots, associated symptoms like weakness, fatigue, dizziness, palpitation, headache, and psychological symptoms like stress, irritability, anxiety, poor concentration, social withdrawal. Signs on examination, we can see signs like pallor, acne, obesity, hirsutism, mainly in PCOS, and thyroid enlargement. So the main complications are iron deficiency anemia, reduced academic performance, emotional stress, and social withdrawal. So in such a condition, diagnostic approach and evaluation is important. So detailed history is the main thing. So menstrual history and bleeding pattern, clot passage and pad count, stress and psychological history, weight changes and diet history, and investigations like CBC including HB, and thyroid profile including T3, T4, and mainly TSH, coagulation profile to rule out any coagulation factor is there, serum prolactin. Examinations like we should examine in pallor, anemia assessment, BMI measurement, thyroid gland examinations, signs of PCOS, that is acne, hirsutism, and imaging that involves UAG pelvis, assessment of uterine morphology, rule out any structural causes, and evaluate ovarian volume. So, modern management involves acute management, that is hemodynamic stabilization is important. IV fluids and blood transfusion if severe menorrhagia is there. Hospitalization if HB is less than 7 gram per DL. And medical therapy like tranexamic acid, NSAIDs and combined oral contraceptive and progesterone therapy works here. So the correlation of correction of anemia is important thing. So oral iron supplementation, nutritional correction, iron rich dietary advice, monitoring HB is a necessary thing. Also along with this management, lifestyle modification plays important role like weight reduction through controlled diet if patient is obese, regular moderate exercises, stress management techniques, sleep hygiene and routine. So Ayurvedic Nidan and Samprapti of Asirik Dara. As we know, Asirik Dara, in this Asirik Dara, Rakta Pravritti is in Atyadik Matra and Atyadik Strava is there. So Aharaj Hetu, Viharaj Hetu and Mansik Hetus are mainly Nidana in such a condition. Aharaj Hetu like Ati Ushna Tikshna, Lavana Ahara. And Viharaj Hetu that includes Ati Vyayama, Ratro Jagarana, irregular lifestyle and Ati Kshobha, Ati excessive traveling and Mansik Hetu like Shoka, Krodha, Bhaya, Ityadi. Hence, it leads to pathogenesis like Nidana Sevan causes dosha prakop that leads to Rakta Dushti, hence Artha Dushti and that leads to excessive bleeding. So the management according to Ayurveda is first one important is Nidana Parivarjan, second one is Pitta Shamana, third one is Rakta Stambhana Chikisa that is hemostasis management to control bleeding and Agni Dipana is important and then Vatanuloman and Dhatu Poshan. So our treatment goal is to control bleeding, correct anemia, normalize cycle and improve overall well-being of the adolescent girl. So Ayurvedic drugs and Pathya Apathya we have mentioned here. Important Ayurvedic drugs are Kashayas like Drakshadi Kashaya, Ashokarishta, Mustadi Kashaya, Pushanuk Churna and Lodra, Ashok, Nagakeshar, Amlaki and Rasayana Chikisa that involves Shatavari and Guduchi. Sorry. Pathya and Apatya plays important role in such a condition. We should advise patient to increase the intake of Krita and Dugdha Pana as Dugdha Pana is mainly indicated in Asrikdara condition. Also, enriched food that is dates, pomegranates, beetroot and green leafy vegetables. Homemade nutrition food is advised. In Apatya, a patient should avoid Ushna Tikshna Vidahi Annapana and bakery and preserved food. So, role of yoga, pranayama and lifestyle modification in such a condition. Yoga and asanas like Baddha Konasana, Bhujangasana, Vajrasana, Surya Namaskara play important role and it is important to improve pelvic circulation, stimulation of reproductive organs, aids digestion and calms mind and Surya Namaskara is helpful overall hormonal balance. So pranayama like Anuloma Viloma, Bhramari and Nadi Shodhana is important to balance nervous system, to reduce stress and anxiety and to purify energy channels. So this combined benefits in stress reduction and mental relaxation, hormonal balance, improve pelvic circulation and emotional stability. So integrative management is important as it leads to holistic care, better quality of life, reduces recurrence and improves overall health. So the modern medicines helps to rapidly control the acute bleeding episode, hormonal regulations through OC pills and progesterone, correction of iron deficiency anemia is managed through modern medicines and diagnostic procedures like lab investigations etc. According to Ayurveda, dosha and rakta stabilization we can do and herbal formulations like ashoka, lodra, it is important to stabilize the dosha and lifestyle and dietary correction as we mentioned that dinacharya, rutucharya is important in such a conditions. So that will help in psychological support and mainly counseling is important. Hence, the conclusion is AUB is common. It's significant gynecological problem in adolescent girl with multifactorial etiology, immature HPO axis and resultant ovulatory dysfunction remains the predominant cause in this age group. Early and accurate diagnosis is essential to prevent complications such as iron deficiency anemia. Ayurveda correlates AOB with acidic thara involving Pitta Rakta vitiation and Urdhwaga Strotos involvement. Integrative management, combining modern and Ayurvedic approaches, ensures sympathetic relief, hormonal balance, and overall well-being. So, long-term follow-up and lifestyle modification are the key preventing recurrence and preserving reproductive health. So, these are the few references. Thank you.
Thank you, doctor. Thank you for the well-explained presentation. I don't know, poster presentations is there.
This is Dr. Niharika, PG Scholar Department of PTSR from Pahers, Shri BMK Ayurveda Mahavidyalaya, Belgavi. I'm here for my poster presentation and the topic is Ayurvedic role in adolescents with special reference to acidic thera and integrative review. Introduction. Adolescent AUB affects 10 to 20% of young females, significantly impacting quality of life, hemoglobin level, and psychological well-being. Toiletry dysfunction is the most common cause in adolescent menorrhagia. Immaturity of HPO axis is the primary pathophysiological mechanism, manifests as heavy lung irregular menstrual bleeding. In Ayurveda, it can be correlated with acidic thera that is caused mainly due to pitta vitiation and Raktadushti. Aims and objective. Aim is to review AOV in adolescents and to establish scientific correlation with Ayurvedic concept of acidic thera for integrative understanding and management. Objectives are to study modern pathophysiology of AOVA, to correlate with Ayurvedic Nidana Samprapti, to explore integrative management strategies, and to review classical and contemporary literature. So the modern concept of AUD is actually abnormal uterine bleeding and O stand for ovulatory dysfunction. So the pathophysiology is due to immature HPL axis, it leads to anovulation and there will be no corpus luteum formation that will lead to no progesterone. And upper estrogen will lead to endometrial proliferation and fragile endometrium will lead to irregular shedding. So the clinical presentation will be like heavy menstrual bleeding, prolonged irregular cycle, passage of clots and dysmenorrhea, and that will further lead to fatigue and anemia. So the Ayurvedic correlation is with Asriktara. This is Asriktara is mentioned in Charak Chikisastan 13th chapter and also mentioned in Sushru Samhita Tantra. So the main dosh environment is mainly Pitta and Vata initiation is also there. Dusha is mainly Rasadhatu, Raktadhatu and Artava and Strota environment is Artava Strotos primarily and Rasavan Raktava Strotos. Nidana is आता तीक्ष्ण आहार चिंता शोक रात्रि जागरण अग्निमंद रक्त प्रदुष्टकर आहार अतिस्थौल्य और sedentary lifestyle. So, according to Nanak, it is mainly due to immature hypoxia, post-menarche, nutrition deficiency and anemia, thyroid disorders, PCOS and coagulation disorders. So, the Saprapti, according to Madden, in menarche, there is immature hypoxia that lead to anovulation and hence no corpus luteum formation that will lead to no progesterone. Hence, unproposed estrogen formation is the one that will lead to endometrial proliferation and hence endometrium becomes 3 times fragile, lead irregular uncontrolled shedding and AV stare. According to Ayurveda, it is due to Nidana Sevan that will lead to Vriddhi and Raktadoshti and also Vata Prakopi is there that combined will lead to Agninanda. Thus, Dhatu Vriddhi and Rakta Vriddhi is there and Artava Sratodushti is there that will lead to Karkashay Dhavyadushti and Atipravidya Tarcha, hence Asrikdara is there. So, clinical features of these conditions are mainly heavy menstrual bleeding, prolonged menstruation lasting for more than 7 days, irregular cycle length, it might be less than 21 days or greater than 35 days. Dysmenorrhea or pelvic pain might be there. So, the investigation required are CBC, hemoglobin, thyroid profile, TSH, hemoglobin evaluation, like pharmacostimulative hormone, LH, estradiol, progesterone, UAG pelvis, coagulation profile like blood coagulation and PTPNR and prolactin levels. In Ayurveda, we investigate by Dashvid Ashtavik Pariksha, Agni Pariksha, Nadi Pariksha, and Artha Pariksha. So the management is integrative. According to Madam, we give iron supplementation to cure anemia, tranexamic acid to stop heavy menstrual bleeding, NSAIDs and hormonal therapies like OCPs, and according to Ayurveda, mainly Nidana Parivarjan should be there and Chikitsa should be Rakta Pitta Hara and Rakta Visaravati Chikitsa, Rakta Stambhan Dravyas, plays important role in such a condition. Virechara is mainly uh, indicated in condition of acidic dara and formulations like Tushanu Chuna, Nudradi, Ushirasa, and Chandraprabhavati mentioned in such a condition. So the clinical observation in age group of 13 to 19% age group is commonly affected, and 78% of patients with irregular bleeding pattern. There are 62% cases associated with anemia that is as less than 10 gram per year. So the discussion is about Ayurveda and modern science converge on the central role of hormonal imbalance and blood tissue involvement in the pathogenesis of adolescent AUD. Immature H2 axis that is correlated with Vata Pitta imbalance in arthrosclerosis. Estrogen-induced endometrial proliferation can be correlated with Rasa Rakta Vritti. Convolution correlates with Apanavata dysfunction. Stress is the common positive factor in both systems. Ayurvedic Vedastam drugs that complements the modern hemostasis and integrated approach improve menstrual irregularity, HB level, and quality of life. So the final conclusion is AUD and Asrubdara shares strict parallel pathophysiology across both systems. Adolescent AUD can be effectively understood and managed through an integrated lens. Nidana Parivarjan and dietary correction are powerful prevention tools. Ayurvedic Raktastamban and Shodhan therapies offer holistic effective management. Early diagnosis and integrated treatment help in prevention of iron deficiency anemia and long-term reproductive complications. Therefore, integrated care leads to holistic well-being. These are few references. Thank you.
Thank you, Doctor. Thank you for the insightful paper and poster presentation. Next, we go to the another poster presentation. I'd like to invite Dr. Utkarsha Sawant for the poster presentation on the topic Uttarabasti in female infertility.
All respected panel members present, myself, Dr. Utkarsha Sawant, PG scholar from Prasuti Tantra State of Department from Dr. D.Y. Patil College of Ayurveda and Research Center, Pilgrim. Topic of my poster presentation is Uttar Basti in female infertility, guided by Dr. Jayashree Patil ma'am and HOD Dr. Dhanashree ma'am. Styayatyasam garba iti stri annam bandhyam nirastram. Failure to achieve conception is infertility. Infertility is the inability to conceive after 12 months of unprotected intercourse. It can occur from issues with the ovaries, uterus, fallopian tubes, hormones, or psychological factors and is classified as primary or secondary. Ayurveda emphasizes on four main factors: Beach, Saumanasya with Apana Vata playing a key role in regulating reproductive organs. Types of infertility according to Charak: Bandhya, that is absolute inability to conceive due to serious innate problems like Beachopagata. Praja, infertility in which women conceives after treatment, or a woman with unsuccessful pregnancies. Praja, women in her active reproductive age does not conceive with previous history of bearing successful pregnancies. Causes of infertility are ovulatory disorders like PCOS, hypothalamic disorders, primary ovarian insufficiency, high prolactin, thyroid disorders, fallopian tube blockage, damage, uterine issues like fibroids, age-related infertility, unexplained infertility. These factors include age. As women age, quality quantity of eggs decline, making conception harder. Smoking, harms reproductive organs, depletes eggs, increases miscarriage, ectopic pregnancy risk also increases. Weight, being overweight or underweight can affect ovulation. Sexual history, STIs like chlamydia and gonorrhea can damage fallopian tubes and multiple unprotected partners increase fertility risks. Alcohol, excess alcohol consumption can reduce fertility. Now the definition of Uttarvasti. Uttarmargena Diyamanam Tatha Shreshtagunataya Ucha Uttarvasti. Uttarvasti is a unique Ayurvedic procedure involving administration of medicated oils or decoctions into the uterine cavity through the vaginal opening. Properties of Uttarvasti include Yoni Prasadana, that is, it promotes health and hygiene of the female reproductive organ. Dosha Shamana pacifies vitiated Vata and Kapha doshas in the reproductive system. Artava Janana helps in the proper formation and regulation of Artava. Garbhasya Balya strengthens the uterus and supports healthy conception and pregnancy. Shulahara relieves pain and discomfort in the pelvic region and during menstruation. Vata Anulomana regulates downward movement of Upan Vata and restores natural functions. Mode of action of Uttarvasti are it has local as well as systemic effects. Local effects include cervical problems. In that, Katu Ushna Tela reduces obstruction, improving patency. Poor cervical mucus secretion. Madhurashita Grita nourishes cervical glands, increases mucus production. In ovulatory disorders, Sneha drugs acts after absorption and helps regulate HPO axis. In tubal blockage, Lekhana drug acts locally to clear obstruction in fallopian tubes, may also stimulate endometrial receptors, normalize reproductive physiology. Intravaginal administration helps better drug absorption because the posterior fornix has rich blood supply and acts as a drug reservoir. Systemic effect of Trabasti include it stimulates neuroendocrine pathways, influences hormonal balance and reproductive functions. According to the concept of systemic biology, all body organs are interconnected. Changes produced in one organ can affect the whole body. Discussion. Female infertility is increasing due to modern lifestyle and genetic factors. Infertility causes physical, mental, and emotional stress in women. According to Ayurveda, conception depends on four factors, that is Ritu, Kshetra, Ambu, Bij. Disturbance in any factor can lead to Vandhatva. Uttarvasti is an important therapy for correcting Kshetra defects. Vata dosha is considered the main cause of yoni vapor and infertility. Uttarvasti acts through Vata Shamana, that is pacification of Vata, Shodhana, that is cleansing, Ropana, that is healing and rejuvenation. It also helps improve uterine health and female fertility. Conclusion. Ayurveda offers economical and effective infertility treatment with minimal side effects. Tirabasti is considered a major therapy for Vanditva, especially Vata dominant conditions. It strengthens Garbhashya, that is uterus, and improves reproductive health. Direct administration of medicines enhances therapeutic effect. Proper drug selection and timely administration are important for better results. Thank you.
Thank you, Doctor. Thank you for the well informative poster presentation. Next, we're going to another paper presentation related to the hypertension. I would like to invite Dr. Harshini T for the paper presentation on the topic Ayurvedic management of hypertension.
A warm good evening to everyone. Myself, Dr. Harshini T, MD Scholar, Department of Kaya Chikitsa from Dr. NRS Government Ayurvedic College, Vijayawada, Andhra Pradesh. My topic is Ayurvedic management of hypertension, a holistic approach. Hypertension is widely recognized as a major lifestyle disease and it is considered as the main cause of morbidity and mortality nowadays. And WHO has identified 33% of world population were estimated to have hypertension, in that half do not know that they have hypertension. As a Ayurvedic practitioner, what we will offer to the society is important. Most of the cases we will think only about Sarpagandha or its derivatives. Sometimes patient may respond and sometimes may not. And another one thing is Ayurvedic medicines as an added therapy to modern medicines we are giving. Is there something we miss and what we can do? we will see in this presentation. This presentation discusses the Ayurvedic understanding of hypertension. Hypertension is one of the leading non-communicable diseases worldwide and is often called the silent killer because many patients remain asymptomatic for years. It significantly contributes to cardiovascular, renal, and cerebrovascular diseases. In India, hypertension is responsible for a major percentage of stroke and coronary heart disease deaths. The Ayurvedic challenge. Hypertension is not directly named as a single disease in classical texts. However, it can be understood through concepts of dosha, dusha, and stotas involvement. And another one important thing is hypertension is not a single diagnosis in Ayurveda. It is a sambrapti. If not properly controlled, it ends up in many diseases and complications too. Physiology of blood pressure in Ayurveda. In Ayurveda, maintenance of normal blood pressure depends on the balance of Tridosha and Dhatu. Pranavada regulates central control mechanisms, while Vyanavada governs circulation and cardiac activity. Sadhaka Pitta influences stress response and emotional regulations. Nidana, it is of Aharasha, Viharasha, and Manasika Karana. In modern, we are seeing it is of primary hypertension, secondary hypertension. Primary hypertension, mainly it is of genetic disposition plus environmental factors, and secondary hypertension, it is due to any other complication. As Sambrapti, it is of Bijabhaga Dushti like genetic disposition, and it is of Sandarpanajanya or Apadarpanajanya Vyadhi. If it is of Sandarpana or like Virdahara Sevana, it will end up in Agnimandya and then lead to aggravation of Kafapitta, Rasarakta, Mamsa, Meda, Dushyas and leads to Margavarna Chanyam and finally ends up in Vada Prakopa. If it is Apadarpana, and easily it will end up in Vada Prakopa and leads to Upadrava Vyadhi. Sambrapti Kadaga, Vada is of Prana Udana Vyana and Pitta is of Sadhaka Pitta and Kapha is of Avalama Kapha. Mainly Dhatus like Rasarakta, Mamsa, Meda Dhatus and Shrota involvement is of Manavaha Shrota, Rasavaha Shrota, Pranavaha Shrota, Rakta and Mamsa and Meda involvement will be there. Lakshanas like Siraha Shula, Akshiraga, Brahma, Tamodarsh. Presentations in patients. Normally up to Vyaktavastha, patient don't approach us. In the Vedavastha, like in complication stages only they will approach us in the form of Vyadhi Sankara, Avarana and Marma Vigata. Like Vyadhi Sankara like metabolic syndromes and Avarana and Marma Vigata. Marma Vigata mainly is of involvement of 3 Marma. Like we can compare with end organ damage. Chikitsa, Nidana Parivarjana, Shamana Chikitsa, Shodhana Chikitsa. Nidana Parivarjana is the first and most important step. Nidana Parivarjana Chikitsa. So, only with Shamana and Shodhana Chikitsa, without modifying the cause of hypertension, we cannot treat or prevent the complications. In Sadhya Asadhya also, if Acharya mentioned like if Nidana is strong and the disease is considered as Yapya. In modern medications like in primary hypertension, they prescribe non-pharmacological methods like involving lifestyle modification, regular physical exercise, salt restriction, weight loss, avoid smoking, alcohol, relaxation, DASH diet, potassium rich diet, and blood lipid control. Next is Shamana Chikitsa. Like Kaya se Antaragni Chikitsa, Kaya Chikitsa. Mainly this Samrapti is due to Agni Mandya. So Agni Vaishamya, we have to correct the Agni Vaishamya and Avarana. Avarana has to be corrected by Anabhishanti, Strota Shodhanam, Vada and Lovnam. And Vada and Lovnam is important thing in hypertension because Vyanavada mainly involved in Samrapti and Marma Paripalana because we said like Trimarmya is affected as end organ damage and finally we have to give Rasayanam. Lava Payashi Shastanam Rasadinam Rasayanam. Next one is Shamana Aushadhis. So not just by like hypertension means Sarpagandha or like specific drugs, we have to concentrate on like this is due to which dosha, dusha avasthas and due to any other secondary complications, whether it is of primary or secondary, we have to see and depending upon the causes, we have to treat which one is needed like Hridya, Rakta Shodhaka, Medahara Lekana, Mutrala, Medya Rasayanam, Ojavartaka and Pramati Dravya. Sarpagandha vati is very effective in controlling hypertension as a single whole herb or in combination with other drug. Reserpine is an active principle as a potent sympatholytic agent that can lower blood pressure and but long-term use may lead to depression. And like Amlam Hridyana Shreshtam, Amlo Hridyam Tarpayati. Acharya Sharaka given importance to Amla Dravyas. In Hridya Deshemani, like 10 tracks or is of Amlarasa Pradana Dravyas. This slide highlights the correlation between Ayurvedic pharmacological action and modern scientific. In Shodhana Karma, Vamana is not preferable as if the patient is having cardiac related issues. If the patient is lean and not having any cardiac ailments, we can go with Vamana. And Virechana is indicated mainly of Mriduvirechanam, and Nityavirechana also good. And Vasti and Nasya also indicated Rasayana plays a major role in long-term management and prevention of complication. Conclusion. Hypertension is not merely a single disease entity with a one-size-fits-all treatment approach. Its management should be individualized based on the nature of the condition, whether primary or secondary hypertension, along with assessment of dosha involvement, avastha of the disease, rogabala and rogibala. Ayurveda emphasizes a holistic and patient-centered approach rather than symptomatic control alone. Effective management requires not only internal medication but also nidana parivarjanam, appropriate lifestyle modification, dietary regulation, stress management, and as a biopsychosocial approach. By integrating preventive, promotive, and curative principles, Ayurveda can play a significant role in reducing the morbidity and mortality associated with hypertension. Thank you.
Thank you for the well explained presentation. Thank you so much, Doctor. Next, we go to the another paper presentation. I would like to invite Dr. Rika Ashok Sankalage for the paper presentation.
Respected teachers and my dear colleagues, today I am going to present a topic on digital screen exposure effects in children from an Ayurvedic perspective. This is an important emerging issue in pediatric practice. So let's begin with the introduction. In today's digital era, children are increasingly exposed to screens such as mobile phones, tabs, and televisions. This exposure has significantly increased, especially after the COVID pandemic. Early exposure, even before 2 years of the age, is now very common. This can be considered a modern light-related disorder affecting overall child health. So, let's see the objectives. The objectives of these presentations are to study the effects of digital screen exposure in children, to correlate these effects with Ayurvedic principles, and to suggest preventive and management strategies. Effects. Excess screen time leads to the multiple systemic effects, physically, mentally, and socially. So, physically, it causes the eye strain, obesity, and sleep disturbances. Mentally, it leads to reduced attention span, poor memory, and anxiety. Socially, it results in poor bonding, reduced interaction, and decreased play activity. Thus, it affects the child holistically. Now, we are going to see the Ayurveda correlation. According to Ayurveda, this condition can be explained through multiple concepts. Firstly, there is a Vata aggravation leading to the hyperactivity and insomnia. Secondly, the Pitta aggravation causes the eye strain and irritability. And third, the Kapha aggravation due to the less inactivity. There is also increased Rajas and Tamas, which affects the mental state. Most importantly, it is an example of a Satmendriyartha Samyog, meaning improper the use of sense organs. Let's see the developmental impact. Excess screen exposure reduces direct human interaction. This leads to the delayed speech, poor cognitive development, and behavioral problems. Ayurveda describes this as an impairment of Medha, Smriti, and Vyavahar. Hence, proper sensory and social stimulation is very important for the child development. So, let's see Udan Panchak from the Ayurvedic diagnostic perspective. Udan is excessive screen exposure. Dosh involved are Vat and Pitta. Dushya includes Manas, that is Rajasa and Tamas, and Indriya. Clinical features include Nidrana, Chanchalta, and eye strain. So, let's see the management. The main principle of management is Nidana Parivarjan, that is avoiding excessive screen use. Along with this, proper dinacharya, including the good sleep, outdoor activity, is essential. Like the Rasayana like Brahmi, Shankapushri, Vruta, help in improving the cognition. Therapies like Abhyanga, Shirodhara may be used in selected cases. So, prevention is always better than cure, as we all know. Prevention is the most important aspect. Screen exposure should be avoided in children below 2 years. In older children, it should be limited and supervised. Encouraging physical activity, family interaction, and play is essential. Now see the Ayurveda versus modern correlation. Modern medicine explains this as a neurobehavioral and lifestyle disorder. Ayurveda explains it as a dosha imbalance and improper use of sense organs. Thus, both systems complement each other in understanding this condition. So, to conclude, digital screen overuse affects the physical, mental, and social health of children. Ayurveda explains it through the dosha imbalance and indriya overuse. Prevention remains the best strategy. This condition can also be considered as an anukta vadhi, means newly emerging disorder, as per the Ayurveda. These are the some references which are used for this presentation. Thank you so much.
Thank you, Doctor. Thank you for the well-explained presentation. Next, we go to the paper and poster presentation. I would like to invite Dr. Suyog Evale for the paper presentation.
Educational Society, Ayurvedic Medical College and PG Research Center, Rome, Karnataka. My paper presentation topic is anatomical change in lumbosacral spine in Vata, Kapaj, Vidrasi and MRI-based cross-sectional study. Understanding Vidrasi in Ayurveda. Sanskrit derivation derived from a Greek word, Varsha, referencing the typical clinical gait of the patient. Classification considered as a major neurological illness, Maharoga, and categorized under Vataj Navantaj Valley. Symptom pathway, radiating pain starting at the speaker, local region processing down to Kati, lumbar, pushkar, thigh, janu, knee, janga, calf, and finally reaches to palm. Rational and research objective. Why this study matters? Ancient Arabic classics describe the subjective pathology and physical signs of water frequency extensively, yet direct imaging correlates are scarce in research. This study acts as a bridge utilizing high resolution numbers sacral MRI scan to pinpoint exact structural compromise corresponding to functional Ayurvedic symptoms. Research hypothesis, primary objective to map and analyze clinical anatomical variations and structural degeneration in the lumbosacral spine in pre-diagnosed patients. Hypothesis, distinctive structural compromise, disc herniation, facet arthropathy, osteophytic changes act as a direct physical substrate for what purpose symptoms. Classical literature review, speak Purva Kati, Pushto, Ruja, Arju, Janga, Pada, Kramata, Brudrasu, Stamba, Ruka, Tandri, Gruhati, Spandati, Mruhu, Vata, Dwada, Kapata, Tandra, Gauro, Rochika, Nita, Charaka Samita, Chitastan, 2883/4, 54, Vata, characterized by stiffness, stamba, pain, ruka, pricking, toda, and twitching. Spandana. Vata Kapajata exhibit additional heavy congestion, drowsiness, tandra, heaviness, gauro, and anorexia or ochaka. Research methodology and design. Study framework. Study design cross-sectional clinical trials. Study duration 18 months of incentive screening. Sampling method, purposing sample, source patient database from Ayurvedic hospital. Sample size calculation n is equal to 4 into Q upon E square. N is equal to 40.25, sample size n is equal to 35. Clinical assessment parameter, Ayurvedic symptom, Lakshana, Roka, modern clinical equivalent pathological action, radiating, cytotic, neuropathic pain, assessment to present option, visual scale. So the paresthesia, teams and neural sensation, Astanga, lumbar stiffness, restricted spinal movement, Spandan, fasciculations, muscle twitching, Ruchi, Tandra, systemic proper indication, anorexia, smilance, and gaurava. Filling out profound heaviness in lower body. Lumbosacral MRI parameters, colon space parameters, vertebral body or osteophyte changes, alignment issue, intervertebral disc protrusion or extrusion in L1 S1, L1 to S1, intervertebral foramen, degree of foraminal narrowing, curvature, loss of standard lumbar lordosis, neural and soft tissue parameters, nerve compression site and implemented severity, spinal canal, high resolution stenosis measurement, ligaments and joints, ligamental flavum and facet hypertrophy, lumbar musculature, spasm and muscle atrophy indicators. Prevalence of clinical symptoms, Roka 100%, 35, stamba stiffness 85.7%, Gauros heaviness 74.2%, 26% of 35, Toga creaking 68.5%, 24% out of 35, and stamba twitching 40%, 40% by 35%. Key structural anomalies L4 to L5, L5 to S1 disc herniation, canal stenosis and foraminal narrowing or facet joint arthropathy and osteopathy, other curvature. Also to find an evaluation of the herniation is 51.4%, then canal stenosis and foraminal narrowing 28.6%, facet joint atrophy and osteopathy 11.4%, other curvature anomalies and atrophy 8.6%. Clinical anatomical discussion. Ayurveda model synthesis. Our cross-sectional MRI study reveals a direct link between Ayurvedic pathology and physical finding. The stomach stiffness and broader heaviness in Vata Kapha Grigasi correlate directly with the space occupied and compressive nature of cough. This is visualized radiologically as a facet joint hypertrophy, ligamental flavum thickening, and posterior disc extrusion, causing a significant spinal canal stenosis. Key research finding 85.7% is compromise. Symptom mapping, anatomical nerve growth compression correlated precisely with the classical pain pathway starting at a speaker and relating to partner. Proper phenotype, severe symptom like stomach, reproductive structural chronicity marked on MRI by scanner so facet atrophy, clinical and integrated number cycle MRI scan into Rachana, Sareera assessment provide robust data to anatomical diagnosis before deciding the on therapy. Thank you.
Thank you, doctor. Thank you for the wonderful paper presentation, and one more poster presentation is there.
Sir, Dr. Daniel, Rasayana, Professor Department of Rasayana, Medical College. My contribution topic is the role of normal chikiৎসা in pain management or review. Abstract. Normal chikiৎসা, a key component of Ayurvedic medicine, focuses on the manipulation of vital energy points known as norma. This examines its role in pain management, exploring the theoretical foundation, mechanism of action, clinical application, and implication for integration into modern healthcare. Interval suggests that normal chikiৎসা can provide relief in various types of pain, including musculoskeletal, headache, and chronic pain syndrome. However, further research is needed to establish standardized protocols and validate its efficacy in contemporary medical practice. In production, pain is a complex experience affecting nearly 1 in 5 adults worldwide. Conventional pain management may cause side effects, dependency, and incompatibility. Ayurveda offers a holistic, safe, and effective approach through normal chikiৎসা. Being able to explore the role of normal chikiৎসা in pain management, materials method, database, PubMed, Google Scholar, Ayurvedic Journal, keyword normal chikiৎসা, pain management, Ayurveda Brahmas, study grade 2000 to 2020 article 22, article included 25. Concept of Marma, vital anatomical sites where muscles, vessels, ligament, bones, that joints meet. Then Marma, 7. Shanka Marma, Nilo Marma, Hada Marma, Nani Marma, Marma, Janu Marma, Marma, Nilina type of Marma, type of Marma, 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 nothing to appointed. Often have to give muscle tissue, strength and continuity, structure muscle. Type of Marma, number 22, related to blood vessel circulation and vitality and main organ structure is blood. 9 Marma, number are 27, associated with ligament, stability and support, and dominant surgery ligament. 50 Marma, 27, located on bones, provides structural support, dominant structure is bone. 20 Marma, number 9, and located as joint responsible for movement and dominant structure is joint. Concept of Pran is the life force energy that flows through the body via process. So this is Pran meant to pain, this is an emotional imbalance. Simulation of Marma restores the flow of Pran and promotes healing. And referring with the modern medicine, in multidisciplinary approach combining Ayurveda, Buddha therapy, rehabilitation, and conventional pain medicine can improve patient outcome and provide hospital pain. Mechanism of action, neurological effect, stimulate mechanism receptor model of pathway and involve get control therapy. Endorphin release, promote release of endorphin, natural pain relief system. Personally, now the flow of and they can supply leads to hospital. Stress, anxiety, and emotional tension improve mind, body balance, anti-inflammatory, radical inflammation, edema, muscle spasm, and food sleeping. clinical application in pain management, musculoskeletal pain, chronic low back pain, cervical pain, shoulder and back pain, outcome reduces pain, improve mobility and function, headache and migraine, stimulation of head and neck murmur, reduces frequency and intensity, promote relaxation, outcome reduce in headache and improve quality of life. Osteoarthritis reduces pain and stiffness, improves joint function, enhances range of motion, outcome, better and daily activity performance, fibromyalgia and chronic pain, reduces widespread and improve sleep quality, reduces stress and fatigue, outcome improve quality of life and well-being, cancer pain management, supporting palliative care, reduces pain and anxiety, enhances overall comfort, outcome management and improve emotional support, advantages non-invasive, free approach for side effects, cost effective, patient centered therapy, limitation, lack of adherence protocol, limited randomized clinical trials, need for scientific validation, requirement for trained practitioner. Conclusion, future को large scale clinical trials, standard treatment protocol, neuropsychological and biochemical studies, integration into evidence-based medicine, awareness and training of practitioners. Conclusion, may Marma Chikitsa is the same effective and holistic approach for pain management. It enhances both physical and psychological aspect of pain and enhances overall health and quality of life. Scientific validation and further research here to integrate this ancient wisdom into modern healthcare. Reference, you will be. Thank you.
Thank you, Doctor. Thank you for the well explained paper and poster presentation. And thank you so much, Doctor. And next we go to the another poster presentation. I'd like to invite Dr. Omkar Sambat Madaki for the poster presentation.
Hepatitis. The hepatitis is a systemic infection predominantly affecting the liver caused by hepatotropic viruses, which are the A, B, C, and T, the type of viral hepatitis. So, hepatitis A and B are usually acute and transmitted through the contaminated food and next type is hepatitis B, C, and D. Can become chronic and transmitted through blood and body fluid. Next, the symptoms of acute hepatitis. The symptoms last less than 6 months. Nausea, vomiting, and right after coronary pain. So, elevated bilirubin level causing jaundice, putridis, dark urine, and pleural stool, and hepatology. Next one is symptoms of chronic hepatitis. Symptoms last more than 6 weeks. Fever, fatigue, and loss of appetite are the most common symptoms, and extra hepatitis symptoms like arthralgia, that is joint pain, and skin rashes are the most common chronic hepatitis. Next is treatment of hepatitis according to the model. First is supportive including hydration, rest, balanced diet. These are the home remedies like another is adequate dietary intake. Next one is also deoxyfolic acid, that is 20 mg per kg per day. It is a dose of that. Next one is chronic HBV treated with entero and lamivudine. These are the drug using chronic HBV. The next one is SCG treated with interferon alpha alone. These are the modern perspective of hepatitis. Another, we are the Ayurvedic perspective. So that is Kamla. Vivekan Kamlana, Lati, Iti Kamla. And the religion or your paper, Italani, Vishevate, Pacificus, Snugans, Lugdan, Rona, Kolkate. Kamla is described as a condition here excessive pitta, that is why accumulated and affected the body. In main forms are Shaka-shaped Kamla and Prostate-shaped Kamla. Peripheral form where curve blocks the pathway resulting in excessive delay, and coastal shaped Kamla is central form requiring gentle purgative with bigger medicine in cleansing the system. Symptoms of Kamla. Haritra Nedra, Sabrusha, Haritra Akanan, Raktapitta,
मूत्रो भेकवर्ण हतेंद्र ताहा विभाग दौर्बल्य दसराहून चिकर्षित कामलारोगोपदेश कोष्ठाश्रय मतः yellow discoloration of skin and eyes, yellowish nail and urine, weakness, poor appetite, and a burning sensation. Ayurvedic treatment of Kamla, Shakashri Kamla Chikisa Sudra, Pilakishkaniga, Yatun, Varcha Srijani, Kamani, Shleshmana, Rudramanga, Deka Pitta, Papatagajira, and Koshkashri Kamla Chikisa Sudra, संशोध्य मृदु विसिके कामनी की विवेचने काव्य संक्षिप्त कोष्ठाग्न पथ्यान्ननि तापयेत शाकशिल्पाम्ल treated using for herbs and medicines कोष्ठशिल्पाम्ल focus on purgative that is virechen the bitter and gentle purgative diet determination that is the bread consume light easily digestible food like whole wheat rice, green gram udra, include fruits like ripened papaya, draksha, and wheat. Avoid heavy, producing foods, sweet cakes, oily, and fried items. Okay, thank you.
Thank you, doctor. Thank you for the well explained presentation. And next we go to the another paper and poster presentation. I would like to invite Dr. Prachod Sahadev Kogane for the paper presentation.
Hello everyone, my name is Prajot Sahadev Kokne. My guide name is Dr. Ganesh Belurkar, Professor Shalyatantra, Co-Guide Dr. Gayatri Mavle, HOD Shalyatantra, Course PG Scholar Shalyatantra Department, Dr. VGD Gramin Ayurved Mahavidyalaya, Patur, Akola. Topic of paper presentation: An Ayurvedic approach to Dushtavrana, a case study. Introduction. The term Vrana refers to a destruction, rupture, break, and discontinuity of body tissue on a body part. Dushtavrana, chronic or non-healing ulcer, is a commonly encountered condition in a surgical practice. If not managed properly, Dushtavrana can severely impact a patient health, leading to complications and even mortality. Delayed wound healing can be attributed to factors such as infections, slough, and the presence of foreign bodies. In contrast, cleaning wounds tend to heal more efficiently, therefore, maintaining wound cleanliness through the healing process is essential. Surgeons aim for optimal wound healing with a minimal pain and scarring. Acharya Sushruta elaborate on 6 types of Dushtavrana and their treatment includes various therapeutical approaches categorized mainly as Vrana Shodhana, wound cleanings, and Vrana Ropana, wound healing. Additionally, Sushruta describes 60 different techniques. Shashti Upakrama. Method. Case report: a 48 years old female patient presented with a non-healing ulcer over medial aspect of left ankle joint associated with pain, pus discharge, swelling, and itching since 16 days. Ulcer become infected with pus discharge. There was no history of diabetic mellitus, hypertension, or any major disorder. The family history was also not significant and with the patient disorder. Local examination: location medial aspect of left ankle joint, size 3 to 4 centimeter, discharge purulent discharge present, floor covered with slough, margin irregular, edges inflamed, tender and localized, raised temperature present. General examination: general condition good, respiratory system not available data, CVS S1 S2 normal, no added sound, CNS normal, per abdomen soft, BP 130 to 130 by 70, pulse 88 per minute. Treatment: Trifala Gugul 2 BD orally, Ashwagandha Adi Lep locally. Mode of action: Ashwagandha Adi Lep consists of Ashwagandha, Katfal, Yashti Madhu, Lajadu. Ashwagandha present in a formation of a Kapha Vata specifics as well as Shotahar due to its Madhur and Snigdha property. It purifying blood, reduces local inflammation, relieves pain. Katfal is potent oral drug which reduces local itching around the infected wound due to its Kashai Katu and Ushna property. It acts Krumigna, leading to Krumigna effect. Yashtu Madhu, due to its Madhur Shita Snigdha property, specifies Pitta and reduces local irritation, causing effective wound healer. It also has anti-inflammatory properties. Lajjaru, due to its Kashaya and sheath property, help in Rakta Stamban and stop local bleeding blood loss in infected wound due to its sandhya properties. It helps in fast healing of infected wound. Trifala Gugul Shodhana purification. Trifala Gugul helps cleanse the wound by removing properties and necrotic tissue, facilitating the creation of a healthy environment for healing. Ropana healing. It promotes tissue regeneration and encourages the wound to close, preventing scarring and promoting the formation of new skin. Third, anti-inflammation and anti-inflammatory action. Gugul, a key ingredient, possesses anti-inflammatory properties, helping to reduce the swelling, pain, and discomfort associated with the wound. Antimicrobial action. Trifala Gugul component include Gugul and Trifala exhibit antimicrobial activities, helping to combat infection and prevent further complication. Vedana Shamak pain relief. Trifala Gugul helps reduce pain and discomfort associated with the Dushtavrana. Application. The wound is cleaned with warm normal saline. After drying with a sterile gauze, Vranalepa is applied over the wound, followed by sterile pads and absorbent layer. The dressing is secured with bandage without compressing the circulation. The dressing is removed in the evening and the wound is cleaned again with a normal saline. Discussion. The treatment approaches on Ayurveda such as lifestyle modification, management of underlying diseases, systemic drug administration. There is no any specific scale applied for the assessment criteria for the case. Only the following points were observed: change in pain over 1 month, reduced pus discharge, swelling and itching over 15 days. Effect of Rana Vedana pain tenderness was gradually reduced by the end of third week of treatment. Vedana is predominant feature of Vata due to a Trifala Gugul Vedana reduces. Effect of Rana Akriti by 30-day Vrana was completely healed. This may be due to a Vrana Shodhana and a Vrana Ropana property present in a Vrana Lepa. Observations. There was improvement in symptoms of pain and redness reduces. Overall improvement in the quality of life was observed in the patient. Conclusion. Vrana Lepa can be used effectively in the management of a Dushta Vrana. It helps avoid the painful procedures and debridement of slough in those who are unable to tolerate pain. It also does the action of Shodhana and Ropana. It removes only the unhealthy granules tissue, hence wound size does not increases. There is further need in the research of Sashti Upakrama mentioned by Sushrut in order to validate their efficacy and broaden the spectrum scope of Ayurveda in wound management. Result. The clinical feature of Dushtavrana were improved around third week and the wound was completely healed at the end of fifth week. Thank you.
Thank you, doctor. Thank you for the well articulated paper presentation. And one more poster presentation is there.
Hello everyone, my name is Prajot Sahdev Kokane, final year PG scholar. My guide name is Ganesh Bilurkar, Associate Professor. Institute is Department of Shalatandra, Dr. VJD Gramin Ayurved College, Patur, Akola. Parikartika, Fishery Nano, an Ayurvedic and Modern Conceptual Review. Introduction. Parikartika is common anorectal disorder described in Ayurveda characterized by several cutting and tearing pain in Godha Pradesh. The condition closely resembles Fishery Nano in modern science. It is commonly associated with constipation, hard stool, improper dietary habits, and vitiation of Vata dosha. The disease is significantly affects quality of life due to severe pain during defecation, burning sensation, bleeding, and sphincter spasm. Causes. The Aharaj Nidan, Rukshahara, Atikatu, Tikshna, Lavanahara, low fiber diet, inadequate water intake. Viharaj Nidana, Vegadharana, sedentary lifestyle, excessive straining during defecation, irregular bowel habits. Samprapti, Nidana Sevana, Agni Mandya, Vata Prakopa, Apana Vata Dushti, Malbaddhata, Gutapidana, sphincter spasm, tear in anal canal, and Parikartika. Dosha and Dushya involvement. Predominant dosha Vata Pitta, Dushya, Tavaka, Rakta Masa, स्रोतस पुरुषवह स्रोतस अधिष्ठान गुद. Clinical feature: acute feature, sharp cutting, biting or burning pain during and after defecation. Pain lasts from minutes to hours. Bright streak of blood with stool, marked sphincter spasm. Chronic fissure, deep cone-shaped ulcer, hypertrophied anal papilla at upper end, thick edematous margin, sentinel pile or tag at lower end, scar tissue at base, pain reduced. Bleeding may be drop-wise, secondary infection, pus or mucus discharge. Management: acute conservative, oral analgesic, stool softener, sitz bath, self-dilation, local anesthetic ointment, chronic surgical, posterior anal sphincterectomy, lateral internal sphincterectomy, excision of anal ulcer, fissurectomy, secondary fissure, treatment of underlying cause, Ayurvedic management, local, पिचू, अनुवासन स्नेह बस्ती, स्वेदन, व्रणरोपण, जनरल, वातपित्त शमन चिकित्सा, दीपन पाचन, अनुलोमन, षष्ठी चिकित्सा is required. Thank you.
Thank you, Doctor. Thank you for the well articulated and informative paper and poster presentation. Thank you so much, Doctor. And next we go to the another paper presentation.
Everyone, myself, Dr. Neha Pawar. I am from Dr. B.Y. Patil Ayurvedic College, Pimpri, Pune, Department of Kai Chikitsa. My case report title is Ayurvedic Management of Prameha with special reference to diabetes mellitus type 2. Abstract. A description in Ayurveda text shows marked similarity of Prameha root and type 2 diabetes mellitus. So, 60 years old female patients having complaints chronicity of 5 years for type 2 diabetes mellitus came for consultations in OPD of Ayurveda hospital. By treatment regimen, fasting blood sugar was 157 mg per DL, which was reduced 38 mg per DL, which was reduced to 224 mg per DL after 30 days of treatment. So, significant result was noted on subjective and objective parameters by treatment plan along with Pathya Palan. So, introduction of Prameya is word Prameya is derived from Meyati Sincheti Mutra Vetnasi, which means to extract. It is a common metabolic disorder which is characterized by hyperglycemia due to impaired insulin activity. As per WHO, diabetes is projected to be the seventh leading cause of death in 2030. According to National Diabetes and Diabetic Retinopathy Survey 2021, prevalence rate for diabetes is 9.8% and pre-diabetic is 11.8. Introduction. According to Ayurveda, Prameha is a Tridosha Vadi and is a group of urinary disorders increased in frequency of micturition and output. In modern medicine, its management is carried out by using anti-hyperglycemic agents and insulin disease modifying drugs and use which have side effects, economical and physical also. Over these complications and side effects of type 2 diabetes mellitus, we need to the Ayurvedic management of Prameha. Case study. So basically, a 60 years old male female patients came to the OPD for consultations with chronicity of 5 years for type 2 diabetes mellitus. So patients have complaints of Atisveda Pravritti, Dorbalya, Ubhapadadaha, aggravated since 2 months. Case study. Past history patients have no any complaints of hypertension or no any medications is present. And patients disbelief in allopathic medications and hence was not taking any medications. Here too, patient is taking Kafakar Ahar Sevan, bakery products, meat, eggs, stale food, curds, and use of white sugars or daily use. Sedentary lifestyle patients have clinical findings. Patient shows signs and symptoms. Atisveda Pravritti, Dorbalya, Ubhay Padudaha, so here grade plus 2. Atisveda Pravritti for 2 months, Dorbalya for
since 1 month and Ugrapadaha for since 1 month. Clinical examinations done Ashtavid Pariksha and Dashavid Pariksha. Propulsion Nadi is 78 per minute, Mal Vadka, Mutra normal, Jiva Sam, Shabda normal, Sparsh normal, Druka Prakrit, Akruti Madhyam and weight 66 kg. Dashvid Pariksha Prakriti, Vata Kapah, Vikruti, Kafa Pradhanam Tridoshaj, वय मध्यम सार सहनन and सत्व is him. सातवें आहार शक्ति जरण शक्ति मध्यम and अग्नि is विषय. Therapeutic focus and line of treatment used in patients counseling, निदान परिवर्जन, अग्निदीपन, आम पाचन, त्रिदोष शमन and पथ्य पालन. So वर्ज गुरु अपत्य अपत्य प्रयोजन and कफकर आहार विहार वर्ज. Treatment plan में so here we use shaman chikitsa औषधी कल्प में विजय सारादी काढ़ा each 5 gram काढ़ा 40 ml BD morning and evening with warm water for 1 month. In Kada contain Vijay Sar, Meshishungi, Haridra, Daru Haridra, Pipala, Musta, or Karela powder. Second, Chandra Prabha Bhatti, twice a day, morning and evening with warm water since 1 month. And Sukhasara Bhatti at bedtime with warm water for 1 month. So, Vijay Sar mode of action is regulates insulin production, effectivity remove arm, and prevents overeating, regenerates insulin producing cells. Meshishrungi acts as Deepan, destroys sweet taste, Medhovar, and Kapashama. Haridra acts as Rakta Shodhan, Tvakadoshahara, Shotahara, Deepan, and Grahi Vishabham. Daru Haridra, it is anti-diabetic agent, Ropan, antioxidant and anti-inflammatory properties. Triphala acts as viracher, remove the kapha and pitta. It corrects those to equilibrium and shows anti-hyperglycemic and rasainic. Musta plays an important role in hyperlipidemia and hypoglycemic actions. Carvellia Mehahar helps to treat hyperlipidemia and preservations of isolates of beta cells and their functions improve digestive disorders. Critical analysis of treatment. Chandra Prabhavati improves blood sugar levels, discrete frequency of urination, anti-infective property, and helps in improving metabolism. Sukhasarak assessment, Anulomam. Criteria for assessment. The patient was assessed on subjective and objective parameters. Subjective parameters, Atiset Pravritti and Dorvalya. Objective parameters fasting and postprandial blood sugars before after 16 days and 30 days of treatment regimen. Atisav Pravrutti on day 0 plus 2 grade, day 15 plus 2 and day 13 plus 1. Dorvalya same day 0 plus 2 grade, day 15 plus 1 and day 30 plus 1. Result of objective parameters fasting blood sugar on present day 157 mg per dl. After 15 days 1112 mg per dl and day 13 85 mg per dl. Postprandial blood sugar on present day 298 mg per dl. On 15 day 207 mg per dl and day 13 to 24 mg per dl. Here the lab reports before and after treatment. Discussions. Comment shows similarity type 2 diabetes mellitus described in modern terms to avoid the long-term side effects, complications, or oral hypoglycemic agents and cost-effective treatment of type 2 diabetes mellitus. Move of Ayurvedic medicines for Prameha is required. Pachan, Kokohar, deeper effects of Aushadhi Kalpa showed good result in both subjective and objective parameters of Prameha without any complications or side effects. Conclusion, plants have always been important source of findings new remedies and human diseases. On the basis of this case study, we can consider this approach for further treatment and research work of Prameha. And references is there. Thank you.
Thank you, Doctor. Thank you for the very informative paper presentation. And one more poster presentation is there.
Hello everyone, myself Dr. Riya Pawar. I am from Dr. D.Y. Patil Ayurvedic College, Pimpri, Pune, Department of Chikitsa. My poster topic is Ayurvedic concepts of Amlapitta and its correlations with
gastroesophageal reflux disease. Introduction. Introduction of Amlapitta is a disease described in Ayurveda caused by Pitta dosha and accumulation of Amla guna. Amlapitta has two types, Urdhwaga Amlapitta and Adhog Amlapitta. Urdhwaga Amlapitta shows complaints, heartburn and retching. Adhog Amlapitta shows burning and discomfort. Amlapitta, in modern terms, correlated with gastroesophageal reflux disease. Nidan or etiological factors of Amla, Pitta, intake of spicy, sour, oily foods, viruddha ahar, incompatible food combinations, overeating and late night meals, excessive tea, coffee, alcohol, carbonated drinks, stress, and sleep deprivations. These are the factors of causative factors of Amlapitta. Samprapti or pathology, intake of spicy food, source, food and oily foods and viruddha ahar, pitta doshas present. Amla guna soreness accumulations in our body. So Agni Vikriti and Pachak Pitta's dysfunctions present and then Urdhva or Adhav. Vimarga Gaman is also present. Symptoms of Amlapitta then shows. Amlapitta correlated with gastroesophageal reflux disease, Pitta Prokop and Amla accumulations. Then in this modern gastroesophageal reflux disease, acid reflux or regurgitation of stomach acids. Pitta Amla Udgar, that is bitter, sour, blanching, acidic regurgitations, heartburn, dyspepsia, indigestion, dyspepsia, burning sensation, dyspepsia. Conclusion, Amlapitta is closely resembles gastroesophageal reflux disease. And Ayurvedic management focuses on first in Pitta Shaman, second Am Pachan, Dushit Am Pachan, and third and Grahi, and third is Pitta Pachan and Agni Vardhan. Here is the treatment. So this is the Ayurvedic concepts of Amla Pitta and its correlations with gastroesophageal reflux disease. Thank you.
Thank you, doctor. Thank you for the well informative and well explained presentation. Thank you so much, doctor. And next we go to the another presentation. Next, I'd like to invite Dr. Avinash Sarvasi for the poster presentation on the topic hepatitis B.
Myself, Dr. Ravina Survashi, from PG Scholar, Commonwealth Department from Dr. Patil Ayurvedic Medical College, Pimpri. Today I am presenting poster presentation. My poster title is Hepatitis B. Definition of hepatitis B. Hepatitis B is an infectious disease caused by the hepatitis B virus, which affects the liver. It can cause both acute and chronic infection. Many people have no symptoms during the initial infection. Introduction. Hepatitis B virus is a common viral infection worldwide. Hepatitis B is one of the 5 DNA viruses implicated in the causation of human cancer. It can be transmitted sexually, parentally, or perinatally. HPV and hepatitis C virus causes about 70 to 80% of hepatocellular carcinoma worldwide. 5% of all adult patients and 90% of infant born to the hepatitis B positive mother develops chronic hepatitis. Mode of transmission for hepatitis B. The frequency and pattern of transmission vary worldwide. Sexually transmitted, parental like needle stick injury, contaminated instruments, contaminated blood products, or perinatally. I have demonstrated with hepatitis B virus diagram. It is a DNA virus. Investigations for hepatitis B. Serologically, hepatitis HBsAg, antibody to hepatitis HBcAg, antibody to hepatitis CAG, HBeAg, viral load, HBV DNA can be measured by PCR in the blood. Measurement of viral load is important in monitoring antiviral therapy. Signs and symptoms of hepatitis B: fatigue, fever, muscle aches, loss of appetite, nausea, vomiting, abdominal pain, or general feeling of being unwell. Prevention for hepatitis B. There are various modes for prevention of hepatitis B. Need a healthy lifestyle by use of safe vaccination, personal hygiene, do not piercing the tattoo or questionable places, avoid stress, use sterile syringes, observe the rule of anti-epidemic regime. It is prevented by hepatitis B vaccine. Thank you.
Thank you, Doctor. Thank you for the insightful presentation. Next, I'd like to invite Dr. Pradeep D. Limkar for the paper presentation.
Good evening, everyone. Myself, Dr. Pradeep Limkar, PG scholar, Commerce Department, Dr. Deva College of Ayurveda and Research Center, Pimpri, Pune. Today I am going to present a paper on topic Ayurvedic management of cognitive development delay. It is a case study of an 11-year-old child. Introduction: cognitive developmental delay. Definition: in Ayurveda, cognitive developmental delay is understood as a condition where the individual's cognitive faculties, including buddhi means intellect, interacting qualities, smriti means memory, and di means attention, are impaired or delayed in their development. Ayurvedic terminology: CDD is referred to as buddhi avritti or smriti avritti in Ayurvedic text, indicating a disturbance in the cognitive functions. Importance and objectives. Importance of early intervention. Early identification and intervention are crucial in Ayurvedic management of CDD, as they can significantly impact cognitive development and overall quality of life. By understanding CDD through the lens of Ayurveda, we can explore a more holistic and comprehensive approach to managing these conditions. Objective of Ayurvedic research on CDD: develop Ayurvedic diagnostic criteria, establish standardized diagnostic tools for CDD in Ayurveda, investigate Ayurvedic interventions, examine the efficacy of Ayurvedic treatments such as herbal remedies, panchakarma, and yoga, explore prevention strategies, identify Ayurvedic approaches to prevent or mitigate CDD. Ayurvedic approach to CDD. Ayurveda offers a holistic approach to managing CDD, focusing on dietary modifications, means Ahar Chikitsa, lifestyle adjustments, means Vihar Chikitsa, herbal remedies, means Dravya Chikitsa, Panchakarma therapies, means Shodham Chikitsa, yoga and meditation, means Adhyatma Chikitsa. Case: a female patient of 11 years old reported to Commonwealth OPD of Dr. Deva College of Ayurveda and Research Center, Pimpri, Pune, with following complaints: poor concentration, poor memory, poor scholastic performance, slurred speech, history of developmental delay in walking and speech, history of recurrent blindness. The birth history: it is a full-term normal delivery. Baby cried image after birth weight 2.5 kg, sex female, and there was no NICU stay. History of past illness: at 2 years of age, admitted for diarrhea and fever for 2-3 days. Drug history: received a modern treatment. Family history not significant. Immunization history: all vaccines are given as per age. Developmental history: developmental delay started walking without support at 2 years of age. Speak 2 words at 2 years of age. Speak sentences at 3 years of age. General examination: temperature of febrile, heart rate 86 per minute, respiratory rate 20 per minute, BP 110 and 80 mm of Hg, SpO2 99% on room air. Systemic examination: respiratory system, air entry bilateral equal,
CBS, S1, S2 normal, and central nervous system delayed milestones, and foramen is soft and non-tender. Orthopometry, height is 130 centimeter, weight 19 kg, head circumference 50 centimeter, and mid-arm circumference 17 centimeter. Okay. Panchakarma treatment given. Sarvanga Snehan with Balatil for 20 minutes. Then Sarvanga Sweden by Nadiswed for 20 minutes. Pratimarsanasya by drum wicket. Smritisagara Ras 20 mg tablet, 1 bit. Sarso Adasta 10 ml 3 times a day. Vacha Churna 100 mg Madhu with Madhu 2 times a day. Syrup Jamkal P 5 ml once a day. The above treatment was given for 3 months. The patient followed every month for 6 months. Result post-intervention assessments revealed significant improvements. Cognitive development 3 months gain. Language skills 3 months gain. Social skills improved eye contact. Concentration increased. Conclusion. In the present case study, Ayurvedic regimen and the Panchakarma procedure show a significant effect in the developmental delay. The overall effect of therapy shows improvement in symptoms. There are no adverse reactions found with these drugs. Okay, thank you.
Thank you, doctor. Thank you for the proper structural presentation. I'd like to invite Dr. Swapnil Sudham Kadam for the paper presentation.
Myself, Dr. Swapnil Sudham Kadam, PG second year scholar, Lokhande Department, from College of Ayurveda and Research Center, Nigri, Pune. Today, I am going to present the paper presentation on Ayurvedic management of autism spectrum disorder, case of 6 years old male child. Basically, autism spectrum disorder is a neurodevelopmental disorder that characterized by deficit in social interaction, communication, along with repetitive behavior, hyperactivity, impaired concentration, and sensory processing disturbances. Classical text describes Unmad as the development of mana, buddhi, smriti, and indriyas. In clinical terms, Unmad symptoms include confusion, hallucination, mood swings, erratic behavior, features that develop with modern description of severe psychiatric disorder. Importance and objectives. Importance of early intervention. Early identification and intervention are crucial in Ayurvedic management of ASD, as they can significantly impact cognitive development and overall quality of life. By understanding ASD through the lens of Ayurveda, we can explore a more holistic and comprehensive approach to management this condition. Objectives are examine the efficacy of Ayurvedic treatment such as herbal remedies and panchakarma. Assess involvement in the behavioral and social parameters. To study changes in the communication and adaptive functioning following intervention. Ayurvedic approach to ASD. Ayurveda offers a holistic approach to managing ASD, focusing on Panchakarma therapies, that is Shodhan Chikitsa, and herbal remedies, that is Dravya Chikitsa. Methods. In our OPD, a male patient of 6 years old reported with complaining of distractibility, repetitive behavior, hyperactivity, poor eye contact, lack of social responsiveness, and poor concentration. Then we had taken his basic history, his birth history is absolutely normal, full-term normal delivery. His birth weight was 2.5 kg. There is no history of PNICU stay. His family history is also not so significant with ASD. He had received treatment with occupational and speech therapy for 6 months. Immunization history, he had received all vaccines as per his age, according to National Immunization Schedule. In the developmental history, he started speaking bisyllable words at the age of 1 year, then gradually regression of speech was there. Then we did general examination, systemic examination, and anthropometric examination. And according to Indian Scale for Autism Assessment, we had done assessment and his score shows 146. And then we diagnosed this case with moderate ASD according to Indian Scale for Autism Assessment. And then we plan his treatment with Panchakarma therapy and oral medications. In Panchakarma therapy, we planned Snehan Svedan and Matrabasti. We have planned Sarvanga Snehan with Balatel for 20 minutes, which had shown improvement in Vata Shaman and calming effect. Even Sarvanga Seven with Nadi Svet for 20 minutes is shows improvement in removing scrotal road and improve circulation. Then we had given Matrabasti with Zatamansi 20 ml. It shows in the improvement in control of Vata aggregation in the Majjava Strotas, which nourishes the Majja and improves the behavior. Then, in the oral medication, we had given Bazanmali Churna plus Hingolchali Churna, 250 milligram each, with Madhu or once a day, which helps significantly helps in the Dipan and Pachan. Then we given Mukta, Pishti, Manasmitra Vatakam, and just Jatamansi Churna with Mahapaishachit Mutha, which shows improvement in the Vatapitta Shaman, Nidya, and Manoprasadam. And here we have done basically we have done 3 settings of Panchakarma therapy in 6 months and have follow-up of every 1 month for 1 year. And each setting we have given Panchakarma for 7 days. In the follow-up and results, our post-intervention assessment revealed significant improvement in cognitive development after 3 months of then language skill effect in 3 months, social skill, that is improvement in eye contact, concentration increases, discussion, improvement was observed in eye contact, social interaction, verbal responsiveness, hyperactivity regulation. According to Indian Scale of Autism Assessment, suggested mild severity with positive response to Ayurvedic management. The patient previously, when we assessed that time, he was under moderate ASD, and after treatment, he showed significant results, and a score is in under mild severity, that is mild autism spectrum disorder. No adverse effects were observed during treatment. The case highlights the potential supportive role of Ayurveda in ASD management. Patient is still on oral medication under regular follow-up, and further Panchakarma sessions with supportive therapies are planned. Thank you.
Thank you, doctor. As we come up to the end of today's sessions, I would like to take a moment to express my heartfelt gratitude to everyone who contributed to the success of the first day of the Niramaya 2026 National Seminar Paper and Poster Presentation. Today has been a truly enriching academic experience. We had the opportunity to witness a wide range of presentations that reflected the knowledge, dedication, research aptitude, and innovative thinking of participants from different institutions. Each presentation contributed uniquely to our collective learning and highlighted the growing academic and research potential within the field of Ayurveda. On behalf of Ayurveda, I extend my sincere appreciation to all the presenters who invested their valuable time and effort in preparing and presenting their work. Your enthusiasm for learning, research, and scientific communication has made today's session both meaningful and inspiring. I would also like to express our deepest gratitude to our esteemed panel members. Your expert observations, constructive suggestions, and academic guidance have not only enhanced the quality of today's program, but have also provided valuable directions to our presenters too for their future academic and research endeavors. Your support and commitment have been instrumental in maintaining the academic standards of this seminar. We would also like to thank the principals, professors, head of departments, and faculty members from various Ayurvedic institutions for encouraging and motivating students and scholarly to active participate in this academic initiative. Your continued support strengthens the spirit of research and academic excellence within the Ayurvedic community. A special note of thanks goes to all the participants and attendees who have joined us today. Your active involvement, enthusiasm, and willingness to learn have made this event vibrant and successful. Academic gatherings like Niramaya to become meaningful only through the collective participation and collaboration of dedicated individuals such as yourselves. I would also like to acknowledge the dedicated efforts of the Ayurveda organizing team and volunteers who work tirelessly behind the scene to ensure the smooth conduct of today's program. Every successful event is the result of teamwork, commitment, and countless hours of preparation, and we sincerely appreciate their contributions. As we conclude the first day of Niramaya 2026, let us carry forward the spirit of inquiry, learning, and scientific exchange that has been demonstrated throughout today's sessions. We hope that the knowledge shared today will inspire further research, meaningful discussions, and continued professional growth among all participants. Thank you all once again for being a part of this academic journey. We are grateful for your support, participation, and valuable contributions. We look forward to meet all of you again in the upcoming session. Until then, stay inspired, stay connected, and continue contributing to the advancement of Ayurveda. Thank you all. Thank you so much. Have a pleasant evening, and we look forward to see you tomorrow for another exciting day of presentations at Niramaya 2026. Thank you all.